accepting it, but it's a fact.
Do you have any theory what was happening before? Why wasn't there so many cases in Karnataka? Why this sudden?
I guess one aspect is that the testing has been ramped up massively. So we're testing much more. So obviously cases are there. Number two is that there's some sort of social taboo. So people who are reporting to healthcare centers, they come rather late. So
Might you play the video first?
We are all using. I'm using a temporary room within the conference room.
Good morning and welcome to the final day of this extraordinary 60-hour-long observance of Gratitude Week, a tribute to the health guardians. I am Kamal Narayan, CEO of Integrated Health and Wellbeing Council, a not-for-profit social impact initiative to promote health for all. We began this Marathon Gratitude Week on July 1 on the occasion of National Doctors' Day with an aim to express our collective appreciation for people in the healthcare and allied sectors who are fighting this pandemic from the front. Since ages, the healthcare ecosystem has helped us evolve and transform by sustaining or restoring physical, mental, or emotional health and well-being. While we enjoy the boons of modern healthcare, we forget to appreciate millions of people who work tirelessly to make this reach to all those who are in need. This initiative is just our humble way to highlight the contribution and sacrifices of these often unsung heroes. In the past 6 days, we have seen inspiring words coming in from all sections of society. We heard inspiring stories of doctors, nurses, even the patients who have gone through major treatments, as well as the corona survivors. These were the overwhelming participations. Not only because we got a very encouraging support from everyone, including our viewers who watched this one of its kind event in large numbers, but also we got to hear many moving stories of great resilience and innate desire to serve the society. And we heard them from our doctors to nurses and many healthcare professionals. We also had the honor of receiving key members of our national leadership and lawmakers, such as the Minister of State for Family, Health and Family Welfare, Sri Ashwini Kumar Chaube, Union Minister of Ayush, Sripad Naik, and also senior member of parliaments like Meenakshi Lekhi. We also had eminent healthcare leaders of our country, such as Dr. Randeep Guleria, the director of AIMS, New Delhi, Professor Srinath Reddy, president of PHFI, Professor B.N. Gangadhar of NIMHANS, and many other renowned doctors who have been leading national and global fight against several other diseases such as cancer, heart ailments, stroke, mental health issues, among several others that have been taking a massive toll on our people. Let's have a glimpse of what happened in the last 6 days of this Gratitude Week.
IHW के द्वारा जो ये आपने डॉक्टर्स डे पर चिकित्सा दिवस पर इस कार्यक्रम का आयोजन किया है और जिसमें देख रहा हूं मैं सामने बहुत बड़ी बड़ी हस्तियां और काफी डॉक्टर्स और काफी समाज के ऐसे बुद्धिजीवी ऐसे काफी लोग इससे जुटे और आपके प्रति शुभकामनाएं व्यक्त करता हूं और जो भी आज के इस कालखंड में हम लोग एक दूसरे से जुड़े हैं मैं आप सबको हृदय की गहराई से आप सबके प्रति आभार व्यक्त करता हूं.
Congratulating the Integrated Health and Wellbeing Council for this unique gesture to honor the doctors and other people in the medical community who are the most dependable resources to fight this pandemic. This is also an opportunity to recognize the efforts of those working behind the scene, lab technicians, scientists, pharmaceuticals companies, to mention a few.
There are doctors in the wards, there are nurses in the hospital, there are auxiliary workers. Everyone has put their heart and soul in saving all of us. And whatever little we can do, we must do. And the more we thank them, the more compassion and gratitude comes out.
I would really say the doctors have actually risen to this challenge in this unprecedented times. And that is something which is very heartening, not only in our country, but at a global level.
We use our skills to serve a social purpose. And we deliver competent, committed, and conscientious service, essentially for the welfare of humanity.
We are extremely proud also of the healthcare workers working with us for fighting this pandemic as they have done in the previous few months that we've seen. We've seen that even in the most advanced of countries, health systems have broken down. There has been shortage of equipment, shortage of PPEs, shortage of healthcare staff. But compared to that, India has done really well for itself.
Our public health system needs to be strengthened, and one lesson from this pandemic, if we have to derive it, is to strengthen the primary, the secondary, as well as the tertiary healthcare system.
If are we prepared for next war? Are we prepared for next pandemic? That will be the major issue.
There have been several lessons that we are going to learn, several reassurances that we have already got, and I'm sure all of us have to convey to the public.
Today I am happy, I am proud that I could take care of so many thousands of women to bring happiness and joy to their lives and their families.
Fundamentally, the problem lies with the excessive risk factors, not controlling the risk factors.
First of all, I think I need to take this opportunity to thank the godlike creatures on this earth called doctors. So yeah, real thanks to you guys.
And when you hear a doctor getting infected and still the commitment of the rest of the doctors to continue to go back to work, it just shows what they have trained for and what they're delivering. I think they're nothing short of warriors for us, right? And we should respect them.
But this is one place where everybody unites and understands the value of health and value of healthcare professionals. Normally, this is a profession where you do good and do well. So it's not like any other profession where you can only do well. So this is really a do good, do well profession which separates healthcare from every other profession. So we must learn to thank the healthcare professionals for what they do.
भगवान याद कर रहे हैं, हाथ जोड़कर फरियाद कर रहे हैं, मगर अब चिंता की बात नहीं, क्योंकि डॉक्टर इलाज कर रहे हैं.
तेरी गली मुझको घर मिला, आबोदाना तेरा साथ मेरे हैं ना, ढूंढते तेरा खुदा मुझको घर मिला.
मैं मिल जावा गुल बन के, मैं खिल जावा, इतनी सी है दिल की आरज़ू.
अल्लाह के बंदे हंस दे, अल्लाह के बंदे, अल्लाह के बंदे हंस दे, जो भी हो कल फिर आएगा. तुझको आया या ज़मीन और आसमां आएगा, जो लक्ष्य है तेरा लक्ष्य दो. प्यार दीवाना है.
This gratitude week is to remember and appreciate the massive efforts, hardships, and sacrifices of the millions of health professionals during the last 5 months of this pandemic, which included our doctors, nurses, and all affiliated staff fighting the disease at the front line. Diagnostic labs increased their capacity to test, research organizations and pharma companies taking the challenges of changing the deceptive virus and struggle to find its antidote. We also saw the coronavirus revealed many brighter sides of our collective strength. We saw that both public and private healthcare providers are trying to put up an all-round fight against this pandemic as well as against many other diseases that hampers our people's lives, well-being, and productivity. The 7th day of our Gratitude Week is dedicated for the private healthcare providers of our country who have been bridging the major and most critical gap in our healthcare ecosystem. This day is dedicated to those entrepreneurs, doctors, professionals, and workers who constitute almost 80% of our healthcare delivery in India. We wish to underline that what we see in India having world-class healthcare infrastructure in many parts, though dismally centered to its urban geographies, is an outcome of efforts, dedication, and passion of many of these doctors and entrepreneurs who have taken up the responsibility of building this from scratch. We are hopeful that this pandemic will herald an era of India putting the healthcare first, and all our resources, be it in public or private, will be rallied to achieve a healthier, happier India ready to prevent or combat any future pandemic. With this, I would like to welcome our esteemed guests today, those who represent this grit and resilience of private healthcare sector and are some of the finest contributors of what we see as healthcare infrastructure around us. So let me welcome Dr. Dharminder Nagar, the founder and managing director of Paras Healthcare. He's a doctor turned entrepreneur who is credited to take India's private healthcare to the roads less traveled. He has the unique advantage of being a doctor, hospital administrator, and entrepreneur all in one. Several qualifications that include an MBBS from Mysore Medical College, MPhil from BITS Pilani, MS from London's Imperial College, and MBA from Harvard, and more importantly, the passion to serve the people, have propelled Dr. Nagar to the forefront of India's healthcare leadership. Under his guidance, Paras Healthcare has emerged as an hallmark of quality and affordable healthcare. Beginning from Gurgaon in 2014, Paras Healthcare has now taken the world-class healthcare facilities to many unserved parts of our country, including Patna, Darbhanga, Ranchi, Panchkula, and Udaipur. He has several national and international awards to his credit. Welcome Dr. Dharminder Nagar on this Gratitude Week, and we look forward to hear some really encouraging and insightful stories from your side, that how have you been contributing to India's healthcare system. Let me also welcome Dr. Harish Pillai. He is the Group CEO of Aster India, Aster DM Healthcare. A healthcare professional with exceptional leadership skills, Dr. Pillai has worked as the CEO of Egypt's biggest private tertiary care hospital as Salam International Hospital in Cairo. He completed his MBBS from Kasturba Medical College in Bangalore and started his career with Apollo Hospitals Group. He is also MBA in International Hospital and Healthcare Management from the Frankfurt School of Finance and Management in Germany. He is considered as one of the most influential leaders in the Indian healthcare industry and is the convener of various healthcare panel of Confederation of Indian Industries, CII, Kerala State Council. Aster DM Healthcare is the largest healthcare provider in Gulf region and a leading player in India too. So welcome Dr. Pillai on this show. Let me also welcome Dr. Dinesh Batra. He is the co-founder of director of Ujala Cygnus Healthcare Services and is regarded as a well-known healthcare management expert with over 30 years of experience in the industry. He has actively participated in healthcare projects in tribal areas, providing free dialysis to patients and free education to the underprivileged. He is MBBS and Master of Surgery and was the CEO of Delhi's Primus Specialty Hospital for over 14 years. Under his leadership, Ujala Cygnus continues to bring quality and affordable healthcare to the unserved and underserved areas of India, including Delhi, Haryana, Uttar Pradesh, and Uttarakhand. With its chain of 12 state-of-the-art hospitals, Ujala Cygnus has also been appreciated for its wonderful contribution under the Ayushman Bharat scheme. Thank you so much, Dr. Batra, for joining us this morning on the 7th day of Gratitude Week. So let me begin this session before, without much delay. And I would request Dr. Dharminder Nagar to give his opening remark and let us know that how he has been trying and his Paras Healthcare has been trying to bridge this critical gap of healthcare in our society where diseases are definitely universal, but healthcare is not. Dr. Nagar.
Good morning, everyone. Thank you so much, Kamal, for inviting me at this platform. You've done such an amazing job in this time of crisis and need. You've helped buck up each and every healthcare provider, healthcare worker, and I think this Gratitude Week definitely will help us as healthcare providers to keep us motivated, keep going at it, and working even harder for society. The question you've raised regarding accessibility, and I think that has been the conundrum for Indian healthcare. We simultaneously claim that we are world-class in our healthcare provisions, and we are. But that is in patches, that is for certain areas, that is within certain geographies. You will notice that as soon as you leave a metro city, the healthcare moves from world-class to non-existent. Let's not even call it a class, it is a non-existent. There is huge regional discrepancies. As you would notice, Harish, who manages healthcare in south of India and west of India, there is immensely different healthcare provision between south and north, between east and west. The gap in Indian healthcare is not Indian healthcare alone, gap is regional as well. And I think the challenge is to create a healthcare enterprise or healthcare system which takes care of these regional imbalances as well. I particularly work in North India, Paras Healthcare works in North India, and North India is within India much behind in healthcare provision, at least in tier 2, tier 3 cities. When we started Paras Healthcare, now more than a decade and a half ago, we always thought that we'll provide excellent quality healthcare for the middle classes. Although our first hospital was in Gurgaon, there was a huge gap in accessibility within Gurgaon. There was never a super specialist healthcare provision in Gurgaon when I started Gurgaon. In retrospect, now it is, I perhaps would like to say that it's too much of healthcare provision in one's city, but at that time, there wasn't any provision. We decided to move to Bihar. Again, I mean, there was actually non-existent healthcare. There was some government sector, there was some private sector, but on a super specialty level, under one roof, healthcare was missing. And we started Darbhanga, we started Udaipur. But these are very, I must confess, this is just tip of the iceberg. I mean, I haven't even completed 1% of the gap. I mean, my provision, Paras Healthcare's provision in these areas does not cater for 95% of the population yet. There needs to be hundreds of Paras Healthcares in north of India to enable healthcare accessibility, which is quality driven, which is value for money, which is for middle classes, hopefully for all classes. Hundreds of hospitals are required. When I say hospitals are required, government loves to talk about beds, ventilators. Nowadays, ventilators is the main thing, so they love to talk about ventilators, all these kinds of gadgets and beds and infrastructure. Healthcare is not about beds. Healthcare is not about buildings. Healthcare is not even about ventilators. Healthcare is the man behind the machine. Healthcare is about soft nursing care, clinical care, training of those people. And I think that is the gap, which is even worse. When we say there are no hospitals, I feel that it is easy to create the infrastructure, but the human capital is completely missing. I hope during these COVID crisis, one thing society in general may have realized, that healthcare is the most important thing for a nation, for society, and for the world as a whole. This COVID crisis, as finally we, some of us are clinicians, doctors, healthcare providers, are at least in one way, slight sense of pride and happiness has come in that, oh, finally people in society have recognized that nothing moves without healthcare provision. The whole world can shut down, but we will continue to work. We will continue to provide services. Everybody can go home and shut their doors. Healthcare cannot afford to shut their doors. We will not shut our doors. We will always work. We will always provide, and we will always care.
Thank you so much, Dr. Nagar. The important thing you said that healthcare is not about buildings and then the ventilators or beds. And we have seen that situation also emerging in our country where bed, ventilator and infrastructure were put in place, but there were no one to care. And the care is the most important aspect of healthcare. So let me go to Dr. Harish to take you said about his massive work in the southern part of this country. And before I come back to Dr. Batra, who is serving a very, very different aspect of our North Indian landscape. So Dr. Harish Pillai, how your Aster DM Healthcare is contributing to bridge those gaps which we see in our healthcare for decades, and how you are playing an important role also during this time of pandemic. However, we do appreciate and we believe that healthcare infrastructure is not only evaluated as per the performance in pandemic, because what you people are doing and managing on day-to-day basis is much larger a piece and a burden on humanity than the pandemic itself. So Dr. Harish Pillai, your view about Aster DM's contribution and how you envision to make India's healthcare system not only world-class, but equitable to all.
So thank you, Kamal, and I also echo the same sentiments of Dharmender about the fantastic work which you have done. Many times it's very difficult to read the newspaper. I don't watch television at all. I don't watch any news channel because why spoil your mental health? So since many years, I don't watch any TV. So I'm kind of relaxed because I don't watch any news. But still, I'm one of those old-fashioned people who still like the smell of newspapers. So I still read my newspaper or a morning cup of tea. And sometimes it breaks your heart to see healthcare workers around the country being traumatized, sometimes for no fault of theirs. So I guess this is a wake-up call, collective wake-up call for our country that when you talk about strategic sectors, right, we usually talk about defense. Thanks to the Chinese at Ladakh, it's always the headline news. But we never talk about healthcare as a strategic subject. So my hope is that there will be a pre-COVID India and a post-COVID India. A post-COVID India where I feel that every politician worth his salt across the country will have healthcare as a main point in his manifesto. And I'm sure that the constituents of our country, wherever they are, they will demand healthcare as a fundamental right. When Dharmender talked about this regional disparities, it's very true that South India, when you come to some parts of South India, you don't feel like you're in India. I consider India as the United States of India because it's fascinating. Not just linguistic differences, cultural and ethnic differences, but there is clear-cut macroeconomic differences. Like one of my favorite terms in economics is the Gini coefficient, which talks about equity in society. So to give you an example from a state where we are one of the largest players as the state of Kerala, the Gini coefficient there is unlike any other state in India because the whole state is one urbanized network. You can call it from north to south, Kerala is one urban state. And you don't have village from the traditional North Indian description of a village at all in Kerala. You'll never find that. Why is it like that? It's just that from a socio-political point of view, right from early 1950s, like 1957 to be precise, the state democratically elected a communist government to power. When Nehruji was the prime minister, we had EMS Nambudripad, the communist leader of CPM, elected as the chief minister of the state. So from a left of center ideological perspective, there has been a huge focus of sustained investment in social sectors, education and healthcare. So with the result of multi-decade, so in Kerala, every 5 years, the party will change. I mean, that's how the people vote. So irrespective whether it's the communists or the Congress coming to power, the investments in social sectors have been sustained over a period of time. And fascinating that because the high literacy level, 100% literacy level, the reverse sex ratio, the female literacy level is so high. Therefore, you are blessed with some of the best macro health indicators, not just in India, but probably among OECD countries. That's the state of, and this pandemic has really shown that if you really invest in your public health system, especially your primary care, it will pay dividends long term for society overall. And so that, I think, is one big take home, that when I talk about post-COVID India, I hope that the citizens of this country and the political class will wake up that they need to consider health sector as a strategic sector. And one number which I always plead in all public forum is we need to ramp up our investments to 5% of GDP, both at national level and state level, to bring up a certain level of equity in the healthcare model. I don't think society is sustainable if there is such a big gap in accessibility. Your question to all of us today is that how do you address this disparity in accessibility? And I think it's the most ultimate form of cruelty when your barriers of your economic disposition of birth prevents you from accessing quality healthcare. Then there's something wrong in society. So that is why I feel that states across the country need to invest much more in their public health system. And Dr. Dharmendra made an important point that we can't be prisoners of the past. The earlier, I mean, thankfully now the Medical Council of India has been reformed to the National Medical Commission. But earlier it was kind of bizarre that we got fossilized in time. It was based on the British GMC system. GMC has evolved. If you look at the GMC structure, you have stakeholders from the community to whom you're producing doctors to actually be in part of the governance system of GMC, not the Medical Council of India, which we had before. But it's good that the powers that be has made some critical transformation in the past 7 years, I would say. So to list a few of them, I'm pretty excited about this transformation in the regulatory mechanism for education, mainly the NMC. I think that will double the capacity of professionals in the sector. And Dr. Dharmendra's point is quite valid. It's the soft skills, the human resources in the supply chain, which will enable sustainability of the sector. So I think these kind of reformations which is brought in will take us in the right direction in the next 10 years time. It's a decade vision what the country has above it, to double the number of graduates and postgraduate doctors, to bring the disparity, to eliminate the disparity between MCI trained doctors and the National Board of Exams, the DNB cadre in the country. And that was an artificially created disparity. Now it's no longer there. I think the reformations taking place in the nursing council is also important. To, we are now pretty excited to bring in a cadre of nurse practitioners, specialty nurses. In select disciplines, the nurses can also be like barefoot doctors of China, for example. They're also allowed to prescribe. So I think that's pretty good. The Healthcare Council of India has also done phenomenal work in developing a plethora of skilling programs where you can, when you deconstruct most of our work, it's all repetitive tasks. So repetitive tasks could be handed over to a skilled healthcare worker who is in huge demand, especially in the context of a pandemic. Like many of us who are trying to manage, to provide, continue to provide service in a pandemic situation. What is the challenge? What we're facing is, for example, home care, quarantine. You have this COVID care centers where people are under quarantine, and you need healthcare workers to look after them. So you're talking about an army of phlebotomists. You need to have those, those technicians who are in short supply across India. And people are willing to pay premium, but you're not even able to get a nurse. So that's kind of challenge which we're facing in terms of the human resources part. I'm also very delighted about, there is a controversy and debate about it, probably for the right thing, but the fact that the Clinical Establishment Act has been rolled out across different parts of India, I think it's a good thing that there is a grievance addressal mechanism for the common citizen, that if they have a grievance against the healthcare system or the provider, how do you go and approach the system for taking care of their norms? So I think it also brings about a minimum assured quality of care. So that's one of the core principles of the Clinical Establishment Act. The Big Bang reformation which I can reflect upon is, of course, Ayushman Bharat. You know, the point which I made earlier about economic disparity, I think the intent of the government to create Ayushman Bharat is highly laudable. We can talk about it that, you know, there are critics who talk about that it's not a perfect system, but I look at it from a different point of view, that the intent and the idea is wonderful. But at the same time, the sectoral investments making for curative and therapeutic medicine should not rob away the required investments in primary care and also public health systems, which I talked about before. So there has to be a balanced approach between sustained investments in primary and public health, and also in into the world's largest insurance network like Ayushman Bharat. Something which is also a collateral benefit about Ayushman Bharat is the government of India is right now able to get data from across the country because it's backed with a very good digital backbone. You're able to understand disease patterns across the country, mostly in NCDs. You're able to see consumption patterns. You're able to look at pricing patterns. So all this data which is being collected at the central level, I think it will help us to have targeted and precision policy. When I talked about the United States of India, actually India at a political level is based on the districts. So when you consider the district, the disparities between the various districts of India is something which we can address, because clearly there are some districts which are in the red zone. They have not just healthcare, they have nothing. So it's a bit of a shock when you go to those districts. So you can't afford to have that kind of a situation, especially from a national point of view. As concerned citizens, we all aspire that our country truly gets its place in the committee of, if we aspire to be a superpower, the superpower is not a definition of your political, strategic, or your military strength. It's also a reflection of your social standing and human developmental index. So I think that's what my dream of post-COVID India is going to be. Talking about Aster, we are spread across 5 states, 13 hospitals, mostly in South India, Kerala, Karnataka, Andhra, Telangana, and we have a presence in Maharashtra. So we have tried our best to extend services not only from the hospital side. We have leveraged on technology quite a bit, because in the initial stage when the Prime Minister announced about the Janta curfew, there was a lot of anxiety prevalent among citizens about COVID type of symptoms, and most of our doctors and institutions got jammed up with calls. So we looked at launching an AI-based app which will answer most of the questions of the citizens. So that was the first initiative which we did. We quickly moved on to the telemedicine platform in terms of e-consult services. We are extremely grateful for the Government of India and the National Medical Commission to bring out those guidelines on teleconsultation, which is much needed for a country of our size. And I really believe that technology would be a key bridge to overcome the human resources gap what we have in this country. Third aspect is home care, what we talked about. I think home care is something which was there only in urban centers, but I think there is a great role for home care in semi-rural areas, in tier 3, tier 4 cities, and also in rural areas. I think that's very important. Fintech plays a key role, because that's something thanks to the push by the Government of India in promoting digital finance, whether you have your Beam app or others. So I think fintech also has removed some of the bottlenecks which COVID-related issues created in the system. So in our own way, we have tried to look at it. The last point, addressing Dr. Dharmender's point, is what can we do to increase the pipeline for human resources? So we are also working with the Healthcare Skill Council to have nursing care assistants, for example, because at this point of time, all hospitals require an army of nurses and nursing care assistants. So critical care assistants or nursing assistants So we are trying to ramp up that program across our network hospitals. So I hope this answers your question. Thank you.
Oh, thank you so much, Dr. Pillai. You very well highlighted the multiple aspects which are playing a role and are actually bringing out the kind of outcome which we saw during this pandemic. And thankfully, despite all those hiccups initially, India is doing fairly better than other countries in the world. But it's still I think a big fight and a long fight. Let's see how we are able to continue to put up this kind of response to the pandemic and the other areas. Dr. Batra, Dr. Pillai talked about this geographical discrepancies which we see in our healthcare. The kind of area you are serving to is very unique. We don't have even this geographical discrepancies from Delhi to Darbhanga, or maybe from let's say Kochi to or maybe I'll not take Kerala as an example, because Kerala has a much better health infrastructure, but maybe maybe Hyderabad to Guntur. But you see the same large metropolitan metros like Delhi, where you see a South Delhi may be having a much more concentration of healthcare, and maybe the East Delhi or the the peripheries of Delhi may not have that kind of healthcare system. And in the time of critical care or emergency, maybe to reach to a right hospital within the city itself, a person may have to travel for 2 hours, which is equivalent to traveling almost 100 kilometers. And you have tried to provide healthcare in those areas, and also in those areas which are the satellites of large metros, like your hospitals are a lot in Haryana as well. How do you see this geographical discrepancies, and what are the unique need of these areas, and how you are addressing that problem, and how you have been building hospitals which can provide this essential, critical, tertiary care and secondary care to the people who need, and in time within their access.
Thank you, Kamal, for this wonderful opportunity to be part of a panel where eminent people like Dr. Dharmender Nagar and Harish Pillai are there. And Dr. Nagar, very frankly, has been a source of inspiration for all of us. He was one of the pioneers who started work in Gurgaon when nobody thought that the kind of hospital he's making in Gurgaon will be able to survive. And going from there, he has taken healthcare to the areas which are far from imagination for most of the people in terrains of Bihar and other places. And simultaneously, I must compliment you for the kind of week you have celebrated and the other activities this organization is doing. And best wishes from me and Ujala Healthcare for these activities. As far as gratitude to the doctors are concerned, that's a tremendous transformation in last 4 or 5 months, for about 30, 40 years in existence in healthcare. Actually, those people who started the career in 80s and they decided to become doctor in 60s or 70s, they actually got so much of disappointment while they came into the actual stuff of service. And they found the very reason because they became doctor has actually vanished from the scene of service. So the whole thing got totally commercialized. And so there was huge frustration and disappointment. And at the same time, that probably was one of the reasons of starting something what we did 10 years back in the name of Cygnus Medicare. But this whole issue of COVID has turned the whole thing upside down. It has brought back doctors into glory. And probably we have started feeling proud again. And if you see, there's something to do with the mindset of certain people in society, the mindset which forces a particular person to choose a profession like becoming a soldier in army. And I used to think that the soldiers, when they decide to become an army man, probably they are trained and they are prepared to lose their life. While doctors are not trained that way. But despite that fact, in the last 4 or 5 months, we have very clearly seen the kind of devotion which is unimaginable. Everybody salutes this profession and the people who have actually sacrificed their lives, and many of them are still struggling to survive. So with that thing, I want to start the topic which you have given, that the geographical discrepancy in North India and India as a whole. And if you see 70 years of existence post-independence, and where we should have been in healthcare and where we are, actually see about, if you go back to 10 years, let's say in early 2000, you would be surprised to see the most of peripheral areas at district level or beyond district, tier 2 or tier 3 towns, lack the emergency services other than maternity. So if you see 3, 4 major situations, emergency areas, like if a person has a heart attack, if a person has trauma, if a person needs any medical intensive care because of any reason, maybe it is respiratory distress, maybe it is poisoning, maybe it is any other reason which require intensive care, this guy was shunted off from that village or block or tehsil or a district and advised to go to a state capital, maybe in our case Chandigarh, Delhi, Patna, Jaipur, etc. And even from those the state capitals, they would ultimately fly to places like Delhi. And I remember, as Dr. Dharmender was telling about a north-south gap, many years back, even for a CABG, North Indian people, even from places like Delhi, used to travel to South India for getting a bypass surgery done. So that is the kind of disparity we had. And that is the kind of disparity which existed in North India till 10 years back. At that point of time, few of us, Dr. Nagar is here, and the Cygnus also studied this evolution very closely. And we found out that whatever tertiary or quaternary care which exists in this country is still limited to metropolitan cities, at least throughout the country. But if you go slightly beyond, if you start, even today, if you see the tertiary care, it is at a low level in state capitals. There are many state capitals which do not even have an organ transplant facility even today. So that is the kind of gap. So going beyond a state capital in district centers, even today we are struggling to provide low tertiary care. So that is the kind of situation where we are in. Look at and it's not only accessibility. If you ask me, what is the reason of accessibility not being filled in 70 years, I'll straight away tell 2 major reasons. One is the affordability issues of the public, which did not allow private sector to grow in those areas. And second, inability of our political system to invest in healthcare. And as we are still struggling to invest less than 2% of GDP in healthcare, and Harish has rightly said that it should be at least 5%. So there are these two major reasons that we couldn't develop the accessibility in peripheral towns. This government particularly has done a wonderful job by addressing the affordability issue by means of Ayushman Bharat, which still is in a nascent stage, which still lacks awareness in the peripheral towns. But I think this will go a very long way in improving the accessibility. So we had been talking about let's say 60, 70 years that doctors are not there, nurses are not there, and that's the reason of inaccessibility. But now things will dramatically change because of affordability issue has been taken care of. Accessibility will definitely follow. And of course, the quality accessibility will still have to wait for some more time, but it will definitely follow that also. And Ayushman is very particular about taking care of quality issues from day one. So keeping these things in mind, about 10 years back in 2011, we decided to sort of do whatever we could do. And so we started opening these hospitals in peripheral town like Sonipat, Panipat, Karnal, Kurukshetra, Kathal. Then now we have one in Kashipur, the second in Kashipur, Varanasi, and a few peripheral areas of Delhi. As you rightly said, geography of Delhi is very heterogeneous. The peripheral areas of Delhi are as bad as Haryana. The moment you move out of Delhi, as Dr. Dharmender said, there is non-existent healthcare. While we opened the first hospital in Sonipat, we found out that most of the clinics or nursing homes would close down at 7, 8 p.m. And if any emergency lands up even in a hospital, private hospital, he will be politely told that doctor is not here, take this patient to Delhi, because they understand that beyond 7, the kind of emergencies which will land up, they'll not be able to tackle them because they don't have the specialists or super specialists. So they'll politely refer those patients to. So that was the condition 8 to 10 years back in places as close to Delhi as 20 kilometers. So there was non-existent healthcare. There are a lot of work which has happened in last 10 years, but still we need to wrap up this very fast. And I would say there are many private players need to join hands together. For example, there are 3 people sitting here, and there I'm sure many more who can work together and create something very meaningful in a very short span of time. That's what I feel.
Thank you so much, Dr. Batra, for highlighting, and then you highlighted some of very important point. One thing which you mentioned about that, the people who started their, let's say, medical practices around or career around in 80s and saw that the scenario has changed dramatically. You mentioned about commercialization, but apart from commercialization, what of late, we have been seeing, and I belong to little, I think the later generation. So we are also seeing a lot of distrust. And I would like to go to Dr. Dharmender Nagar, that the increasing distrust which is happening both from the society side and also many times being highlighted or aggravated or maybe extended further from the government side by the media. How do you see that, when there was a time which I heard from our seniors only, that there was a time when doctor or civil surgeon used to be respected like the district magistrate or the superintendent of police in a society. Now the trust and the respect for the doctors have got a severe beating. How do you see that this challenge of getting more resources, more human resources, more doctors, more nurses, more paramedics joining in in a society? And I'm talking a little bit of before COVID-19 time also, and also within COVID-19, where society sometime also end up distrusting and sometimes even bashing up their medical professionals for something which is maybe a alleged or a perceived negligence, or maybe just not living up to your inflated expectations.
I think this trust issue is a multifaceted one. If we try to answer this just with one go, that we can resolve this trust issue in one go, it will not happen. As medical professionals, we have to realize that people come to us in times of stress and unhappiness. It existed before, but expectation 30, 40 years ago from a doctor were very, very minimal. So if you went to a doctor, you went to your local practitioner, if you survived, wonderful. If it didn't survive, that was the expectation. Now the expectation has been mixed with financial issues as well. So the perception of society in general is healthcare should be free. That is the expectation. I don't and should not pay for healthcare services. If I'm paying for healthcare services, it is a majburi. It is because somebody is kind of cheating me out of something. And God forbid, if there is a negative result, post my admission, post paying, let's say 4 lakh rupees, then obviously somebody has to be held accountable. Whether it is justified, whether there was a medical negligence or any sort of negligence, it does not matter. Because I spent 4 lakh rupees and I expected 100% outcome, I should get the result. And if I haven't got the result, somebody is at fault. In this, our professionals and we ourselves are also at fault. We in India, our counseling skills as clinicians, as hospitals are very, very low. We do not sensitize the patients for negative outcomes. I think I practiced briefly in England, and the only thing I realized is that the counseling skills of ours did not even exist. Any doctor abroad will take you through the positives, negatives, probable outcomes, and we don't spend enough time doing that. So it's a financial issue. It's a training issue from clinical side. And how do we bridge it? I think bridging is going to be a long haul. I see that when patient is not paying out of pocket, somebody else is paying, his natural inclination to complain always comes out. So how do we ensure through Ayushman Bharat or through medical insurance that society pays out of pocket at the minimal level? We don't ask the patient to bring out wads of cash. Ki ji, ye 1 lakh rupees hai, please do my surgery. I think insurance, whether public or private, is the need of the hour. And if as healthcare providers, we have to grow, we have to sustain, and we have to build trust, I think we should all make sure that society is moving in that direction.
Thank you, Dr. Nagar. So you are of opinion that the financial distress which comes along with the the healthcare distress is many times driving or pushing people to kind of lose respect or trust to the healthcare system, because I think the innate feeling is that they should not pay. Dr. Harish Pillai, and this is the last comment, Dr. Pillai and Dr. Batra, I'll be coming after him to you. We are getting to the closure of this session. Dr. Pillai, you said that you are kind of dreaming about an India which is 5% of GDP being spent on healthcare. People should not be paying from their pocket, and you also want that every politician should be having the first agenda item should be that they will provide healthcare. But when Dr. Nagar says that any person and every person who is coming to the hospital is having a feeling that I should not pay for health, how do you see that? Is it matching with that? Because if as a citizen of this country, I believe that healthcare is most important and I should not be paying for that, do I really go and vote for that? So how do you see that happening?
So, Kamal, it's a very complex question what you have asked. It takes me back to the famous quote of Rajiv Gandhi, our former Prime Minister, when he said that "1 रुपया जो दिल्ली से निकलता है, वो जब जमीन तक पहुंचता है, it is 10 पैसा. तो जो 90 पैसा, it just disappears in the system, right? So the biggest problem, it's a cultural issue which we as Indians need to acknowledge, is corruption in our society. There's something wrong with us. This popular term of jugaad, no? Sab kuch chalta hai. I think it's time to put a full stop कि सब कुछ ऐसा ही चलेगा तो कुछ होगा ही नहीं. So there is something we have to do soul searching, that why are we always trying for jugaad, like trying to short? We don't want to stand in a queue. हम लोग the old days, of course, nowadays nobody, I mean, thanks to streaming platforms is different, but we are not even disciplined enough to stand in a queue to see a cinema. We have the ticket black mein milta hai na. So that kind of culture, it's a cultural issue which we face. So coming to your question is that if there is an efficient management of limited resources, it can be done. See, that's why I gave you the first example of, you have to look at the district level. We talk about the Indian Administrative Service, right? The so-called the steel framework of India. But there are good IAS officers, there are average guys, and there are terrible guys. I know of so many districts where there are phenomenal IAS officers. Because of that individual officer's presence, the healthcare system is just transformed dramatically. But if that unfortunate soul has been transferred out due to some other reason, that's it. It's going back. So we have a problem in terms of also insulating our systems, our governance systems. I have also talked in public forums that why is India not having a central cadre for managing health? The Dr. Batra ne bhi bola tha pehle that most public hospitals, the senior most doctor, right? The senior most doctors made the medical director or the medical superintendent. That's a culture in India. Now, it doesn't mean that a very senior clinician who is very good in clinical medicine is also a good manager who can manage limited resources at his disposal. So there is a systemic issue. Why are we not having a cadre? I give an example of France. France has got giant public hospitals, which is like 1,500 to 2,000 bed size. But the director of the hospital is always a professional who comes from a public school. You need to have like an equivalent of an MBA, and very young professionals managing such large systems. I feel there is an employment opportunity in our country to professionalize the management of public hospitals in the country. So that is something else what we have to do. The expectations, what you talked about consumers. So that's also, I guess that the distrust which happened is also when that economic transaction took place, I guess there's a mismatch in expectations. If you are fond of old Hindi cinema, we always find that the Dr. Kaka or the Dr. Nana holding that bag, he's always there. The friend, philosopher, advisor to the family in Hindi cinema is the doctor, Dr. Chacha. But you always find that when the Dr. Chacha does his stuff and goes back, unko fees dene ka hai. So fees is, obviously there's a financial transaction. So I guess the entire difference in expectations came somewhere in 80s. I would say mid 80s is when this transformation and expectations changed for the society. But like Dr. Dharmendra said that I feel that in the next 5 to 8 years time, this out-of-pocket expenditure part will come down, either through public financing like Ayushman Bharat, or private insurance will step in, or there would be a hybrid model where employers, whoever, whether you're in formal or the informal sector, the employer will also pitch in to give some kind of a health coverage. So that's a way forward. It's very clear that out-of-pocket expenditure is definitely going to come down. Doctors, we also have to do some soul searching. Like one excellent example from India is the National Cancer Grid. The National Cancer Grid is, I'm sure there will be a case study which will be done where they have looked at the objective evidence-based treatment of cancers around the world. Like in the old days, we had few eminent doctors who were considered to be the godfathers for medicine. But the National Cancer Grid is basically a data-driven algorithm where whichever part of India you are, there is a scientific objective pathway for treatment of cancers. The big collateral benefit is the cost of care has dramatically come down, and those kind of acquisitions, people, because of information asymmetry, you always find that there's an adverse outcome, the doctors to be blamed. So the National Cancer Grid has actually thrown all these things out of the equation. So the corollary which I'm trying to say is that the same objective application which took place at the National Cancer Grid can be applied for many other non-communicable diseases, whether it's coronary artery disease, whether it's orthopedics, neurosciences. So if you do that, and we have the technical, intellectual ability and also the science behind it. So it's just a matter of time when data-driven treatment of diseases will actually remove this kind of misconceptions which are there in the minds of patients or their family members.
Thank you so much, Dr. Pillai. Your point is well, taken, and I think definitely in the coming 5-6 years we should be seeing a very, very different India, and this pandemic will trigger some that change as well. Dr. Batra, a quick remark from your side. You are contributing immensely on Ayushman Bharat, one of the I think most talked about, appreciated scheme across the board. But we at the same time also see a lot of apathy from the government sector to the private sector of healthcare, especially from the lawmakers and from the regulators and all that. How do you see this relationship going forward, especially when they have also realized in time of COVID-19 that government alone cannot provide the healthcare to this massive country, is, either out of pandemic or during the time of pandemic. So do you see that this is going to change completely the relationship between these two very, very important partner going forward? Dr. Batra, are you on mute, I think, Dr. Batra?
Yeah, that's very true, actually. The biggest catalyst for this change is actually Ayushman. And although there are a lot of apprehension still in the mind of many healthcare players, particularly private healthcare players, and actually it has to be understood that this scheme actually is designed for all those healthcare service providers who are providing service in peripheral towns. And the objections coming are mainly from those corporates who are providing services in metropolitan towns. So that has to be very clear. And actually, this is going to not only increase the accessibility and affordability issue, and this scheme actually has to ultimately transform the trust deficit also. And this trust deficit, which exists between patients and society on one side and doctors on the other side, as Dr. Dharmender has rightly said, this is directly linked to the payment out of pocket. As we progress and evolve towards a stage where less and less people are paying out of pocket, this problem will go down, and we see the trust deficit almost non-existent in Ayushman patients. And so because they are not paying anything, they do not have, and their ticket size is so big that all their diseases are covered for a year. So insurance patient still cribs because of he's worried about his ticket size. But as far as Ayushman is concerned, that issue does not exist. And going forward, this will be a major bridge between the service providers on private side and the government side. And if finally government decides to be a uniform third-party payer, the role of it takes over the role of a payer rather than a service provider, it will go a very long way if they allow private healthcare to work as a quality service provider, and they transform themselves into a maybe some kind of preventive and the wellness side of it, and they take care of the diseases like pandemics and other stuff, the awareness part and the root cause of all those issues, and dedicate themselves more towards research and innovations, then probably leave the service part and the service provider part to the private sector, and where the patient has to pay less and less. Even today, about 60% of population does not have to pay out of pocket, because around 40 to 50% comes under the Ayushman, around 6, 7, 8% comes under insurance, and rest comes under some or the other kind of employee scheme, for example, ESI, CGHS, ECHS, etc. I want to, in the last, I'm sure you're getting short of time. In the last sentence, I want to utilize this opportunity actually to emphasize a point that actually government should, why there is a need of running a ESI scheme separately. I have a very, very strong reservation on running a ESI scheme separately, CGHS, ECHS separately. All these schemes actually should be, without any delay, merged into Ayushman. ESI running a medical college makes no sense. It's an insurance company, for that matter. ESI is an insurance company. They are sitting on a corpus of 50,000 crores. They're not paying people on time, and still they are opening medical colleges. They are spending money in infrastructure. Let the private sector spend money in infrastructure. Let the private sector provide services. And all these, they should increase the base of Ayushman, do work on a better pricing and on quality. That's the last comment I wanted.
Thank you so much, Dr. Batra, Dr. Harish, and Dr. Nagar, for your wonderful work which you people are doing at every stage of this healthcare requirement, and have been serving the society, to the people at areas where it was non-existent. And I believe that when the private sector can now be allowed to make rockets and go to space. At least this part can be very well given to them to manage it, and government become a more of a supporting partner than the provider itself, and takes care that the healthcare is reaching to everyone on an equitable manner. With this, I would like to also bring into your knowledge that as you know, and many of your colleagues and your team members are fighting on the front line of corona pandemic, and some of them have also lost their lives. And we are making a demand to the government of India to set up a gratitude memorial for all these corona warriors who have either sacrificed their lives or are serving on the front line, risking their lives, their well-being every day. So to respect and to remember their contribution, their hardships, and also to make a bold statement, and to remembrance to the society also, that health comes first, and we as a society must be very, very particular about that. We have requested the government to set up this gratitude memorial. I'll request my team to quickly play that video for the benefit of our audience as well as you. And I'm requesting our audience also, they can go and sign the petition on change.org. The link for that is also available on the chat box of this live show. And this movement, and we believe that as war memorials, a memorial for health will make our society be aware and more concerned about the issues related to health. Video. So much. So thank you so much, our esteemed panelists today. We are moving on to our next session, and my colleague Anisa Nair Dhawan will be taking care of. Will be moderating the next session. We have a lineup of esteemed healthcare providers from across the country for the next session. But before I sign out, I would request my team. We have created, and since we have most of the doctors who are contributing to our health for ages and for during this pandemic, ISW Council has created a small anthem in reverence and respect to them. I'll request my team to play that, and post that the session is over to you, Anisha, to take it forward. Thank you so much, Dr. Dinesh Batra, Dr. Harish Pillai, and Dr. Dharminder Nagar for your wonderful work, your contribution. We are really, really thankful for whatever you people are doing for the health of this country. Thank you so much.
Thank you, Kamal. Thank you for the opportunity.
Hi, my name is Padamjit Shelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया. Thank you.
Gratitude Week. I'm Anisha Nair Dhawan. From the 1st to 7th of July, we have been celebrating the Gratitude Week, an initiative of the Integrated Health and Wellbeing Council to bring everybody together to show a never seen before emotional and social support to our doctors, nurses, and the entire healthcare ecosystem. During this Thanksgiving marathon, it is our endeavor to thank our healthcare heroes for a whole week and carry this gratitude in our hearts forever. Now, over the last week, we have spoken to a multitude of healthcare professionals, doctors, paramedics, hospital administrators, and senior executives of pharmaceutical companies. Through their narration, we have understood about the exemplary work being done by them during this corona pandemic. This has given the public a true picture of the heroic efforts put in by the medics. A heartfelt thank you is the overwhelming feeling that we hope will go through this gratitude week and will hit millions of people across our country. Now, while the corona pandemic has brought our healthcare ecosystem together to fight the unseen enemy, there are still upteen instances of fault finding, criticism, and sometimes even coercive action against hospitals. The topic of this discussion that we're going to have now is why more brickbats than bouquets in running a hospital? For this discussion, we are joined by, and please welcome, Dr. Atul Kapoor, Managing Director, Regency Healthcare, Dr. Shujan Bajaj, Founder and Director, Ujjwala Signals Hospital, and Dr. Mayank Somani, Managing Director and CEO of Apollo Medics Super Specialty Hospitals, Lucknow. Welcome to this discussion, gentlemen. Thank you so much for being with us at in the Gratitude Week. It's great to have you with us. Mr. Bajaj, let me start with you. You have been running hospitals now. What is your experience in running the hospitals? Do you get more of gratitude and thanks, or do you get more of brickbats?
Thank you very much, Anisha. It's good to see you again. And namaskar, Dr. Kapoor. Hello, sir. How are you? Good to see you again. So thank you once again for having us on board this Gratitude Week. Lovely concept, and it's drawing to a close today. So it's a bit of a mixed emotions for us, happy and sad, as happens in all hospitals, I think. We've been running hospitals in small towns of North India for the last 8-9 years now, and see, the mismatch between expectations and delivery is more pronounced when a person or a patient has to pay from his or her own pocket. That is the big gap between the expected outcomes and the real outcomes. The patient really feels that he or she should not be made to pay for any medical services. That is ingrained in the mind of everybody, that medical services have to be charitable. Doctors are supposed not to, ask for any money. And if there is any money being asked, that for sure means that there is some cheating going on and somebody is fleecing somebody if there is any exchange of money. And once I have given some money, then of course I have to be very sure that there has to be no adverse outcome. It cannot be that I paid 50,000 rupees and then the doctor tells me that, oh, I'm sorry, we could really cure you of your illness. So the more we move towards a model where the patient does not have to pay out of pocket, I think the lesser these big bats will become. Of course, there are a lot of bouquets in this whole venture. Otherwise, we would not be doing it. I would not have left Delhi and gone to these small towns if there were no bouquets. There are a lot of bouquets, of course, because we provide services which are not existent in those small towns. We are the only ones who are providing these services. And as you know, we are the largest provider of Ayushman services as an organization. Ayushman itself is a wonderful scheme because there is no out-of-pocket expense involved. There is a lot of stress on quality, lot of stress on accountability. You can't have low quality services or unaccountable services in Ayushman models. That is where we get a lot of bouquets, not just from the patients, but from the policymakers as well, from the lawmakers as well, from other organizations as well. But I think the brickbats are only few and far between, and the bouquets more than compensate for those. On a daily basis, we get a lot of pleasure, a lot of happiness from treating our patients. One particular incident that I can tell you about was when this whole COVID pandemic hit us hard and our OPDs fell drastically. We started a telemedicine solution for our patients. And last month, we made more than 35,000 teleconsultations. And all of our patients were so thankful to us, saying that this is a wonderful model. We were wondering how we will go to the hospital, how we will talk to our doctors. Our blood sugars are not controlled. And every telemedicine consult that we did, and it was not just in our own geographies, we did telemedicine consults as far as Bombay, as far as Chennai, Africa, the US, and we got a lot of bouquets on Twitter as well for that people were very appreciative that we were reaching out to such a large geography. So it's a mix of both, of course, Anisha, but the bouquet is far, far more than the big bags.
Dr. Atam Kapoor, what has been your experience? Dr. Bajaj just told us that it's a mix, and he really appreciates the good words that his patients have to give to doctors who have treated many of the patients. How do you see this entire situation? Do you see the glass half full or half empty?
See, Anisha, it's a mixed bag of things, He said that Dr. Bajaj said that we have bouquets and big bats both. See, the problem is that now I'm running this industry for the last 25 to 27 years, 27 years to be in fact. And we have 6 facilities now, 5 in Kanpur, 1 in Lucknow. Going forward, the biggest problem what Dr. Bajaj analyzed was the payment part. The patient has to pay from his pocket. So nobody wants to pay for a health service. People want to pay for big fat marriages. They'll pay for big fat jewelry. They'll pay for anything. They want to have big cars, but they don't want to pay for health. And that's across. The people who have big cars will come to you for a discount. That is where you start laughing. That this guy can afford 10 Mercedes cars, but he'll come for a discount because he feels pleasure in that the doctor should be working for free or for lesser amount. See, understand that as an industry, even the government at times sometimes says that no, we are overcharging, he's overcharging, and she's overcharging, and they are looting the public. The media will come out that we're looting the public and we are charging high for implants and all those things. Understand, where does it come from? First of all, we have a debt to service. The loans that we take has to be repaid back to the banks. The huge debt service, a huge capex, as well as all the doctors will agree with me. There's a huge talent cost. You have to good doctors, you have to pay them high. People equate a doctor of a government service, let's say, who's getting a lakh of a salary, but our intervention radiologists will be getting about 10 lakhs. See, the talent cost is huge. And how does that money come back to the system? You're running a company to make some money, or let's say service the debt, or service the society and make something in the bottom line. Investors are there. Then, government gives no relief, no tax relief. You pay tax like ordinary people. There's no GST relief. We keep on, all of us will understand huge amount of GST that we are paying to the government. We get no input whatsoever because health is not taxable. So even if it was taxable 1% GST, at least I would recover crores and crores of rupees, the GST that we pay to also, housekeeping staff, security, machinery. So now see, we are caught in two angles. First of all, a huge debt, a huge capex. Investors working with us, they want a certain EBITDA. We have to work on that direction also. Cost has to be taken care of. Plus the, let us say the talent cost. Combined together, the cost of treatment has to be not at a government level. People have to pay for it. Ultimately, and when you want something good, you pay for it. You go to the best resort in the world, you spend 50,000 rupees for a room. So, because you want it. Here, people think, in fact, Dr. Dharmendra Nagar also said just now, that out of majburi, it is a majburi. And they don't want to pay for a majburi. Health is not majburi. Health is everything that a person can, basically have. The best health is the best what a person can have. So seeing going forward, the bouquets come from all kinds. For example, in the world, eight police people shot by an outlaw. 7 of them injured with gunshot injuries all over their abdomen were admitted in my hospital. So in Kanpur. So we treated them. They all absolutely fine. They'll be discharged in 3-4 days time. So that gives us happiness that, and government was also appreciative at that point of time when the CM came to visit the hospital and all the ADGs and everybody and DGPs and all. So they were praising us that, did a great job, you saved my policeman. So those are the bouquets you get, and bouquets you get from every single angle. Any patient who goes well gives us bouquets. But brickbats come only primarily because of the financial cost that patient has to pay. And the cost obviously is derived from the cost that we have to incur to maintain that setup.
Right. Dr. Somani, both our previous speakers have underlined the fact that people are complaining because they are unwillingly having to pay for medical services. But even those who go to public hospitals complain. They're not paying, but they complain, it's dirty, doctor doesn't see me. Their list is also very long. So what's the problem? You criticize the private service providers, you criticize the public service providers. Are Indian patients not possible to please at all?
Yes, Anisha, Dr. Kapoor, Dr. Bajaj. See, I'll answer your question that, people, their expectations of the services versus what is being delivered, that gap is significant, both at public as well as private. So that is what, that gap, if it can be filled in their own minds or the service provider fills that, that's the only two ways it can be handled. So that's where you go to a public sector hospital, and people are still complaining because they think that if they have brought their patient, they should get adequately treated. And the definition of that adequate is always a question mark. We don't know what's their expectation. So the expectations have to be set right before we are able to, so the satisfaction question will be defined eventually once we define what's the right expectation. And that's applicable both in private as well as in public. And Anisha, just quickly, I was told by Kamal to present, to share the thoughts through a slideshow. So let me know,
Yes, please go ahead, Dr. Somani.
no,
Please.
but I don't want to take the time of everybody else. So I was prepared as a slideshow, and Kamal said that this is the last part where there will be an interactive session. But if you want to go ahead with the interactive, I'm also okay with that. The choice is yours, but there is.
All right, Dr. Somani, then let's just have a discussion first, and then we'll go through your presentation once everybody has.
That's only on the brickbats and bouquet and the concept behind that. So let me know, but otherwise we are happy to just interact as well.
Sure. Dr. Bajaj just spoke about the Ayushman Bharat scheme. Because of insurance coverage, criticism is lower. Is this then the way out? Because you may give insurance cover, people may or may not pay their premium, the government may pay or somebody else may pay, or you may pay out of your pocket. But if your infrastructure is not going to be enough to meet the needs of the large population, will the criticism go away?
Say it again.
Very good. Sorry.
Okay.
Dr. Bajaj, the question.
All right.
Yeah. So that's a very important point that you raised, Anisha, and it ties back to the last point that you had raised, that it's not just the private hospitals that are facing criticism, it's also the public hospitals where actually there is no out-of-pocket payment involved, but still there is a lot of criticism happening. So there is obviously no one magic bullet for everything. You can't just say that, okay, if the payment goes away, then everything will be hunky-dory, because we have to understand what is the issue with the public hospitals. It's not the quality of services, I feel. We've all been trained in public hospitals. I think the quality of service there, the quality of doctors there is far superior maybe to most private hospitals, not just but the problem is that there is no communication. The associated staff does not take care of the patients as they are meant to, I think. If you go to a private hospital, the nurses and the general duty assistants would be doing almost 95% of the work. Whereas in a public hospital, all that work will be done by the doctors themselves. And thus they have no time to communicate, to walk the patient through the journey, to make them understand what exactly is going on. And this opacity in the entire transaction makes the patient uncomfortable, makes the patient doubt the intentions of the doctors. And when an adverse event unfortunately happens, the reaction of the patients is generally that we were never told about this, we were never told that our patient is serious, and how did the patient just suddenly die, and now you're coming and telling us the patient is no more. And that is when all hell breaks loose. So this communication is also needed. So we need to have a system where the quality and the work ethics of the private hospitals are transferred into a system where there is no out-of-pocket payment. Universal insurance is a good way to do it, but we know that that is also not the real solution, because if you have only insurance, then still the incentives of the doctor and the patient stay misaligned, right? If you have an insurance, the incentives of Dr. Kapoor and myself and organizations like ours, Dr. Mayank's organization, is that you fall sick, you have a heart attack, you come to our organization, we'll put a stent into you and we'll charge money from the government or the insurance payer, and you'll be fine, you don't need to pay, but still you've had a heart attack, right? There is no incentive for you for us to counsel you not to have that heart attack. So the real solution lies a long way ahead. We need a paradigm shift in the entire healthcare ecosystem where there is no payment at the point of care. If there is no exchange of money at the point of care, you can never doubt the intentions of the doctor, right? Because right now you go to hell if you do, and you go to hell if you don't. So things like cardiology and obstetrics are the most affected by this. You do a cesarean, patient says you did it because you wanted the surgery money. You don't do it and something happens to the baby, then you're stuck because the patient will be like, doctor रात को आए नहीं और अब देखो अब ये बच्चे को हमारे ये सब हो गया. Same with cardiology. You put in a stent, तो patient is like, अरे जबरदस्ती डाल दिया, कुछ था ही नहीं, गैस की शिकायत थी और इन्होंने तो देखो stent डाल दिया इनके पास ले. And you don't do it and something happens to the patient, you are stuck again that patient complicated ho gaya and he's having CPR going on because you didn't put in the stent in time. So if there is no point of exchange payment there, that you are not paid for per stent, or you rather paid for an outcome based, that how many in the district are healthy, or how many of your patients circle that has been coming to you are healthier, I think then the patient will not doubt it, right? Because you're not being paid for the stent, you're being paid for the patient outcome, that the patient is healthy, the patient survives, the death rate goes down, or all these things. So it is a long way away, but I think universal insurance is something that we should definitely start out with. It should be compulsory. If you can afford to have insurance for a scooter or a motorcycle or a car before you get onto it and drive out into the city, I think you should definitely be made to be responsible for your own life. It is much more expensive than a scooter or a car that you buy your insurance for. So a personal health insurance, I think, has to be a compulsory thing for each and every citizen. And of course, you can top it up as much as you want to put in all the bells and whistles that you need later.
Right. Dr. Somani, as Ms. Bajaj said, that insurance is a good way out to reduce the angst. But I'm still trying to understand, why has this perception come about that private hospitals are profiteering at the cost of the health of people? Now, we heard Dr. Atul talk about the cost private hospitals have to incur to run their hospitals and give the service that they do. So they have to recover the cost. But everybody just says, oh, they got free government land, and look at the amount of money that they're taking from patients. This is exploitation. Where has this belief come from? If it really wasn't the minimum costs required for payment, why do people feel that there is exploitation?
Right. Anisha, what I'll do is I'll quickly put on the slides, and it has all the answers which you are seeking, and it has a base to it as well. So I'll quickly do that. And then can you see the slides?
Yes, I can see them.
Yeah, so that's how, I'll quickly, so this is just what I was told to, So, and just, I'll quickly take 10 minutes and I'll rush through it, because now the premise of the whole conversation is interactive rather than a presentation. And I would not like to take too much time of Dr. Bajaj and Dr. Kapoor, so I'll rush through it as well. If you look at the journey of a doctor, at 12th class, what do you think is the mental ability or aspiration of a 12th standard guy, 17, 18 years of age? What are we expecting? Is he looking at a philanthropic life? This is the answer to your question. That once somebody decides at the point of 12th class that he's going to become a doctor, he's not looking at a philanthropic life, which everybody's expecting him to deliver, because he's not supposed to charge anything. Are you with me with this?
Yes, definitely.
This is no, the aspiration is largely that you have a concept that there will be a financial stability in life, and you will get some respect. And that's why a person becomes a doctor. Then you do graduation, post-graduation, specialization, super specialization, and more super specialization. Take 18 to 20 years to become a doctor. And what are you looking at? Respect, finance, peace of mind. And look at these two guys, they're top, and they didn't study as much as any doctor, a regular doctor reads. And look at them, where they have become. What have they become? The amount of respect, the amount of money, the amount amount of stability in life, and anybody can recognize these guys. And even if the smaller photographs, if you look at, even a very small Nadella, somebody who's just at the bottom of what he would become, is also very happy and satisfied, content that, okay, he works, he gets respect, and then there's a stability in life. But what a doctor, after 20 years of hard work and with few lakhs of earning, is labeled as, in today's times, thief. Everybody thinks that a doctor is stealing. Conceptually, we are defeated already. Now look at the whole premise. India spends 1.2% of the GDP on healthcare, which is lowest in the world. Heavy disease burden, and health expenditure per person is also the lowest. Public versus private healthcare. Now this is the paradox here. If you see, public healthcare, both rural, urban, is lesser than private healthcare, and also the amount of money spent is also more on private healthcare. And why is that? I mean, who's forcing anybody to come to the private healthcare? Private healthcare or people charging will die on its own if everybody goes to public healthcare. Don't bother about private. If there's no demand, there's no supply. So what is it? Why is the paradox? Because there is no nearby complete facility. People like Dr. Bajaj, Dr. Kapoor have created brilliant facilities for people who needed it, And then there is inconvenient facility timings. People are not available at night. There's healthcare personnel availability is a big question mark. You may not get the doctor you desire. Then there are the long waiting times, and the quality of care is question mark. Now, what's happening? We are the #1 healthcare provider exporters, Doctors and nurses go out, they don't stay here. Why again? I mean, if there's a great infrastructure, if a doctor is supposedly to be noble, then treat them like one, make their lives easier, keep them here. Why are they even going out? And that's my personal journey. I've done, been largely into academics, and then I thought that I'll create a hospital. Why? And Kamal specifically asked me, you created a hospital, and why do you feel that there are more big bats or bouquet or vice versa? So this is the answer. There's a family perspective to it. There's a risk aversion. Don't take the risk. You're happy, you're educated, you're stable. Why do you even do it? So if it ain't broken, why fix it? Was the question which my family asked. And then and Dr. Kapoor just mentioned, that there is an investment, then there's a design and build. You build the hospital, then there's a clear infrastructure, and then there's an approval matrix which you have to go through. And all of that is a difficult proposition. It's not easy. So, there's an expectation reality mismatch from the investors. There's a reluctant toward local institutional investors. And there's a completely convoluted healthcare finance medium. They don't understand that it's a capital intensive, long gestation. And then you get a land, and then there's land mafia, sand mafia you get into. Then there's an infrastructure to establish, it takes its own time. And then there is an approval matrix where approval to start the hospital, approval to run the hospital. There's so many challenges. And then you end up running the hospital. And then what happens is suddenly, private healthcare is already deemed expensive. It's labeled already in the whole mindset because nobody wants to spend money on health. You can go to a 5-star, you can go to you can go to Hawaii, but as soon as you have to spend 600 rupees for a consult, you have a problem. So this is the mindset which has to change, if at all. And then there's a zero tolerance for untoward outcomes. You're paying. Once you've paid, that means you've bought life. No, that's not possible. We are not gods. So somebody needs to understand this. And then there's a gross unacceptability of cost overruns. We're not making a room. We're treating a patient. We seriously have no clue. We give an estimate, I can remove your gallbladder. Suppose it's complicated, there would be a cost overrun. But people are not accepting it at all. We can't really always guesstimate right. And then resorting to violence is such a common. Making a bill is like a crime. I mean, you treat, you're fine. You make a bill, oh man, you're a criminal. So what do you do with this mindset? Asking for money is evil because you are noble. And I'll come to this noble part again. So, and then this is the part where you're running the hospital, and from the perspective of the patients, then you have a staff and team pressure as well. Running the finances or the regular day-to-day. Here there is investor expectation. There's a family expectation as well. They are also on your head that you don't give us enough time. And then there's self-expectation. I want to do something else, but I couldn't. So, you always are under pressure. And then media. Typecasting is such a common practice, a perpetual fall guy. Don't even listen to doctors' perspective. As soon as somebody complains that we did not get the right deal, you are in trouble. So there's a biased narrative for sensationalism, so-called TRP. And if you look at violence against doctors, 75% of doctors in India have faced violence at some point of time. And it's everywhere, wards, OPD, emergency, everywhere. So what are the key triggers? Long wait for appointment, investigations, overcrowding, delay in patient care, but largely these are just triggers. They want an opportunity to just shout because they are spending money. So why is it? What's the concept? And that's something which is ingrained in all of us. Like, doctors are not supposed to charge money. And that's the basic concept. And that's where your answer to your question is, that why is it even happening? It's happening because everybody is very clear that we do not want to pay. And and the concept that doctors it's a noble profession, it's a philanthropic profession. Everybody who's getting into it should not charge, should not take money, and just continue with the philanthropy. And then there's a fragile ecosystem. I'll just skip that. And the fear which is palpable. Doctors feel stressed in their profession, are scared and hiring security. So what would doctors submit? Have faith and take an unfiltered narrative. Understand from us as well that where are we coming from? And Dr. Kapoor very clearly mentioned, there's so much expectation. We need to bridge that gap of understanding that why people are even paying. And doctors don't make a huge amount of money. Please be, most people think that once you're a doctor, you're making money. You're not. Look at the IT industry and various other industries where people are really, and this is again the same. And are we leaving behind a legacy? It's a dark chapter now. I don't think that, most people are shying away from becoming a doctor. My own daughter, I have one daughter, and now she is doing her computer science in Berkeley. We both her parents are doctors. There's just so much of overlay, so much of influence which was possible, but the influence was negative. No, a lot of people ask me this, so you don't think that there's any gratitude? There is nothing? No. The case is that we get 98% of the times gratitude, lots of it. And I'm very happy, and that's what keeps me going as well. And most doctors, and Dr. Kapoor and Dr. Bajaj and everybody else, whoever is there. Why? Because see, what happens is that we get it on a daily basis. There's a daily dose of gratitude coming. And then there's a 2% people who are dissatisfied and cause disharmony, discontentment, anger, violence. But trust me, that 98% of gratitude which I get gives me only 2% of my life, because one media, exposure, so-called exposure or coverage, it kills my 3 months of life. There's a media, there's a paper, there are people shouting, there are videos, there are social media, and everybody is grabbing only the headlines. I do a very difficult neurosurgery. I get hardly, 1 or 2 likes on my Facebook. And somebody else puts that so-and-so hospital, there's a violence, you get 1 lakh likes already. So why? Why is it like that? So the whole concept, it's not that, we don't get love. We're very happy with the work which we do. Unfortunately, it only becomes 2% of our life. The 98% of the times, I'm just managing people's discontentment and dissatisfaction. 1% out of the 500 OPDs start shouting in the OPD. I'm managing him for next 5 hours, not attending the OPD only. So the doctor is the labeled noble guy, and everybody else is the self-proclaimed judge who tells how a doctor has to behave, and that's where the whole problem is. And this whole nobility is great. I mean, I'm very happy to, you know, very happy to make people understand, or anybody, if you think it's novel, then everybody should come together and make everybody feel novel as well, right? Like, for example, an army personnel has his own whole life chalked out. A doctor doesn't. If you tell me that my life will be chalked out forever, I get all these facilities, everything, then it's more sought after. But we have to make first we have to make our own education, then we have to make our own lives, we have to make our own clinic. We don't get any support from the government. It's not that I'm paying commercial rent for the place, I'm paying commercial rent for the electricity, water, everything. So why is it that even expected that there will not be a certain cost, and the cost control is there, but there's a mismatch in people's expectation versus the cost. And Anisha, I can read at your face that have gone longer than what you wanted, but where, the whole concept has to be understood as to what is it, what's wrong with us,
I think what is wrong with us is that all of us have become so materialistic that whatever is deemed free, our health, our good health, the air we breathe, all these, because they're free, they're worthless. This is the problem. Nobody realizes the value of their health till they fall sick. But, it was free. And then they had to pay money, and then all the discomfort started. Dr. Kapoor, we heard Mr. Somani gave us an entire snapshot of, how somebody goes through setting up a private hospital, and, what is the urge and what is their motivation, and then what really happens. In our country, there is a huge demand-supply gap in healthcare facilities, healthcare infrastructure. The government is very slow, but because there is a market, private people are coming up, private hospitals are coming up. Do you see this as an ongoing opportunity, or do you think that there will be a little hesitation in setting up private hospitals if this is the feedback that you get, if these are the day-to-day problems you're going to face? Dr. Kapoor will request you to please unmute yourself. You're on mute now.
Just a moment.
Yes.
Fine?
Yes.
Anisha, sorry. Well, things have changed in the last 4 months, 5 months, to be honest. And the healthcare industry has gone to, troubled times, primarily because the huge CapEx cost and the huge salaries had to be taken care of in corona times when the business was hardly 15%. Now, this 4 months has given a deep stress to the entire industry all over the country. I'm very sure about it. So all the healthcare providers now are on a common platform for the thought process. For next 1 or 2 years or 3 years, I don't think that anybody would like to invest in healthcare, keeping in mind the stress that has gone through in the last 4 months, and keeping in mind that the loss of revenue plus the expenditure is, see, ultimately I tell you that normally in any good hospital, about in a good corporate hospital, the salaries component is about 47 to 46% in a good hospital of the whole revenue. Now understand that when I get 15% of the revenue, how can I pay 40% or 47% of salaries? But again, because we are here for the last 25, 26, 7 years, we continue to do that. Plus all the government regulations of COVID, providing all kinds of protection to the doctors, to the people, and to the staff, like PPE, and creating huge isolation tents. We have created huge isolation tents of 5,000 square feet where social distancing is being practiced because hospitals don't have that much space what the government wants. Now, all that costs huge to all of us. And then after that, all kinds of controls are there. Now you can't charge this much, you can't charge this much for the ICU, you can't charge this much. You expect the doctors to work in COVID times, put their health to risk, and then again not charge also. So then they can live their lives because they're noble people. They can give their lives also and not charge anything. Now there the government steps in, no, there's a market cap, there's a price cap. Although honestly speaking, in UP at least I know that the government has done 90% of the COVID work and private sector has hardly done 5 or 10%. Fortunately for us that they have not pressurized us. They talked to us that we should create a COVID facility and we should do something more for that. The pressure comes not from me or not from any doctor, not from the public. Pressure comes from the VIPs in the system, our so-called, let us say, the rich people of the city, or maybe the politicians, as well as the senior officers, that God forsaken, if something happened to them, where do they go? So Dr. Kapoor creates something of this kind. You must have, because you're the leader. Fine, all right. But where do I get the doctors to work on that? Again, I have to insure them also. See, a simple insurance for a particular person in private sector for 50 lakh, let's say, who works in COVID facility, Dr. Bajaj would know, and I think Mayank also knows, it's a huge cost. How can I risk my people who are working in the last so many years to go through a COVID facility and then not charge for it also? So what do I do? And again, if God forsaken some patient is found positive, the whole system will hound on the patient. They'll make him feel like a criminal instead of empathy and sympathy that you have a COVID, you get all right, don't worry. The whole system, the police and the medical departments, 5 ambulances and so many people will take you away and they'll carry you away as a criminal, and then the family is taken away. That all has deterred the private sector to come forward for COVID facility treatment. Why? Because all of my doctors say that, look, if something happens and something does happen to me, what happens to my family? Nobody's worried on that point, that what happens to their family. So ultimately, Mayank said the same thing, Dr. Bajaj has the same view, that the cost, the people have to understand there's a cost, they have to pay for it. No system in the world is where it is free. Believe me, Ayushman is doing good work, all right. But anywhere in US also, something comes from the pocket. And unless a patient spends something from his pocket, he does not value the treatment. Believe me, you hold a free camp anywhere, he pays nothing for it. But paper is you'll throw in the dustbin. But if he pays even 50 rupees, 40 rupees, 25 rupees of registration, he'll keep that paper properly. So everything free is also not possible. You have to mix. Government can do much more. And if the government does do much more, I'm sure there'll be less scope for private sector. But then the gap is huge. Mayank said just now 28% and 72%. Those figures even I didn't know. I thought it was about 70-30. But anyway, closely, if the places where there are government setups, let's say Lucknow. Lucknow's got good government setups. SGPGI is there, KGMC is there, they're doing good treatment. So scope for private sector is limited there because they are doing a lot of high-end treatment for which we also look up to them to get professionals from those institutes. But in smaller places, believe me, there's a wide gap. And that is why entire 3 cities, the private sector has a great future as compared to metros where they're only overcrowded. But people have to pay.
Right. Dr. Bajaj, I've been a news reporter and I have seen that for healthcare listed hospitals, investors line up to buy stake. If there is a problem, if stake is available, whatever be the reason, they line up because they believe there is a market, an untapped market. And if Indians are not paying, there are many foreigners who come to Indian hospitals to get treated. They do pay, right? So where will that thrust come from? Investors seem willing, despite the day-to-day challenges hospitals face themselves. Will they be pushing forward just because of the size of the market and getting more people? Just by setting up new private hospitals, will we solve the problem? Where will we get the manpower from? Because there are only as many doctors. What is going to, like Dr. Kapoor said, that there may be some hesitation because the last 4 months have been tough. But, for a long-term player who's looking at 5-10 years, what will be the thrust? Will it be a private person's personal aspiration to serve the society? Will it be investors who see good returns because, there is an unmet demand? What will bring the thrust for, the private system to go forward from here? Because the brickbats are many.
Yeah, so investors are definitely interested because they see the wide gap in availability that Dr. Kapoor was also telling us about. There are only a very few cities where the public sector stands up and gets counted amongst the best hospitals of the city. Most of the other places, the budget of the public facilities are 10 to 100x of what the budgets of those private hospitals are. But as Dr. Sumani pointed out, 80% of the facilities are being provided by the private players. You travel across North India, town to town, city to city, you'll see every city has the same situation. You'll find a large civil hospital spread across acres of land, and the budgets of that hospital will be running into hundreds of crores of rupees a year. The salaries of doctors and staff will be much higher than what the private players are affording. And after 2 o'clock, I don't think you'll find even a single soul there. There you'll find just one doctor sitting in the emergency, referring patients to the nearest big city continuously, refer to Lucknow, refer to Chandigarh, refer to Delhi. That is all is being done there. It's a very sad state of affairs. And we have this misconception in our mind that everything is free. Nothing is free, right? As Dr. Kapoor said, nothing is free anywhere in the world. So the public healthcare system is paid. It's like a prepaid system. It's paid upfront by the taxes that all of us pay. And the per bed cost, if you can work out. So we did a lot of exercises with the Delhi government, just trying to analyze what exactly is the average cost per bed in a government hospital. So most of the private hospitals that you see, their average revenue per occupied beds would be ranging from 10,000 to a very small center that is running in a small town to say 30, 35,000 in a big center, or in a multi-speciality center that Dr. Mayank or Dr. Kapoor may be running. It's unimaginable what is the cost per bed in a Delhi government or a state government hospital. It runs to almost 80,000 rupees per bed if you include all the costs. So we are paying taxes to run those hospitals at 80,000 rupees per bed. The private sector is charging 15,000 or 10,000 or 20,000, and still we feel that private hospitals are more expensive. Whereas in reality, if you see it, they are 1/4 the cost. So investors are definitely interested because they see this value that private sector is providing high quality healthcare at very low costs compared to the rest of the world. The problem is we compare within India, but if you go anywhere in the world, I don't think you can find this quality at this price. And I'm saying anywhere. It's not just Europe or US. Go anywhere in the world, you will not find this quality at this price. These qualified doctors, this qualified staff, this high-end equipment, all the outcomes that you see, we have better outcomes than most countries in the world, whatever you can count on. So the investors are interested because of that. The problem is, if you now go to the market, and as all capitalists will tell you that market is the best judge of everything, and unlike us semi-socialists who are still in the romantic mode of providing free healthcare and charitable healthcare to people, if you see the markets, take the top 100 companies of India, you will not find even one healthcare provider. You will find a lot of pharma companies, you will find a lot of laboratories, which are actually connected to the whole ecosystem, but you will not find any hospital or healthcare providers. So we should understand what exactly is going on, where exactly the gaps are. The investors will be very happy if they come in and actually get worth for what is being provided, rather than, as Dr. Sumani and Dr. Kapoor mentioned, doctors being labeled as thieves or as extorting people, when actually the cost of service is much higher. The cost of lives, you see the number of healthcare professionals that are falling in this battle, and they're taking their families into the battle with them. So each and everyone in their family is at risk, because we are going to the hospital treating patients. I treat COVID patients myself. I've been posted in COVID duties because one of my physicians, when they fall sick or they go into their quarantine period, I am the Stepney of the organization going around. So I would ask anybody who wants to challenge this cost factor to come and do duties in the wards. What cost are you willing to take? You don't need to be a doctor. Just come in and help us doctors doing the file work, or just talking to patients, or counseling them, or doing some paperwork. It's very easy to say it. How many people have you seen going into COVID wards and actually
volunteering
their work? So there is a lot of things to be taken care of. I think a lot of thoughts to be considered before we start this labeling process of various people.
Right. So, this is a big reason why the IHW Council has come up with the Gratitude Week, because we just take it for granted. We take our good health for granted, and at times when we do fall sick, everybody's to blame. The entire healthcare system is to blame. We never appreciate the good work being done by them and how they help us to lead a healthy life. So So this is our attempt to make people notice, but I'm sure this isn't going to happen overnight. So Dr. Somani, what is your solution to this? How do you increase engagement? Like a lot of marketers say, how do you increase engagement, improve outcomes, meet expectations? Is it just better communications? How do you think the situation improves, Dr. Somani?
I think Dr. Somani is not there.
I think he's got disconnected. So I'll ask you, Dr. Kapoor, same question. What is the way out? How can we improve, perhaps engagement with patients, make them appreciate the hard work being done and the risk to outcomes? You're doing your best, but this is the risk. So how do you improve that?
One thing more I'll add, Himani, which I forgot to say when I was speaking. That by far, people call doctors thieves, whatever. You talk to any banker, they say that doctors are the best paymasters for all the loans. Doctors are very weak that way. So they will never default on any bank dues. They will never default on any money to owe to the institutions and investors. So that is why investors bank them. And banks also say that doctors are the best paymasters because they have a reputation at stake. You see, that image of a god, and then suddenly, the god becoming a defaulter, just impossible. It doesn't go together. So that at that point of time, they always see that, we are in the right books here, the right papers, we are always protected. So half the time their life goes in this only, that image to be maintained, what to wear, what not to wear, where to go. Doctor Sahab, you go to a shop, you buy something like an ordinary person, I'm not expected to be there. Doctor Sahab, saman khareed rahe? These things of which the public has a different opinion about doctors. They are not human beings. Not running into a normal human life. But yes, what is important, which was told by Dr. Nagar also just a few minutes back, that engagement in a way that counseling the patient, spending that much time and giving patients to tell the pros and cons, the good and the bad about every illness may improve the relationship to a large role to play. That for God's sake, you have to pay if you get some services. Is all over the world, you travel business class for the same flight, you give, let us say, 1.5, 2 lakh rupees ticket. Somebody is traveling at 30,000 rupees in the same flight. So why you pay business class? So ultimately, there's a cost involved. People must be sensitized that healthcare is not cheap. Healthcare is costly. The drugs are costly. The pharmacy is costly. Everything combines as a treatment. It's not only the doctor who's getting everything out of it, or the hospital getting everything out of it. Connection by way of counseling to the patients, having more counseling centers. I've got a couple of counseling people in every hospital now. So they counsel the patient before treatment. That does make a difference, that this is the cost you have to pay and it may exceed also. So doctors don't have that time. What Dr. Bajaj said is right, that in government setup, who has the time to talk all these things? In private sector, we can afford people, we can afford counselors, we can afford PCCs to connect with the patient, counsel them. And I think 90% of the problems are solved once you counsel the patients properly.
Right. Dr. Bajaj, you were extolling the virtues of insurance. Now, what is the way forward for improved, healthcare coverage by insurance? Because of COVID, a lot of people have started buying insurance because this epidemic has put health in the center of everything. Does this mean that a few years from now, we will have fewer dissatisfied people because they will be not paying out of their pockets and getting better services? Because, like Dr. Kapoor was saying, there may not be an increase in supply happening immediately because of these tough 4 months. But like 2 to 5 years from now, does it get better?
So, Anisha, see, as I told you, insurance is not the magic bullet at all, and it's not like that people will become more satisfied if they have insurance. See, the incentives of both the doctors and the patients have to be aligned, and the patients have to realize that the doctors are not doing something just for the money or just because they're greedy for something, right? This is what they have to realize. So US has like 90% insurance penetration. Do you think people are satisfied there? It has the highest rates of litigation on doctors. Patients will go and sue you in a minute. because of the fact that again there is point of exchange of the transaction is at the point of care, and this transaction we have to realize is a very imbalanced one. There is complete opacity in that transaction. The patient feels he has no power on that transaction. So if he comes to you and you say you are having a heart attack, you have to have a stent in, the patient feels I don't have a choice. What do? I can't take my patient out because he may die on the way. I have to trust you, but I'm not really sure I trust you, but I have no power now. So I just submit to you, but in the back of my mind, I always feel that I may have been cheated because I had no clarity on what was going on. So this problem will remain till the time you make education or healthcare a transactional facility, right? This is why people are dissatisfied with private schools as well, because they say, oh, the school charges me for this, the school charges me for this, but I have no choice because my child is studying there, so I can't raise my voice, I can't do anything, but still we'll be dissatisfied. We'll still feel in the back of our minds that we are being cheated of something because we don't really know what's going on. So this entire ecosystem has to go on a capitation model, or a model where the doctors are paid very well, but not like a per transaction fee. They have to be paid well, right? You can't do that. A doctor will be paid like 50,000 rupees a month and expect him to become a super specialist and study for 20 years. He will obviously run away to brighter futures, to brighter lands. That is why people went to the US and UK in our times earlier, because there was nobody paying them salaries. But now with the private hospital providers coming in, as Dr. Kapoor said, the interventional radiologist, neurologist will be paid 10 lakh rupees a month in his hospital. So obviously he has no incentive to go out to foreign lands. He will provide that high level of care that otherwise he would have went and provided in the Middle East or Europe or US. So you have to be paid well, but try to make a system where you are paid well, but not on a per transaction basis. And the patient also pays a subscription fee and not a per transaction basis. So we see how much the dissatisfaction with mobile service providers went down when we got these subscription models, like a unlimited per month you pay this and you go unlimited. Otherwise, when we were paying per call and per KB of data, we had so many people complaining, so many dissatisfied customers, so many people going to the arbitrators that my bill is unjustified. So if you can make a subscription model for the patients as well as the doctors, that is, I think, the way to go. So when I was in London, there was this big doctors strike. I don't know if you recall that in 2015, when the salaries of doctors had been deducted by the then health minister there, Mr. Hunt. And there was lots of marches and protests, and I joined a couple of them. So we were standing in the tube station with our placards and everything, and every person came to us and congratulated us and wished their best. And we are with you, doctors. We are always with you, and you are our pride. Imagine something of this sort happening in India, where doctors are protesting for a pay hike. Everybody will throw brickbats at them. They say, "You already are thieves. Why do you want more?" That is the difference between paying per transaction and having a system where it is not a transactional thing. So that is the difference between the Western European systems, the Scandinavian systems. You don't see any patient filing suits against them on a daily basis. Do you think they have lesser complications than the US? Not really, right? But the patients trust them more, because they feel that whatever they are doing is in good faith, and they say that this is a mistake, not malice. Here, everything will be attributed to malice, not mistake. So
right. Right. Dr. Somani, what to your mind is an ideal solution for this? We've seen your presentation. You laid it out very clearly, what doctors who then set up their hospitals go through. I wanted to understand from you, Dr. Somani, what to your mind is the best solution for this? How to improve patient satisfaction? Dr. Somani, if you could unmute yourself, we can't hear you.
All right.
Yes.
So there's no clear mantra, Anisha. There's no clear formula that this will work. There's always going to be saying something.
Please go ahead.
Yeah. So there's no clear mantra. We just need to have a very clear understanding and put things together that the understanding at the level of people that's the first thing, that what private healthcare or public healthcare, where is the gap, what's the analysis, what we should do, what is our understanding at the level of government, understanding at the level of media, understanding at the level of fellow doctors, understanding at the level of insurance companies also. And there's a lot of talk regarding Ayushman, CGHS, insurance, but then there is another gap that sometimes some of these the appropriate rates are not there for anybody to understand how private healthcare would run on the said rate lists or anything. So there's no clear mantra that okay, do this and this will solve. That's not going to happen. It's only going to happen, and it's going to see a real change when we see that there is a very clear shift in understanding of everyone at every level. Otherwise, we've been talking this. I have been to various forums, and we keep talking, and we keep talking, and that's how we vent it out. But it doesn't translate into any change really. So if you want to change a shift, I think it's going to take some time. But
yes, but at least we're making a start here, Dr. Samani. We want to thank our doctors, our healthcare staff. They're doing an exemplary job. This pandemic has brought forward to the center stage the efforts being made by healthcare staff. So I'm sure now people will certainly be a little more grateful for what doctors are going through, and not just keep criticizing them for everything that doesn't meet their expectations. This is our hope, and this is our initiative to see that there is more gratitude and there is more thanks, more bouquets and brickbats for those running hospitals. Thank you so much, Dr. Kapoor, Dr. Bajaj, Dr. Samani, for speaking with us, sharing with us your views on the challenges hospitals face when just doing their normal day-to-day jobs. Thank you so much for joining us. I would like to hand over to Kamal, who will be taking us through the next session. Over to you, Kamal.
Thank you so much, Anisa, and really wonderful to hear all three of you, Dr. Kapoor, Dr. Mayank, and Dr. Bajaj. And Dr. Mayank, I must tell you, your presentation was wonderful, and you hit the nail, and then you identified all that areas which are leading to that kind of dichotomy where we are seeing a deteriorating trust, but at the same time we are also seeing that the relevance and the requirement and the need of our doctors in private sector is increasing day by day. So thank you so much, our panelists in the previous session. And now we will be going forward to our next session, and we are going to talk about something very important, the elephant in the room, when it comes to the maintaining the trust or in building a healthcare which is based on trust and compassion. But before that, I would request my team to play the video of our glimpse for our audience who are joining us now in this afternoon, the glimpse of what happened in the past 6 days of this gratitude week, for them to see that how the society, the doctors, the community practitioners, showed their overwhelming response, their support, and their gratitude for all the healthcare workers and professionals who are helping our society at the time of this pandemic.
IHW के द्वारा जो ये आपने डॉक्टर्स डे पर, चिकित्सा दिवस पर इस कार्यक्रम का आयोजन किया है, और जिसमें देख रहा हूं मैं सामने बहुत बड़ी बड़ी हस्तियां और काफी डॉक्टर्स और काफी समाज के ऐसे बुद्धिजीवी, ऐसे काफी लोग इससे जुटे, और आपके प्रति शुभकामना व्यक्त करता हूँ। और जो भी आज के इस कालखंड में हम लोग एक दूसरे से जुड़े हैं, मैं आप सबको हृदय की गहराई से आप सबके प्रति आभार व्यक्त करता हूँ।
Congratulating the Integrated Health and Wellbeing Council for this unique gesture to honor the doctors and other people in the medical community who are the most dependable resources to fight this pandemic. This is also an opportunity to recognize the efforts of those working behind the scene, lab technicians, scientists, pharmaceuticals companies, to mention a few.
There are doctors in the wards, there are nurses in the hospital, there are auxiliary workers. Everyone has put their heart and soul in saving all of us. And whatever little we can do, we must do. And the more we thank them, the more compassion and gratitude comes out.
I would really say the doctors have actually risen to this challenge in this unprecedented times. And that is something which is very heartening, not only in our country, but at a global level.
We use our skills to serve a social purpose. And we deliver competent, committed, and conscientious service, essentially for the welfare of humanity.
We are extremely proud also of the healthcare workers working with us for fighting this pandemic as they have done in the previous few months that we've seen. We've seen that even in the most advanced of countries, health systems have broken down. There has been shortage of equipment, shortage of PPEs, shortage of healthcare staff. But compared to that, India has done really well for itself.
Our public health system needs to be strengthened, and one lesson from this pandemic, if we have to derive it, is to strengthen the primary, the secondary, as well as the tertiary healthcare system.
If are we prepared for next war? Are we prepared for next pandemic? That will be the major issue.
There have been several lessons that we are going to learn, several reassurances that we have already got, and I'm sure all of us have to convey to the public.
Today I am happy, I am proud that I could take care of so many thousands of women to bring happiness and joy to their lives and their families.
Fundamentally, the problem lies with the excessive risk factors, not controlling the risk factors.
First of all, I think I need to take this opportunity to thank the godlike creatures on this earth called doctors. So yeah, real thanks to you guys.
And when you hear a doctor getting infected and still the commitment of the rest of the doctors to continue to go back to work, it just shows what they have trained for and what they're delivering. I think they're nothing short of warriors for us, right? And we should respect them.
But this is one place where everybody unites and understands the value of health and value of healthcare professionals. Normally, this is a profession where you do good and do well. So it's not like any other profession where you can only do well. So this is really a do good, do well profession which separates healthcare from every other profession. So we must learn to thank the healthcare professionals for what they do.
भगवान याद कर रहे हैं, हाथ जोड़कर फरियाद कर रहे हैं, मगर अब चिंता की बात नहीं, क्योंकि डॉक्टर इलाज कर रहे हैं.
तेरी गली मुझको घर मिला, आबोदाना तेरा साथ मेरे हैं ना, ढूंढते तेरा खुदा मुझको घर मिला.
में मिल जावा गुल बन के मैं खिल जावा, इतनी सी है दिल की आरज़ू.
अल्लाह के बंदे हंस दे, अल्लाह के बंदे, अल्लाह के बंदे हंस दे, जो भी हो कल फिर आएगा. तुझको आया या ज़मीन और आसमां आएगा, जो लक्ष्य है तेरा लक्ष्य दो, प्यार दीवाना है.
So these were some of the glimpses of our 6 days of Gratitude Week. We are on the 7th and final day of Gratitude Week today. And I would like to remind our audience and our panelists and to inform them that this day is dedicated for the private healthcare providers of our country who have been bridging the most critical and major gaps in our healthcare system. This day is dedicated for those entrepreneurs, doctors, professionals, and workers who continue to, provide almost 80% of the healthcare in our country. And we also wish to underline that what we see in India, having world-class healthcare infrastructure in many parts, though sometimes dismally, centered in urban geographies, is an outcome of effort, dedication, and passion of many of those doctors, entrepreneurs, companies who are building this infrastructure from the scratch. The session which we are starting now on this afternoon is about how do we build a healthcare system of compassion and trust, and how can a media play a role in that. For that, I would introduce our esteemed panelists today. So we have Mr. Ajay Maharaj. He's the head corporate communication at Fortis Healthcare. And he's leading the internal external communication for the Fortis Group Pan India. As we know, Fortis is one of the largest healthcare provider in our country. The role which Mr. Maharaj is playing in bridging the communication between the hospitals and the public and the media is very critical. So we look forward to hear some interesting insights that how media can play a better role, a more constructive role in building a healthcare of trust and compassion. We also have Dr. Karan Thakur. He's the Vice President at Operations and Communications at Indraprastha Apollo Hospitals, and he's an expert in health policy, health communication, operations management, and healthcare system. Dr. Thakur is representing another major and the premier healthcare provider of the country, which managing a chain of major hospital across the country. So welcome, Dr. Thakur, on this show, and we are looking forward to have some really insightful information from your side as well. We also have Sunalini Matthew. She is a senior deputy editor with the Hindu, India's national newspaper. She has an experience of 15 years with magazines, online and custom publishing, and a newspaper focusing on health, fitness, and nutrition. She is also a champion of health and women causes, and I welcome Sunalini on this show of Gratitude Week.
Thank you, Kamal.
We are also being joined today with Nikki Gupta. She is a co-founder and director of Teamwork Communication Group. She is also director of ISW Council I must highlight that. And she is a specialized communication expert, and the Teamwork Communication is a specialized advisory group in the area of healthcare. Nikki Gupta is advising several brands and organizations in the area of healthcare in their communication and media relations. So thank you so much, Nikki, for joining this session today. So let us begin this important session. And some of you had actually joined in our last session itself. And what we heard and what we have heard in the last 6 days of this Gratitude Week, that every doctor, every professional highlighted there is a, why there is a trust deficit and how we are going to bridge it. And everyone highlighted that we need to have more counseling, more communication, more transparency between the hospitals and the patients and their attendants and the public at large. But what happens when the perceptions are built? As I said, that apart from the two stakeholders, the patient and the doctor, there is a third stakeholder, which is the elephant in the room, and that is media. We heard some of the doctors highlighting in the last session that 98% of healthcare system, they see that people are showing their gratitude, and they are happy with the outcome. But the 2% of that where the outcome might have not been that positive makes the 98% of their life, because that become an overwhelming situation. So I'll begin with the a fast increasing trust deficit, and is there a role which has been played by media? And I'm not saying that there is a role; it may be a possibility, and I would like to understand from our experts today. So over the last decade, we have seen a widening trust deficit between patients and doctors, and who also include the hospitals. Let me begin this with Mr. Ajay Maharaj. Ajay, what do you think? What has been, what is your take on this? What has been the possible contributors of, increasing trust deficit?
Thank you, Kamal. And like that, our topic of discussion today is regarding building trust and compassion. Basically, in the recent surveys which have been conducted by various industry bodies, both trust and compassion, or maybe the doctor-patient relationship, has come at the bottom of the grid. A lot of surveys have been conducted by different bodies, and we've get to see that this is a major issue. There's a huge communication gap, and this is considered to be a challenge for the communicators as well. And to change the perception, the key barriers which needs to be addressed and which are on the current debate, which are going on other hospitals, are considered as the profit centers. Overcharging is another cause which keeps coming up. Different media stories or the patients and the outcomes are not right, or maybe some other times also. Doctors is also another thing which keeps coming up. In the recent we have seen that a lot of cases where the outcomes have not been good.
Mr. Maharaj, can you speak a little louder? Sorry.
Okay, and assault against the doctor has been another challenge which we are facing. And the fourth one has been the overpriced medical devices and other complications which come up. So as a communicator, it's our prime responsibility, what I feel, is to educate the masses, the patient, the media, and the various stakeholders. What is the, why it's happening and what is the reason behind it. And we have to transmit the right messages, identify the right platforms, and have to highlight the role of the private healthcare. As you rightly said, 80% of treatment is happening at the private healthcare. And people have the trust, but a few cases which doesn't have the positive outcome, so they get highlighted in the media. So from my perspective, we really need the support of the media also, as an educator who can provide us with the right platform and give the right message to the people, educate them, and also make them aware of the various challenges the private healthcare is facing towards providing this quality care, which is one of the best in the world. In fact, when you look at India, it's one of the best quality care and at a very low cost and the price which we are providing. I think that's the challenge we are facing, and the media can be really supportive in that.
Thank you so much, Mr. Maharaj. So you are highlighting that there are, as a communicator, as a hospital, they need to communicate better to the patients as well as to the media, so that we can, kind of make them better aware of the thing. But I think you are trying to do that, on your day-to-day work as well. Mr. Thakur, and before I go to Sonalini to hear the media perspective on that, how do you see that? What has been the contribution of this growing trust deficit, and what is your take on that?
Yeah, thanks, Kamal, for having me here. Really appreciate what you're doing through this Gratitude Week. I think it's timely. If you look at the the entire paradigm of trust, we have seen in the past few decades, unfortunately, an erosion of trust, not just with private healthcare, but with most institutions, unfortunately. Whether it is the police, whether it is the bureaucracy, the political classes, our systems, there has been an erosion of trust as a citizen towards the system. And I think that private healthcare does not remain immune to this social erosion that one is witnessing. Specifically for healthcare, one feels that the past few decades, the expectation that the public health system was supposed to deliver has not met the aspirations of citizens. And what that has done is it has shifted some of that onus, not all of it, some of that onus onto private hospitals. Once we see that that migration of expectations to the private healthcare, that's where people have certain expectations that they were expecting from public health has not been delivered, and therefore the private healthcare should have filled that gap. Primary to that gap was the cost of care. And I think that is where the crux of the problem is, where we as citizens feel that there is a societal entitlement that we must have towards good quality care, which is absolutely fair, to come at a reasonable cost of free, which again, as a citizen, I may aspire to have as a citizen some of the rights that I enjoy, but that has not been delivered. And that has led to what we are seeing today as erosion of trust and some of the issues that are relating, as Ajay had just alluded to. But if you look at the word trust itself, it has 2 or 3 attributes. It's reliability, it's truth to be conveyed to you by someone or somebody, and third is the fact that there has to be an ability. So when you trust somebody, there has to be that ability. I think on ability, most people, most patients would grant us that private hospitals do have the ability to give care. But I think it's reliability and the truth or transparency is where I think we all need to work more on.
Thank you. So, Dr. Thakur, you are echoing the same sentiment that there need to be more communication, transparency, and you are also seeing that there is a overall, erosion of trust as the people are getting more educated. They are looking for better accountability, and they also have the opinion that these are their rights to get a quality, equitable service, whether it is healthcare or any other service, whether it is you mentioned about even the police and the other public services. So let me go to Sunalini. Sunalini, you have been seeing the healthcare and private healthcare system, the increasing role of it, and then you have also been seeing and reporting several sources stories where we see that apparently private healthcare sector looks like that this is a machine which is there to fleece the patients, and the focus of the hospitals and doctors and maybe other medical professionals might be more towards how to make out of the misfortune of others than to provide the care itself, and which is largely is changing in the new narrative of COVID-19. But if you also see the some of the discussion which I heard in the last session was that if we see the private healthcare and the government healthcare cost of it, so the government healthcare cost is much higher than the private healthcare cost, as one of the esteemed panelists highlight that if you are going to a private super specialty hospital, the cost of the bed may be around 25,000-30,000 rupees, while in the government system it is 80,000, and this is all prepaid by people like us, people like you, and all the taxpayers of the country. How do you people, how medias, perceive in a case of, let's say, this kind comes to them that, okay, there may be an apparent higher charging or overcharging in this case, and what kind of due diligence, goes through that, okay, what might have been the reason, what kind of treatment was given, what was the need of that treatment, was there a need of ICU, what was the condition of the patient when the patient was rolled into the operation theater or in the ICU. How much diligence media normally does in those kind of cases? Sunalini.
Yeah, that's a tricky question because obviously different media houses operate differently, right? And I'll give you a very simple example. Forget looking at the cost of the bed and the cost that the hospital has to put in. The simple example was a recent suicide, right? Different media houses of Sushant Singh. Different different media houses reported it very differently, right? So some media houses already have protocols behind them to say this is how you're going to report on suicide, right? A lot of media houses don't, which is why you have things, people coming out and saying he committed suicide, which we all know is not the way to report it, and this is what happened, he had this fight, this baby, whatever, all those rumors that were happening. So it really depends on the protocols that your individual media house has put in place. Not many media houses have put in place protocols, right? There are a few who have. So I think as like you've pointed out, we need to put in place those protocols collectively as a media, especially not just the English media, right? The vernacular media, as well as TV channels, which have a huge influence. So I think putting protocols in place are important. The second thing is the media is not there for the healthcare system. The media is there for the people. And I think that's something we need to understand very clearly, that we are reporting to give the most information that we have at a particular point in time to our reader, because our priority lies with them, not to the doctor, not to of course we try to do justice, right? Because the aim is always to report correctly, right? Report the facts. That's what we're all taught in journalism school. And I know you've been taught that too, right? The point is to report the facts. Follow-up stories can be done. Unfortunately, in the media, we don't have that much of a system of doing follow-up stories. So suppose I say, so-and-so hospital is charging 400 times what a government hospital, so-and-so a private hospital is charging 400 times what a government hospital is charging. I am reporting that. It is the truth. There is nothing wrong with that reporting. My reader needs to know that. And therefore, my reader can make a judgment on whether for a particular COVID-19 or whatever the problem is, I should know that as a reader so that I can then make my choice on whether, if, God forbid, I get this terrible infection, should I go to a government hospital or should I go to a private hospital? So I can make that intelligent decision. I may not have 4 lakh to shell out at this particular point, right? Irrespective of what the bed costs, great treatment, etc., I just may not be able to afford that, right? Yes, a follow-up can be done on how much this bed is, what the quality of care is, all of that can be done. We don't often do it. And that is something I admit to. But I think, and I keep saying this, even to my own journalists, we are here for the reader. We have to report what we are seeing. And there are no two ways about that. So we are not there for the healthcare system. We are not a platform for the healthcare system or any system, the political system, whoever. We are not there as a platform to promote their agenda or anybody's agenda for that matter. We are just here to report the truth in an ideal world.
Thank you so much, Sonali. This is very important, and I think there is no doubt about it that every media house is responsible towards their reader, the public at large, and they need to keep their interest in mind first before they report anything. My point also here is that are we doing more damage while we do immediate good? Because what is happening sometime, and this is what the question we are trying to just address today, that why the whole trust is deteriorating, and that trust deterioration also leads to a lot of other problems, which are the collateral damage of this whole thing. We have been hearing in the last session also, and you as a journalist also must be following it up, and that a doctor's son don't want to become doctor, like a farmer's son don't want to become farmer today. Why? Because the farmer is struggling day night under that sun, and then they're not able to earn adequately, which can run the family. But at the same time, it is not the case with the doctor. Doctors are earning well, but at the same time, they are not getting that respect or that gratitude for which they are sacrificing. So that may be a reason. We will come to that. Let me just go to Nikki. And Nikki, you have been managing, I think, a lot of that there is a communication coming from a hospital, and there is a there may be a scenario, a case which is also being reported by the media, and you may find yourself at a situation where there are two streams of perception. The hospital would feel that they are right, what they have done, and that is justifiable. Media will feel that what they are doing is completely justifiable because their duty lies to the readers, and they need to bring that fact out to the people. Where do you see that the overall perception gets changed in this process, and can lead to something which is not the right outcome in this whole communication? You are on mute. Sorry.
Yeah. So thanks, Kamal. See, when it comes to the trust deficit, the major reason for this, I would say that patient, they have a lot of information. When they reach to doctor, they have already Googled enough things. What doctor is saying, they sometimes even don't believe to that. And the major reason that many taking too many consultation with the various doctors, that's also one of the major reason of bringing healthcare system in such scenario. When it comes to communication and handling media and the healthcare clients, both side, we really need to do very transparent job. We really need to tell what we feel, and cost is a major concern, as all of them correctly said. But if we talk about the cost, that also we need to understand that everybody would like to go to nobody wants to question when it comes to the government hospital. Private hospitals, private healthcare, they are always questioned about for their cost, but they also want to go to the private hospitals, right? That's also one scenario. But we here, what we do in our communication as a major, we are a specialized healthcare communication firm. We always try to bridge the gap, and we try to provide the right information. In the recent scenario, we have seen such a case where one of our hospital client turned into a COVID hospital, and a leading electronic media house, English electronic media house, they did a story on the cost on the PPE kit. It was 5 times charged. Then when the media house approached us, we communicated to them, they spiced up a bit more and they ran the story. Then I spoke to the editor, we communicated that if we will not be charging, if the client hospital will not be charging the PPE kit, how we are going to give the protection? The safety is also equally important. So when we communicated in the right way, and the editor heard us, and they immediately stopped the story. So we need to be very, very clear in our communication, and we need to tell. Then I think it can help us to change the perception. Not immediately, yes, it will take time.
Wonderful. So you brought us some interesting story in that. So let me then go to Ajay, on this. And Ajay, what happens, normally when, somebody, a patient is coming, it is possible that the patient asks for the best kind of services, they are, when they are taking admission in your hospital, and they may think, that they want, so they will ask for which category room you have, and the best category room they want, no matter how much, the frills are involved in that, which maybe it is an important during in COVID-19 also, because people are looking for private rooms, people are looking for, and definitely that adds on to a lot of the cost. Everything goes fine till the time the health outcome is good or okay, and they go happily out of the hospital. The moment the desired outcome has not come, this whole thing become the case of overcharging, fleecing, and apathy, medical negligence, If that does not happen, then it's all right. So how do you see that? And is there, are you able to communicate to the media that, this was the fringes, these were the services taken by the patient over the period? Do they, or are they receptible to those kind of information?
It's a very nice question, Kamal, and that's a challenge we face as the healthcare communicators, which Karan is also aware. Like people ask for the best possible treatment, which is there, which can be done. And for most of the treatment, I mean, regular consent, regular counseling, everything is done for the patient. They're aware about the cost, they're aware about what kind of medication has been given. And to be, I'm like, every disease has a different treatment protocol that people have to understand. For COVID also, what you said, people are getting treated with different protocols. Some might get treated at home isolation, some has to be hospitalized, some on oxygen, some on ventilation, and critical care is involved. So people have to understand that they can't just say like, this is the treatment, this has to come at this cost. So that perception is like why 4 lakh has been charged. If somebody's on a ventilator for 14 to 18 days, obviously the cost is going to come high. And it's going to be there because when you're talking about the PPE kits also, obviously everybody entering the ward, everybody treating the patient, they require a PPE kit for the same. We can't, I mean, like we can't neglect the safety of our clinicians or our people who are serving the patients. So we have to ensure that with every protocol, safety, again, everything is followed. So that is very important. And regarding, as I said, we treat 25 lakh patients every year, out of which maybe 10 to 15 cases get really highlighted in the media. Why? One of the main reasons is because the outcome did not come as I desired. If this is a situation like most of the media houses, like I'm talking about the reputed one, they understand the situation, they come up with a version like Sonali said, like we talk for the people, definitely they have to talk for the people. And but to educate the people on what is actually required, why it was done, why this treatment was required, with this cost has come, that has to also be explained properly to the people, so they understand these are the challenges with the private healthcare faces. These are the kind of cost which is going to be there. And as I said earlier, also India is one of the cheapest and one of the best medical care which is provided in the world, and India is one of the cheapest in the world. The main issue in India comes because of the insurance. People don't buy insurance policies and they don't go ahead with that. So that becomes another challenge when they become a cash paying patients, they're always expected a discount. And when the outcome is not right, they say that there was a medical negligence, the hospital didn't treat you well, the doctors were right. And these are the challenges we face quite often. So I think these are the things we have to look at, and that's the support we're expecting from the media. We write for the people, definitely write for the people. The people have to be aware this is the cost which actually comes out. This is what is required. They just get the people, I think the media reporting, healthcare reporters have to get in depth into the situation, understand what is the cost, why it is required, and why these people have to pay, or maybe the patient has to pay that cost. So that's my only concern.
Dr. Karan, you are running hospitals in multiple parts of the country, and I'm sure you are getting those information, from all across. Many times what happens, especially I'm talking, and as Sunalini also highlighted, that there are lack of protocols of due diligence, many times in the regional media or vernacular and all that. And you deal with them also. I'm sure your hospitals are dealing a lot of them. How many time you see that, and also keeping in mind that in many of the tier 2 cities where you may be having hospitals, or other smaller cities apart from metros, patients first go to multiple round of treatments, and over the period the condition keeps deteriorating, and they reach to a super specialty hospital at a time when it is already a very, very advanced stage of the need of treatment. And obviously many of them are then put on ICUs for longer time, I think sometimes more expensive medications, antibiotics, and so many things that leads to increased bill. But when again this outcome does not come, and they go to the media and say that, oh, we were charged for 20 days, 30 days, we were charged so much, and they kept us in the ICU. Nobody goes to the detailing of that okay, why the ICU was needed. So do you see that, or how do you try to communicate to the media at that level, or
is your hospital coming up with some kind of ways and means through which you can bring in better information to the patients at every stage of the work, and can maybe have a better grievance redressal system? How do you do that?
Yeah, that's a very good question, Kamala. There are some aspects to it, so I'll deal with it one by one. As Ajay just mentioned, unfortunately in healthcare we have a situation which is like the goalkeeper's paradox. He may defend without letting the ball go past him for 89 minutes of the game, and then in the last 1 minute there's a goal, and he's blamed for all that went wrong. Those 89 minutes are forgotten. Similarly, in healthcare, every case is expected to have a certain outcome, whereas the disease progression and the outcome may be very different case to case. So I may have referred to a patient who may have recovered from X disease, but another person may not have recovered from it. So sometimes what happens is there is a lot of hearsay around disease outcomes and assumptions that now that you have reached an Apollo or a Fortis or a Max or any others, you are expected to get through it. We are not gods. We are the first ones to accept this fact that every disease progression is a challenge, and ensuring an outcome to the best of our ability is possible. But to guarantee an outcome, nobody makes that promise. Number two, in terms of communication, I think when things go bad and when the media reports, by all means, I think the public, the wider audience that Sonali mentioned, they have a right to communicate to them. But today, the type of words that are bandied about, I don't think make for fair or balanced or fact-based reporting. To call hospitals and doctors looters, to use a legal term negligence so freely, where anything could be amounting to negligence, where a delayed care is called murder. I think those type of languages need to be tempered when we are discussing science. Just like we don't expect scientists to use fanciful language, we want them to be tempered. Health reporting should be health reporting. It cannot become sensationalized for TRPs or for gain of more readers or viewers. So we've seen this, but specifically to your question, we've seen not only this in tier 2, tier 3, but also in mainstream media, where this sort of sensationalizing, for whatever reason, may serve for good TRPs on the evening news, but it damages hospitals and doctors immensely. And I think that's where some amount of checks and balance need to be put in place. What can hospitals do? I think, and I'm the first to admit, we have not done a job good enough to communicate adequately to patients and their relatives. We must do more. And I think in the previous panel also, that was one thing that came out very clearly. If you see how good medical records are progressing day to day on a patient's condition versus how we communicate that very good medical record documentation is abysmal. It seems as if they're not even the same documents versus what was communicated. So while I take the point that we must communicate more and better, I think some of this reporting that is happening today is not purely fact-based.
Thank you so much, Karan. So Sonali, I think wanted to say something on that, but I'll come to Sonali and with the question also. Sonali, do you see that there is an overall erosion of the trend of writing in-depth stories in media? For example, when you are writing a financial scandal, it is written in so much of chronological order, and the journalists go each step and stepwise that where and how the things went to a certain level where wrongdoing happened. Do we do the same kind of thing in healthcare reporting, or it is just taken for granted? And sometimes do you also see that in media, do they have some kind of training process that if somebody is coming to the health reporting, at least these are the basic parameters that person should complete in terms of health reporting? Because as Karan said, this is a science, and everyone may not understand the terms and then the terminology and then their impact and their relevance and their connections with other things. Yes,
so
Sonali.
Kamal, Yeah, this is where I go back. Media is not all the same. We are not one homogeneous group, right? And there are different kinds of media with different kinds of checks and balances. We at the Hindu have very stringent checks and balances. You don't just write a story and put it out there. You write a story, it will go to the desk, it will go to the editor. It's a very old fashioned way of doing things, which is why we are not, the quickest. We will not be able to report stories immediately within 5 minutes, right? That's because there are protocols, there are checks and balances in place. Journalists come from different backgrounds, which is why we have those checks and balances in place. Because we have more senior editors who will be able to guide journalists on, have you checked this with the doctor? Right? If I'm writing a story on cancer, the last thing I want to do is to put out an incorrect term or to give an explanation that is incorrect. And we look at our jobs a lot of the time, especially when we are doing lifestyle related reporting. We look at our jobs as a conduit between the doctor and the reader, because we want to give the reader the best explanation of the science behind it, right? So I will also therefore draw your attention to the role of the media in in COVID reporting, for instance, right? The fact that we have been able to, and this is not just speaking about the Hindu, right? This is for all media. We have been able to a great extent to put out information that it is necessary to wear a mask. Correct. We have, I think, been to some extent fairly successful in that. We don't, therefore, we are feeders into good practices amongst our readers, good health practices amongst our readers. Wash your hands, carry a sanitizer. These are things that doctors have put out through us to people. But again, I go back to the fact that we are not here to promote agendas of doctors. We are not here to promote agendas of hospitals, and we are not here to become echo chambers of various private hospitals and echoing what they want to tell the public. We are not. That is not our job. Our job is to communicate the facts. So if a hospital is overcharging, not overcharging, that's an incorrect word. If a hospital is charging 400 times for a PPE kit, or 5 times, or whatever the number is, it is our job to report it.
Certainly. I know we are not at all, I think, arguing on that. What we are trying to understand that, when we say that our agenda is the public interest, I think health is one of the biggest public interest agenda. 100%. And as all stakeholders, it is very essential for everyone. And that's why we are talking today. We have been talking with so many doctors and policymakers and healthcare professionals. But I think we Ajay, so many journalists who are also risking their lives, going out reporting, going to even sometime hospitals during this time. So this is a very, very important the partnership which has to keep going on, and the agenda of health for all has to be served, not of any section or industry.
Right. So sorry, Kamal, but I think that's another problem. We have now begun to see health as an industry. We don't see it as a service, right? And the moment we see something as an industry, and this is not, this is also for us to think about it. In the previous session, Dr. Somani had pointed out, he said, why does a class 12 student become a doctor? And he named 2 reasons. And he said, one is respect and one is financial security, right? And therein lies the problem. The child, therefore, has not thought, this is something I enjoy doing. This is something, the idea of service may come much later, right? It probably comes in your 30s or 40s. But just that initial thing of, this is something I enjoy doing. Not that, oh, my father was a doctor, my mother was a doctor, and oh, doctors are really respected in society. That's not why you become a doctor. That's not why we become journalists. That's not why we do the jobs we do. We should, in an ideal world, be doing a certain job, whatever that job may be, because we enjoy it. because we're curious about it. And later in life, yes, the idea of service, right? So a person joining the army, I think, again, same thing. You join it maybe because you like the physicality of it. And at some point, it dawns on you that, yes, the idea of service really appeals to me. And I think that's where, whether the doctors in the private sector, whether in the public sector, or whether the journalist is, again, whether it's a journalist or anybody, I think maybe we need to go back to that a little, rather than calling it an industry and thinking of it as an industry, which then becomes, all your capital. Then becomes, all your capital. Yeah, look at it as a service that we're providing.
Very valid point, Sonalini, on this, and this reminds me, when why we started this Gratitude Week, and we started this Gratitude Week on the National Doctors Day, which is celebrated on the birth and death anniversary of Dr. V.C. Roy, and the kind of emotions you are trying to highlight, that when you are really attached and enjoy what you want to do. And that has been the the epitome of how our doctors have been. Dr. V.C. Roy, despite being the chief minister of the state, used to do the he used to see the patients, and every day he used to see the patient, and he kept doing that throughout his tenure as CM, or as a politician, or as a doctor. So that's where those value system comes in. So your point is very valid, and I'm sure that we all need to work towards it. Nikki, you heard about the responsibility towards the people, and you have also heard that the challenges which are coming in. What kind of cases you might have seen where this kind of sensationalizing of the news might have taken the front seat, instead of understanding the issue itself? And Sonalini also highlighted that different media has different protocols and system to vet the stories. Would you like to share some case?
Certainly, Kamal. So I would like to discuss on the point that Sonalini and the other panelists said this. When it comes to electronic media, as in the morning session, Harish Pillai was also saying that he doesn't watch electronic channels, TV channels, because it affects his mental health, right? Electronic channel, I'm not because being into communication part, I'm not pointing out anybody, but yeah, I'm trying to be balanced in my communication and the conversation that we are having. We have various cases. I think in a week we handle 7 to 8 such cases. I'll tell you a very good example in a Patna case, where the doctor was doing a CPR on a patient, while the patient family reported that doctor was jumping on his chest. Okay. So, and it created, all the national electronic media. It was all the front pages that, the patient was died, and still the patient, doctors were jumping. I can tell you the whole story headlines. I still remember, it's been a while, of this case ki mara pada tha patient, wo aur shav pe kudte rahe doctor. That was the story, and you will not believe this story was stretched for almost 15 days. Almost we spoke to all the top editors of electronic media houses. So spicing up things in electronic media, I would say it's too much for TRP they do. And in fact, I would say in the print media fraternity also, many times they question, on the new media is also one challenge which healthcare industry is going to face, because they are not going to any media houses. They are, him directly tagging to ministers. They are directly speaking out, raising their concerns and all, which is leading to the another next level. So there are multiple ways that we need to handle the situation. I'll give you one more example where in another big multinational, hospital brand, where the patient was served the tea, but the tea bag which they got, it was written 1-day expiry sugar, and they created the whole mess. The whole media was called in the hospital, and any kind of a crisis is a crisis. It's not always related to life and death, but yes, crisis in healthcare they can create, because most of the time patient is reaching out to the media houses and they feel what the patient is saying, they are always right. While we always try to communicate in a balanced way, we empathize with their patient situation, but at the same time we need to understand what brands want to communicate and what is their problem, their challenges, right?
Thank you, Nikki, for bringing this interesting case also. I remember, I think it was the case of where a patient collapsed in a ICU and the doctors or the, I think, attendants there were trying to give the CPR.
Yeah.
And that was unfortunate outcome that the patient actually could not be revived. But when the patient was, I think, was informed that has died to the family thought that actually the doctors were giving the CPR to the dead body and keeping the dead body in the ICU for long. This was the claim, and this was blown out of proportion. You highlighted an important point, which is about the new media. So, Ajay, how, this new media, so Sonalini talked about that newspapers like Hindu have very well led vetting process, diligence, editors are involved, and then things go to the public so that the public keep getting the right balanced information.
I would like to add here, but not Hindu definitely they have this system, but not all the media houses.
Yes. So that is a challenge. But what happens, Ajay, when every person has got their own media? Everyone has got their own. They're all reporters now, and we are talking about training our journalists to be more sensitive, to understand the terminology, the processes. Here, the 1.35 billion people can become potential journalists, and they all are writing what they are writing, and they are all alleging what they are alleging, and everything is a news. And as Dr. Somani previously said, that 20-30 cases in a day which are going good, happy, health has been retained and restored, and one case, and those Facebook posts may get much more of trauma and allegations to you than the 20 other good cases. So how do you deal with that, with this new media surge of allegations?
Very valid question, Kamal, and I'd like to add on to something what Nikki had said earlier, that everybody reaching the hospital Googles the information. So that's the problem where everything starts. When they start Googling the information and they try to become a doctor themselves. That's the first concern we have, because a doctor is going to prescribe the medication according to the clinical, what is the requirement of the patient, what is the criticality, what's required, like they have to prescribe the actual care, what is required. But looking at Google, the outcomes can be different, the patients can be different. So that's a major concern for us, where everybody becomes a doctor. And secondly, a new media, like basically right now, the social media is very, very in full action, you can say that, very dynamic as of now. And everybody is going to dive onto the prime minister or the health minister or each and every influential person or different NGOs and everything. They get onto that whenever something is happening. Like you talked about a case where we're jumping on doctors, we're jumping on the patient to a tea bag or anything. So we have to be prepared on that part. So that's very, very challenging, because print media, we get time to respond to the queries. At least most of the journalists connect with us. They want to know our side of the story. So we will give it to them, so they are able to capture it and provide it. And so with the electronic media, is also pretty challenging, because they want an electronic bite. If you don't give them a bite, or maybe we're trying to gather information, they run the story and they try to add on to the whatever quote or what we provide. But the new media, like the social media, is the one which is very, very dynamic as of now. And that's a challenge which we all are facing, because they have been tagging at all the platform, all the ministers, all the chief ministers and different bodies. And to come up with the right justification becomes an issue. WhatsApp platform is being used, and different kind of information on the WhatsApp university is being shared. So a lot of videos get viral on that. So, I mean, like recently, another private hospital in Gurgaon had some video which was going on for a long time where the lady was accusing the hospital or something. So, you don't get the right time to come across and put your point of view and give your statement across in the right directive and basically explain the situation to them. It's a big challenge. We all are facing it, and we have to be very, very, I mean, like 24/7 kind of a thing. It has happened now. We have to be active 24/7. We have to screen each and every portal which are possible can be possibly screened to get the information where what is happening. Good outcomes and good news is taken for granted for sure. That's what people expect. Whenever there's an outcome which is not appropriate, it becomes a story for us. So that's a huge challenge.
Good news is promoted as a promotional stories.
Yes.
They don't consider it. I'm sorry.
Yeah. That's what I'm saying. It's taken for granted. The outcomes and good news is always taken for granted. And whenever there's an issue, or if any small issue can be also highlighted and taken to a different level, that's a huge challenge for us also.
Well, thank you, Ajay, for highlighting this. And definitely, it is a challenging, as you are saying, to deal with the new media. Dr. Karan, see, many times all this which goes to the media, whether new or old or traditional, is also the outcome of the feelings which the patients and their attendants may be having at that time. Most of the people, and we know that in healthcare system, everyone who come, except for a situation where the childbirth is involved or cosmetic surgery is involved, normally the people come to a hospital are distressed. And many a time, any kind of, handling which can be perceived as mishandling at the time of, acute distress you are in. And especially when either you have lost some lives, somebody dear to you, or you are seeing acute sufferings there. How do you people also try to mitigate that these things are not going or aggravating, and we are able to empathize our patients and their attendants at all possible level? And I'm talking from the guard on the gate to the somebody on the front desk to the nurse who take care at the ward.
Absolutely. And that is, you've hit the nail on the head, how to really change this current scenario. Just one comment on what we discussed on social media. I think that, maybe it's time that some sort of fact checking, whether it is a loose group of people who are interested in medical facts or doctors, put out facts rather than what is being peddled to be facts, should be done probably is one solution. We're seeing how effective fact checking has been in the political realm. When political leaders say something, there is an army of people who are also fact checking and putting it out there. CNN does that. It has a fact checker which is putting out against a range of politicians when they make any proclamation. So maybe in healthcare that is required. Who will do it? How will it be done? I don't have the answer there, but maybe that's one route. On the second point that you raised, I think that's where the crux is. Patients and their families do have rights. They do have a right to know what is happening to their family member or to a patient themselves. This needs to be communicated in a language and in a manner that they appreciate, understand, and can absorb. So that is the job of hospitals that we must do, and we do, which includes training to the staff, which means communication at set intervals of time and in a manner in which patients do understand. So training will have to be much, much more rigorous for every staff member, as it is happening now also in hospitals, but clearly more needs to be done on that front. Then trust accretive exercises like having patient support groups that are formed where they can informally discuss conditions, doctors, hospitals. That helps. But then this should become a constructive exercise rather than naming and shaming only. If somebody were to tell me that they've gone through a similar condition and this is what they went through and that they've gotten out of it, it helps another person go through that journey with a little bit more confidence and trust. So I think that is one element, training, and the other is of patient support groups that may help in cutting through all of the misinformation or lack of information that may exist.
Thank you. So that's important aspect, and I'm sure that all other hospitals are also trying to do the same thing, especially at the private space. Sonalini, so we will be closing this session. So I'll I would request for the last your remark on this. You said that every media, and I, as a I trained as a journalist and worked as a journalist, so I also believe that every media has the prime responsibility of addressing the concern of the people and what is good for people. And health is something which is the biggest aspect of our life. And I think media has also a greater role of addressing those this aspect, that why we don't still consider health as one of the major issue around us. Why still we don't our governments are not bothered about investing adequate resources in health. Why we are always more focused on what is happening in our neighborhood, whether sometime it is intruding or not, but at the same time we are preoccupied, and we are not seeing. So how much of media can actually play a role that health become the supreme agenda, the first agenda? Because I believe, and I believe others will echo this sentiment, that this pandemic at least has shown that nothing comes before health. Nothing. So are our media going to play a role that the health of the people become the biggest agenda, and anyone and everyone who is contributing to that is either supported or criticized constructively? What's the role media can play in that?
So there are 2 or 3 things. One is, you mentioned governments which don't invest adequately in health. And I think it's for all of us, you, me, everybody, to now demand that there is more investing in health, right? The media can play a huge role in that demand, right? But it's not only the media. We should also then be in a position to vote based on that, and not vote based on any other agenda, right? We need to put health at the top of our own priority when we vote, right? The second is, I think if the media can focus a great deal more on prevention and protecting ourselves, and in some way sparking our own, as people of society, sparking our interest and that continued interest in health. Now we are in this COVID situation, everybody's very bothered about health. But to maintain that through and through, by putting health stories, giving health stories prominence, that is important. For instance, in our app now, if you look at our app, along with national news, city-based news, international news, we have a wellness tab as well, right? So if all of us can do that as media, to put health upfront, to make it important, that would really help, and to focus on prevention. I cannot stress this enough. And how do we focus on prevention? By bringing about behavior change. So behavior change in for instance, a lot of people are now going back to work, and people are only going back, 30% of the workforce, 40% of the workforce. How are companies deciding which 30% or which 40% to actually bring back? A lot of companies are saying, if you smoke, please stay at home and work. If you chew tobacco, please stay at home and work. So bringing these aspects out, that health is of primary importance. And therefore, we need behavior change. What are companies indirectly saying? Companies are indirectly saying, please change your behavior. Please stop smoking and then come back to work. Please stop chewing tobacco and then come back to work. And I think if the media can highlight those stories, I think that will be good for society at large. So again, I think prevention hinged on behavior change. And if the media can bring out the health issue, which perhaps it will in the future elections that are to happen. That will be great too. And then we all need to vote accordingly as well.
Thank you so much. So, Nikki, your final remark on this, and this is on the important aspect of. So what we have seen, Sonalini is saying that the media has to play a greater role in wellness, in prevention, in awareness of health. What we have seen over the period, and you can help us understand better, that the space dedicated to health in media has over the period evaporated. There is hardly a dedicated space for media. Maybe so like you have a political theater in papers. Nobody has health of the nation, where you report health every day, where you report or health every day, or the areas to improve upon and health every day. In the pandemic time, almost the entire media is the health media. How do you see that? And should the media take some take away from here? And when we come out of this pandemic, should there be a section of health of the nation in every media talking about health, so that the agenda is not getting out of the mind, out of sight, and is not also getting out of the follow-ups, as Sonalini said?
Absolutely, Kamal. So this pandemic will certainly going to change the perception when it comes to the healthcare reporting and the healthcare challenges in the media and in the system that we face. It will improve. I would say there is some, in today's time, you absolutely correctly said that everybody is health reporter. Everybody is reporting health at some extent, if we forget about business beat, everybody is health reporter. So keeping that in mind, media will certainly opt for more health pages, and people will become more health conscious, and there will be a behavioral change. It will change the perception. It will change some doctor patient trust factor also. This will not just only will be a temporary change. I'm sure it will change going forward the whole scenario in India when it comes to healthcare reporting, healthcare communication, everything. And it will help healthcare system also going forward.
Thank you so much. So we end with this positive note that the media, we as a industry contributors, and the public and the people of this country will value more informations which are related to health. They will give more weightage to what comes first, and we believe this is a health which is the most important priority of life. Definitely our media reflect how our society think, and also our society thinks what our media reflect. So I'm sure that with this gratitude week, where we are trying to highlight, and it's just a scratch on the surface, maybe or maybe just a very small beginning, that we are trying to highlight many those aspects which goes in providing and restoring the health of this nation. There are millions of people who work at many level to ensure that the healthcare continues to reach to the people who need it. And that's where I think our country is progressing in terms of in our many health markers. But at the same time, there's a long way to go, and we expect that our media, our industry players, and everyone who is involved in that will be doing their best to ensure that the health agenda is supported and taken forward to the best of the manner, even despite this pandemic. So with this, I would like to end our last session of this gratitude marathon, which is running for last 7 days. We started with health, July 1 with the National Doctors Day. Our next session is going to be the grand closing ceremony of this gratitude marathon, and we will be joined by the Union Minister of State for Social Justice, Sri Ramdas Athavale, and a host of important healthcare providers from across the country from 3 p.m. to today. for the grand finale of this Gratitude Week. I request my audience to stay tuned or come back at 3 o'clock when we resume again this marathon to take it to the conclusion today. Thank you so much, Dr. Karan, for joining us today.
Thank you.
Mr. Ajay Maharaj and Sonalini Matthew, and we really appreciate all the work which is being done by all of you, Nikki Gupta, which is helping people, understand and value the health, and make sure that health is the wealth, and they get this message time and again. So thank you so much, all of you, for joining today. I would request my team members to play an anthem song which we have created for our doctors and healthcare workers and as a healthcare professionals, and you people affiliated with that, and even media going out. And so this is a salute from our side to you people as well. Thank you so much. Keep doing the good work, and we will come back at 3 o'clock in our closing ceremony. Thank you so much.
Thank you.
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वो ये है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया. Thank you.
अपना सुकून भूलकर वो सबकी जान बचाते हैं, भूख प्यास भूलकर वो डॉक्टर होने का फर्ज निभाते हैं.
Someone has rightly said, as God cannot be everywhere, so He has sent doctors for us.
You are risking your life at every moment. You are not afraid of this pandemic.
ਤੁਹਾਨੂੰ ਦਿਲੋਂ ਧੰਨਵਾਦ ਕਰਦੇ ਹਾਂ ਕਿ ਤੁਸੀਂ ਇਸ ਮੁਸ਼ਕਿਲ ਵੇਲੇ ਆਪਣੀ ਪਰਸਨਲ ਲਾਈਫ, ਆਪਣੀ ਫੈਮਲੀਜ਼ ਨੂੰ ਪਿੱਛੇ ਛੱਡ ਕੇ ਸਾਡੇ ਲਈ ਔਨ ફિલ્ડ ડ્યુટી તે હંમેશા અવેલેબલ હો.
આવી મહામારીએ અમને અહેસાસ દિલાવ્યો છે કે તમે ભગવાનના એક રૂપ છો.
Thank you will never seem enough, but we will say it anyways. Thank you for your countless hours, your unwavering dedication, and the boundless talent that you possess.
माना वो डॉक्टर है, बेशक कोई भगवान नहीं, मगर डॉक्टर का डॉक्टर होना इतना भी आसान नहीं.
I'd like to sincerely pay my gratitude and thank the whole medical fraternity, the doctors, the nurses, everyone who's been working endlessly and effortlessly in this drive to, tackle the pandemic.
Coronavirus, something which we never heard of, something that was totally new to every one of us, even to the doctors. But still, doctors came ahead, they fought this battle, they conquered this battle.
Thank you so much, doctors, that you are there so that we can stay safely at our home.
દિલ से आपका शुक्रिया.
દિલો ધન્યવાદ. God bless you. Thank you.
અમે તમારું ખૂબ ખૂબ આભાર માનીએ છીએ. તમારું ખૂબ ખૂબ ધન્યવાદ.
Thank you so much, doctors, for being there.
I hope you keep continuing the great work. Thank you so much.
We salute all the doctors out there.
We love you, doctors.
Thank you, doctors.
माँ हमें जन्म देती है तो कई बार डॉक्टर हमें पुनर्जन्म देता है।
संकट की इस घड़ी में अस्पतालों में इस समय सफेद कपड़ों में दिख रहे डॉक्टर नर्स ईश्वर का ही रूप है। अपने जीवन को खतरों में डाल करके ये लोग हमारा जीवन बचा रहे हैं। डॉक्टर जिंदगी बचाते हैं और हम उनका ऋण कभी नहीं उतार सकते। ये हम सबका दायित्व है कि जो देश की सेवा करते हैं, जो देश के लिए खुद को खपाते हैं, उनका सार्वजनिक सम्मान हर पल होते रहना चाहिए।
decide to call on a wonderful doctors who are seniors. For the title doctor is an honor. It is true fruition of life achieved by just a few. It's a journey that has brought you to this time and to this place where you can make the difference with each challenge that you face. The knowledge in and of itself is just a part thing that makes you special. Your kind and gentle heart, and when a doctor cares as much sincerely you do, the world becomes a better place, no doubt, because of. Thank you.
My name is Siddharth Suri. I am from class 3C of St. Columbus School. Gratitude to doctors and nurses. You are something special. In fact, you are the heroes to the core. With your efforts, we will make it through this war. You comfort this virus through day and through night. Thank you for keeping your compassion alive. We are so grateful and proud. All we want to say it out loud. The world says, thank you for your service, the lives you are saving. Thanks for all storms you braving. The nurses and the doctors, we are stand behind you strong. This fight is long, but from your courage and bravery, we say thank you for your service from core of our heart. Thank you.
My name is Hudail Das. I am for a St. Columbus School 20 class. I can't even go to school. This is the new rule. No friends, not even a hug. Be careful of a strange word. But my mom told me, the doctor, you see, Corona say, the Rona. Just toilet it, all will be well. Doctors and nurses work so hard, day and night. From their family, they stay apart. And how they there and how they rest. Because the sick ones take care. You are healthy, you are wise. Someone, somewhere has paid a price. So remember to do silent prayer to people who have shown such care. Thank you. We love you.
Dear God, when the times were dark and the virus spread, they stood their ground and the fight back they led. We all sat at home, knowing not what to do, but they went to work to fight this virus that was new. So many of us fell sick, so many of us died, but through all the sadness and uncertainty, their grit and determination survived. We feared for our loved ones and all whom we called dear, but they left their loved ones at home to hold our sick family members near. So many of us got well and happily went home, but some of them died caring for us and we never took a moment to mourn. So here we are standing and saluting the services they provide. These doctors and nurses, they are your angels in human disguise. So protect them and bless them, God, and their families too. For this prayer might be too small to say thank you. Amen.
Good day to all. My name is Johan Mervin, Class 3 from St. Columbus School, Delhi. I am here to recite a poem to show my gratitude to all the Corona warriors. This is my way of saying thank you for their relentless services, hard work and sacrifices. My poem is titled A Grateful Heart. They call it COVID-19, a tiny virus, but very mean. It took away all the fun and kills people without a gun. I'm scared, full of fear. 2020 is an awful year. To be safe, do a little task.
wash our hands, wear a mask. We are saved from this curse only by a doctor and a nurse. So do not fret, do not fear. For every devil there's a savior. Say hip hip hooray, for they work night and day. Every day they go that extra mile, so we can be safe and still smile. My grateful heart says thank you for saving me and you and you. Thank you.
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया. Thank you.
अपना सुकून भूलकर वो सबकी जान बचाते हैं। भूख प्यास भूलकर वो डॉक्टर होने का फर्ज निभाते हैं।
Someone has rightly said, as God cannot be everywhere, so He has sent doctors for us.
You are risking your life at every moment. You are not afraid of this pandemic.
ਤੁਹਾਨੂੰ ਦਿਲੋਂ ਧੰਨਵਾਦ ਕਰਦੇ ਹਾਂ ਕਿ ਤੁਸੀਂ ਇਸ ਮੁਸ਼ਕਿਲ ਵੇਲੇ ਆਪਣੀ ਪਰਸਨਲ ਲਾਈਫ ਆਪਣੀ ਫੈਮਲੀਜ਼ ਨੂੰ ਪਿੱਛੇ ਛੱਡ ਕੇ ਸਾਡੇ ਲਈ ਔਨ ਫੀਲਡ ਡਿਊਟੀ ਤੇ હંમેશા અવેલેબલ હો.
આવી મહામારીએ અમને અહેસાસ દિલાવ્યો છે કે તમે ભગવાનના એક રૂપ છો.
Thank you will never seem enough, but we will say it anyways. Thank you for your countless hours, your unwavering dedication, and the boundless talent that you possess.
माना वो डॉक्टर है, बेशक कोई भगवान नहीं, मगर डॉक्टर का डॉक्टर होना इतना भी आसान नहीं.
I'd like to sincerely pay my gratitude and thank the whole medical fraternity, the doctors, the nurses, everyone who's been working endlessly and effortlessly in this drive to, tackle the pandemic.
Coronavirus, something which we never heard of, something that was totally new to every one of us, even to the doctors. But still, doctors came ahead, they fought this battle, they conquered this battle.
Thank you so much, doctors, that you are there so that we can stay safely at our home.
दिल से आपका शुक्रिया.
દિલો ધન્યવાદ. God bless you. Thank you.
અમે તમારું ખૂબ ખૂબ આભાર માનીએ છીએ. તમારું ખૂબ ખૂબ ધન્યવાદ.
Thank you so much, doctors, for being there.
And I hope you keep continuing the great work. Thank you so much.
We salute all the doctors out there.
We love you, doctors.
Thank you, doctors.
माँ हमें जन्म देती है तो कई बार डॉक्टर हमें पुनर्जन्म देता है.
संकट की इस घड़ी में अस्पतालों में इस समय सफेद कपड़ों में दिख रहे डॉक्टर नर्स ईश्वर का ही रूप है. अपने जीवन को खतरों में डाल करके ये लोग हमारा जीवन बचा रहे हैं. डॉक्टर जिंदगी बचाते हैं और हम उनका ऋण कभी नहीं उतार सकते. ये हम सबका दायित्व है कि जो देश की सेवा करते हैं, जो देश के लिए खुद को खपाते हैं, उनका सार्वजनिक सम्मान हर पल होते रहना चाहिए.
Artist, Asian Research and Training Institute of Skill Transfer based out of Bengaluru, India, has a great mix of specialists, researchers, academicians, advocacy experts, public health experts, and the technology experts, bringing everybody on the platform to connect.
Good morning everyone. Annasanghi from class 2C, and today I am going to recite a poem on a wonderful doctors who are serious. For the title doctor is an honor. It is true, fruition of life achieved by just a few. It's a journey that has brought you to this time and to this place where you can make a difference with each challenge that you face. The knowledge in and of itself is just a part thing that makes you special. Your kind and gentle heart, and when a doctor cares as much sincerely you do, the world becomes a better place, no doubt, because of. Thank you.
My name is Siddharth Suri. I am from class 3C of St. Columbus School. Gratitude to doctors and nurses. You are something special. In fact, you are the heroes to the core. With your efforts, we will make it through this war. You comfort this virus through day and through night. Thank you for keeping your compassion alive. We are so grateful and proud. All we want to say it out loud. The world says, thank you for your service, the lives you are saving. Thanks for all storms you braving. The nurses and the doctors, we are stand behind you strong. This fight is long, but from your courage and bravery, we say thank you for your service from core of our heart. Thank you.
My name is Hudail Das. I am for a St. Columbus School 20 class. I can't even go to school. This is the new rule. No friends, not even a hug. Be careful of a strange word. But my mom told me, hey, the doctor, you see, the Rona say, the Rona. Just toilet it, all will be well. Doctors and nurses work so hard, day and night. From their family, they stay apart. And how they there and how they rest. Because the sick ones take care. You are healthy, you are wise. Someone, somewhere has paid a price. So remember to do silent prayer to people who have shown such care. Thank you. We love you.
Dear God, when the times were dark and the power spread, they stood their ground and the fight back they led. We all sat at home, knowing not what to do, but they went to work to fight this virus that was new. So many of us fell sick, so many of us died, but through all the sadness and uncertainty, their grit and determination survived. We feared for our loved ones and all whom we called dear, but they left their loved ones at home to hold our sick family members near. So many of us got well and happily went home, but some of them died caring for us and we never took a moment to mourn. So here we are standing and saluting the services they provide. These doctors and nurses, they are your angels in human disguise. So protect them and bless them, God, and their families too. For this prayer might be too small to say thank you. Amen.
Good day to all. My name is Johan Mervin, Class 3 from St. Columbus School, Delhi. I am here to recite a poem to show my gratitude to all the Corona warriors. This is my way of saying thank you for their relentless services, hard work and sacrifices. My poem is titled A Grateful Heart. They call it COVID-19, a tiny virus, but very mean. It took away all the fun and kills people without a gun. I'm scared, full of fear. 2020 is an awful year.
To be safe, do a little task. Wash your hands, wear a mask. We are saved from this curse only by a doctor and a nurse. So do not fret, do not fear. For every devil there's a savior. Say hip hip hooray, for they work night and day. Every day they go that extra mile, so we can be safe and still smile. My grateful heart says thank you for saving me and you and you. Thank you.
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया. Thank you.
अपना सुकून भूलकर वो सबकी जान बचाते हैं। भूख प्यास भूलकर वो डॉक्टर होने का फर्ज निभाते हैं।
Someone has rightly said, as God cannot be everywhere, so He has sent doctors for us.
You are risking your life at every moment. You are not afraid of this pandemic.
ਤੁਹਾਨੂੰ ਦਿਲੋਂ ਧੰਨਵਾਦ ਕਰਦੇ ਹਾਂ ਕਿ ਤੁਸੀਂ ਇਸ ਮੁਸ਼ਕਿਲ ਵੇਲੇ ਆਪਣੀ ਪਰਸਨਲ ਲਾਈਫ ਆਪਣੀ ਫੈਮਲੀਜ਼ ਨੂੰ ਪਿੱਛੇ ਛੱਡ ਕੇ ਸਾਡੇ ਲਈ ਔਨ ਫੀਲਡ ਡਿਊਟੀ ਤੇ હંમેશા અવેલેબલ હો.
આવી મહામારીએ અમને અહેસાસ દિલાવ્યો છે કે તમે ભગવાનના એક રૂપ છો.
Thank you will never seem enough, but we will say it anyways. Thank you for your countless hours, your unwavering dedication, and the boundless talent that you possess.
माना वो डॉक्टर है, बेशक कोई भगवान नहीं, मगर डॉक्टर का डॉक्टर होना इतना भी आसान नहीं.
I'd like to sincerely pay my gratitude and thank the whole medical fraternity, the doctors, the nurses, everyone who's been working endlessly and effortlessly in this drive to, tackle the pandemic.
Coronavirus, something which we never heard of, something that was totally new to every one of us, even to the doctors. But still, doctors came ahead, they fought this battle, they conquered this battle.
Thank you so much, doctors, that you are there so that we can stay safely at our home.
દિલ સે આપકા શુક્રિયા.
દિલો ધન્યવાદ. God bless you. Thank you.
અમે તમારું ખૂબ ખૂબ આભાર માનીએ છીએ. તમારું ખૂબ ખૂબ ધન્યવાદ.
Thank you so much, doctors, for being there.
And I hope you keep continuing the great work. Thank you so much.
We salute all the doctors out there.
We love you, doctors.
Thank you, doctors.
माँ हमें जन्म देती है तो कई बार डॉक्टर हमें पुनर्जन्म देता है.
संकट की इस घड़ी में अस्पतालों में इस समय सफेद कपड़ों में दिख रहे डॉक्टर नर्स ईश्वर का ही रूप है. अपने जीवन को खतरों में डाल करके ये लोग हमारा जीवन बचा रहे हैं. डॉक्टर जिंदगी बचाते हैं और हम उनका ऋण कभी नहीं उतार सकते. ये हम सबका दायित्व है कि जो देश की सेवा करते हैं, जो देश के लिए खुद को खपाते हैं, उनका सार्वजनिक सम्मान हर पल होते रहना चाहिए.
Artist, Asian Research and Training Institute of Skill Transfer, based out of Bangalore, India, has a great mix of specialists, researchers, academicians, advocacy experts, public health experts, and the technology experts, bringing everybody on the platform to connect.
Good morning, everyone. I'm Anna
Sangi from class 2C, and today I am going to recite a poem on a wonderful doctors who are serious. So on the title Doctor is an honor. It is true fruition of life achieved by just a few. It's a journey that has brought you to this time and to this place where you can make a difference with each challenge that you face. The knowledge in and of itself is just a part thing that makes you special. Your kind and gentle heart, and when your doctor cares as much sincerely you do, the world becomes a better place, no doubt, because of. Thank you.
My name is Siddharth Suri. I am from class 3C of St. Columbus School. Gratitude to doctors and nurses. You are something special. In fact, you are the heroes to the core. With your efforts, we will make it through this war. You comfort this virus through day and through night. Thank you for keeping your compassion alive. We are so grateful and proud. All we want to say it out loud. The world says, thank you for your service, the lives you are saving. Thanks for all storms you braving. The nurses and the doctors, we are stand behind you strong. This fight is long, but from your courage and bravery, we say thank you for your service from core of our heart. Thank you.
My name is Hudail Das. I am for a St. Columbus School 20 class. I can't even go to school. This is the new rule. No friends, not even a hug. Be careful of a strange word. But my mom told me, hey, the doctor, you see, the Rona say, the Rona. Just toilet it, all will be well. Doctors and nurses work so hard, day and night. From their family, they stay apart. And how they there and how they rest. Because the sick ones take care. You are healthy, you are wise. Someone, somewhere has paid a price. So remember to do silent prayer for people who have shown such care. Thank you. We love you.
Dear God, when the times were dark and the power spread, they stood their ground and the fight back they led. We all sat at home, knowing not what to do, but they went to work to fight this virus that was new. So many of us fell sick, so many of us died, but through all the sadness and uncertainty, their grit and determination survived. We feared for our loved ones and all whom we called dear, but they left their loved ones at home to hold our sick family members near. So many of us got well and happily went home, but some of them died caring for us and we never took a moment to mourn. So here we are standing and saluting the services they provide. These doctors and nurses, they are your angels in human disguise. So protect them and bless them, God, and their families too. For this prayer might be too small to say thank you. Amen.
Good day to all. My name is Johan Mervin, Class 3 from St. Columbus School, Delhi. I am here to recite a poem to show my gratitude to all the Corona warriors. This is my way of saying thank you for their relentless services, hard work and sacrifices. My poem is titled A Grateful Heart. They call it COVID-19, a tiny virus, but very mean. It took away all the fun and kills people without a gun. I'm scared, full of fear. 2020 is an awful year. to be safe. Do a little task. Wash your hands, wear a mask. We are saved from this curse only by a doctor and a nurse. So do not fret, do not fear. For every devil there's a savior. Say hip hip hooray, for they work night and day. Every day they go that extra mile, so we can be safe and still smile. My grateful heart says thank you for saving me and you and you. Thank you.
Hi, my name is Padamji Chelawat, and I thought of dedicating a special anthem, a song for the real Corona warriors, the heroes, doctors, the nurses, the medical staff, for their tireless, selfless service. Thank you. You are the real heroes. जो मैंने लिखा गाया कंपोज किया वही है. काम निस्वार्थ किया क्या बात है, मुश्किल में डटे रहे क्या बात है, खुद की नहीं परवाह की, क्योंकि पेशेंट्स के हेल्थ की चिंता थी. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. शब्दों में शायद न कह पाएंगे, शब्दों में शायद न कह पाएंगे, आपके ऋणी सदा खुद को पाएंगे. सांस खुद की भी थी दांव पर, डगमगाए नहीं पर तेरे पांव थे. डॉक्टर्स, नर्सेस, मेडिकल स्टाफ, आपका शुक्रिया, आपका शुक्रिया. You are the real heroes, आपका शुक्रिया. Thank you.
अपना सुकून भूलकर वो सबकी जान बचाते हैं। भूख प्यास भूलकर वो डॉक्टर होने का फर्ज निभाते हैं।
Someone has rightly said, as God cannot be everywhere, so He has sent doctors for us.
You are risking your life at every moment. You are not afraid of this pandemic.
ਤੁਹਾਨੂੰ ਦਿਲੋਂ ਧੰਨਵਾਦ ਕਰਦੇ ਹਾਂ ਕਿ ਤੁਸੀਂ ਇਸ ਮੁਸ਼ਕਿਲ ਵੇਲੇ ਆਪਣੀ ਪਰਸਨਲ ਲਾਈਫ ਆਪਣੀ ਫੈਮਲੀਜ਼ ਨੂੰ ਪਿੱਛੇ ਛੱਡ ਕੇ ਸਾਡੇ ਲਈ ਔਨ ਫੀਲਡ ਡਿਊਟੀ ਤੇ હંમેશા અવેલેબલ હો.
આવી મહામારીએ અમને અહેસાસ દિલાવ્યો છે કે તમે ભગવાનના એક રૂપ છો.
Thank you will never seem enough, but we will say it anyways. Thank you for your countless hours, your unwavering dedication, and the boundless talent that you possess.
माना वो डॉक्टर है, बेशक कोई भगवान नहीं, मगर डॉक्टर का डॉक्टर होना इतना भी आसान नहीं.
I'd like to sincerely pay my gratitude and thank the whole medical fraternity, the doctors, the nurses, everyone who's been working endlessly and effortlessly in this drive to, tackle the pandemic.
Coronavirus, something which we never heard of, something that was totally new to every one of us, even to the doctors. But still, doctors came ahead, they fought this battle, they conquered this battle.
Thank you so much, doctors, that you are there so that we can stay safely at our home.
दिल से आपका शुक्रिया.
દિલો ધન્યવાદ. God bless you. Thank you.
અમે તમારું ખૂબ ખૂબ આભાર માનીએ છીએ. તમારું ખૂબ ખૂબ ધન્યવાદ.
Thank you so much, doctors, for being there.
And I hope you keep continuing the great work. Thank you so much.
We salute all the doctors out there.
We love you, doctors.
Thank you, doctors.
माँ हमें जन्म देती है तो कई बार डॉक्टर हमें पुनर्जन्म देता है.
संकट की इस घड़ी में अस्पतालों में इस समय सफेद कपड़ों में दिख रहे डॉक्टर नर्स ईश्वर का ही रूप है. अपने जीवन को खतरों में डाल करके ये लोग हमारा जीवन बचा रहे हैं. डॉक्टर जिंदगी बचाते हैं और हम उनका ऋण कभी नहीं उतार सकते. ये हम सबका दायित्व है कि जो देश की सेवा करते हैं, जो देश के लिए खुद को खपाते हैं, उनका सार्वजनिक सम्मान हर पल होते रहना चाहिए.
Artist, Asian Research and Training Institute of Skill Transfer, based out of Bangalore, India, has a great mix of specialists, researchers, academicians, advocacy experts, public health experts, and the technology experts, bringing everybody on the platform to connect.
Good morning, everyone, I'm Anna Sangi from class 2C and today I'm going to recite a poem on a wonderful doctors who are our seniors. So the title doctor is an honor. It is true, fruition of life achieved by just a few. It's a journey that has brought you to this time and to this place where you can make the difference with each challenge that you face. The knowledge in and of itself is just a part thing that makes you special. Your kind and gentle heart, and when your doctor cares as much sincerely you do, the world becomes a better place, no doubt, because of. Thank you.
My name is Siddharth Suri. I am from class 3C of St. Columbus School. Gratitude to doctors and nurses. You are something special. In fact, you are the heroes to the core. With your efforts, we will make it through this war. You convert this virus through day and through night. Thank you for keeping your compassion alive. We are so grateful and proud. All we want to say it out loud. The world says, thank you for your service, the lives you are saving. Thanks for all storms you braving. The nurses and the doctors, we are stand behind you strong. This fight is long, but from your courage and bravery, we say thank you for your service from core of our heart. Thank you.
My name is Hutel Das. I am for a St. Columbus School 20 class. I can't even go to school. This is the new rule. No friends, not even a hug. Be careful of a range or my mom told me, hey, the doctor, you see, Corona say, the Rona. Just toilet it. All will be well. Doctors and nurses work so hard, day and night. From their family, they stay apart. And how they dare and how they rest. Because the sick ones take care. You are healthy, you are wise. Someone, somewhere has paid a price. So remember to do silent prayer to people who have shown such care. Thank you. We love you.
Dear God, when the times were dark and the virus spread, they stood their ground and the fight back they led. We all sat at home, knowing not what to do, but they went to work to fight this virus that was new. So many of us fell sick, so many of us died, but through all the sadness and uncertainty, their grit and determination survived. We feared for our loved ones and all whom we called dear, but they left their loved ones at home to hold our sick family members near. So many of us got well and happily went home, but some of them died caring for us and we never took a moment to mourn. So here we are standing and saluting the services they provide. These doctors and nurses, they are your angels in human disguise. So protect them and bless them, God, and their families too. For this prayer might be too small to say thank you. Amen.
Good day to all. My name is Johan Mervin, Class 3 from St. Columbus School, Delhi. I am here to recite a poem to show my gratitude to all the Corona warriors. This is my way of saying thank you for their relentless services, hard work and sacrifices. My poem is titled A Grateful Heart. They call it COVID-19, a tiny virus, but very mean. It took away all the fun and kills people without a gun. I'm scared, full of fear,
2020 is an awful year. To be safe, do a little task. Wash your hands, wear a mask. We are saved from this curse only by a doctor and a nurse. So do not fret, do not fear. For every devil there's a savior. Say hip hip hooray, for they work night and day. Every day they go that extra mile, so we can be safe and still smile. My grateful heart says thank you for saving me and you and you. Thank you.
We are winding down the Gratitude Week. Over the last 1 week, we have heard extraordinary stories of selfless duty, determination, and heroism from scores of medical professionals. We took one day that is celebrated world over as Doctors' Day and expanded it to a Thanksgiving week. But this initiative of the Integrated Health and Wellbeing Council isn't meant to last only a week. This is an attempt to bring everybody together to show a never seen before emotional and social support to our doctors, nurses, and our entire healthcare ecosystem. This Thanksgiving marathon has given us a chance to thank our healthcare heroes and carry this gratitude in our hearts, not just for a day, not just for a week, but forever. I would request Kamal Narayan Umar, the CEO of IHW Council and the man who has conceptualized and executed the Gratitude Week for Health Guardians, to please address everyone and speak to us about his vision for the Gratitude Week.
Thank you so much, Anisa, for your kind introduction. And I again welcome from the bottom of my heart all our guests who have joined us this evening. And actually, this has been a wonderful journey for last 7 days. We decided to celebrate this as a gratitude week, and I'm really humbled that Honorable Union Minister for State for Social Justice, Sri Ramdas Athawaleji, has joined us on this very, very important occasion where we are ending our 7 days long, 60 hours long, this gratitude marathon. And, my connection may be a little, disturbed because we are, facing a, electricity disruption at my place. So, but still, the good part is that despite all these hindrances, we have been able to continue this very unusual initiative which we tried to took, and it is an humble initiative of ISW Council, Integrated Health and Wellbeing Council, where we are trying to highlight the efforts, the hard work, the sacrifices which our healthcare workers have been always putting in, and trying to bring in as much support to the society as possible. The coronavirus pandemic time in last 4 months have been very, very taxing, very, very unusual. But our healthcare professional rose up to that occasion, and they ensured that the continuity of healthcare is not disrupted. I would also, introduce our esteemed guests who have joined us this evening. We have Dr. Hema Divakar. She is the former president of Foxy. She is head of artist. She has joined us from Bangalore. We have Dr. Rishikesh Pai, who is a legendary IVF expert and a very, very renowned healthcare practitioner. I welcome Dr. Pai also. We have Dr. Nimish G. Desai, one of the finest champion of mental health. So thank you so much, Dr. Desai, for joining. We have Dr. Suchin Bajaj with us.
Glad to be here, sir.
Co-founder and director of Ujala Cygnus Hospital, who is actually a corona fighter himself and is providing care on the COVID-19 wards and running a lot of beds for the COVID-19 patients. We also have with us Professor Ravi Kant. He is the director of AIMS in Rishikesh. So thank you so much, Professor Ravi Kant. You all are frontline warriors who are doing really a wonderful work this nation and the whole humanity. We are also joined with Mr. Sanjeev Nawangul. He is the managing director of Bharat Serum, and the company which is also doing advanced trial of COVID-19 medicine. So thank you so much, Mr. Nawangul, for joining us. We have Dr. Dhamija from the Lady Harding Hospital in Delhi. So thank you so much, Dr. Dhamija. Dr. T.S. Clare, a very renowned cardiologist, is also with us. And Jyotsna Govil, who is a senior official at the Indian Cancer Society. All our guests, thank you so much for joining. And these are also people whose support and encouragement helped us to put together the 60-hour-long marathon, which we are continuing from July 1. And we also have Mr. Prabhat Sinha from Innova. So, and we will be joined by more people in due time, course of time during the next 1.5 hours of this closing ceremony. So I'll go and I'll request now our Honorable Minister, Sri Ramdas Athawale to say a few words and also highlight, what has been his, thousands of people trying to address this COVID-19 problem over the last 4 months. Honorable Minister. He's I think he's on phone, so he'll be connecting shortly. So we have also got Dr. Debashish Danda with us. He's widely considered as a father of rheumatology in a manner in India. He has joined us from the CMC Vellore, and he is heading the immunology and rheumatology department there. And we also have Dr. P.P. Mohanan. He is the president-elect of Cardiology Society of India. So we are really humbled with the kind of support we got over the last 60 days, and I believe that this will help reaching out to a lot of people and help making them aware that the efforts which our healthcare practitioners are doing, and they are really making some the finest sacrifice which can happen. So Honorable Minister रामदास अठावले जी, मैं आपसे रिक्वेस्ट करूंगा कि आप 2 शब्द कहें, और जो आपने आप प्राइम मिनिस्टर नरेंद्र मोदी की लीडरशिप में पूरी सरकार ने बहुत अच्छे से इस पैंडेमिक को एड्रेस करने की कोशिश की, और आप लोगों के एनकरेजमेंट से हेल्थ केयर वर्कर्स ने अपना बेस्ट करने की कोशिश की। तो माननीय मंत्री जी, आपकी उद्बोधन।
एक बहुत ही अच्छी बात है कि आपने 7 दिनों से चर्चा रखी, जो कोविड-19 है ये अपने देश में 2020 में आया, और ये कोरोना का बहुत बड़ा इम्पैक्ट पूरी दुनिया भर में हुआ है। दुनिया भर के 190 कंट्रीज में कोरोना जाकर पहुंचा है। अभी तक 5.5 लाख से भी ज्यादा लोगों की मृत्यु हो चुकी है। अपना इंडिया भी अभी नंबर 3 पर आ गया है। इंडिया में भी बहुत सारी केसेस बढ़ती जा रही है। लेकिन एक बहुत ही अच्छी बात है कि आपने 7 दिनों से अलग अलग एक्सपर्ट के माध्यम से आपने चर्चा की है, और बहुत सारी जानकारी आप लोगों ने ले ली है, और लगातार 7 दिनों में कई लोगों ने अपने अपने विचार अपने विचार उन्होंने रखे हैं, और कोरोना वायरस का सामना कैसा करना चाहिए, लॉकडाउन से अपना कितना फायदा हुआ, कितना नुकसान हुआ, लोगों की जान बचाने का फायदा बहुत बड़ा हुआ है। लेकिन अपनी इकोनॉमी पूरी कोलैप्स हो गई, बात सही है। मजदूरों की हालत बहुत बड़ी बुरी है, और अलग अलग क्षेत्र में काम करने वाले जो लोग थे, होटल कामगार है, हॉल में काम करने वाले हैं, टीम में काम करने वाले हैं, कंपनी में काम करने वाले हैं, ऐसे कई जगह पर काम करने वाले करोड़ों जो हमारे मजदूर थे या काम करने वाले लोग थे, उनका काम पूरा बंद हो गया। और माननीय प्रधानमंत्री नरेंद्र मोदी जी को ये लॉकडाउन का जो पीरियड है ये बढ़ाने की जरूरी इसलिए पड़ी कि हमें हमारे लोगों की जान बचाने की आवश्यकता थी। अपने देश की जो आबादी ये 134 करोड़ की है। अमेरिका की आबादी 40 करोड़ है, लेकिन वहाँ बहुत सारे कोरोना पेशेंट मिले, लेकिन उसके कंपैरिजन में अपने पॉपुलेशन के हिसाब से अगर देखा जाए तो मुझे लगता है कि अपने आंकड़े बहुत कम है। मुझे अभी तक 16,000 से ज्यादा लोगों की मौत अपने इंडिया में हो चुकी है। उसमें हमारे महाराष्ट्र में ही कम से कम 8,000 से ज्यादा लोगों की मौत हो चुकी है। और मतलब ये कोरोना मतलब बढ़ता जा रहा है। इस तरह मैंने पहले भी बोला कि इंडिया का नंबर अभी 3 नंबर पर इंडिया है। आंकड़े के मुताबिक जो 6 लाख से ज्यादा संख्या जो कोरोना के पेशेंट की अपने देश में है, और अपने देश में मतलब अच्छे होने वाले लोगों की भी संख्या बहुत बड़ी है। 54% से भी ज्यादा लोग अपने ठीक ठाक हो रहे हैं। तो अच्छी बात है कि मतलब लोग ठीक भी हो रहे हैं, लेकिन कोरोना एक बार हो गया तो क्या हो जाएगा इसका भरोसा नहीं है। लेकिन अगर हमारा आत्मविश्वास अच्छा रहेगा, अगर हम हमारा मनोबल अगर मजबूत करेंगे, मुझे लगता है कि माननीय प्रधानमंत्री जी ने सबको सूचना दी है कि हमें अपनी जिंदगी बहुत बड़ी प्यारी है। इकोनॉमी हमारी एकदम कोलैप्स हो गई है, लेकिन उसको और भी उठाने के लिए कोशिश हम करेंगे। अगर हम जिंदा रहेंगे तो हमारा धंधा हम अच्छा बनाएंगे। और माननीय प्रधानमंत्री जी ने आत्मनिर्भर भारत की भूमिका कोरोना का जब इतना बड़ा सामना हम करते रहे, लॉकडाउन बढ़ता रहा और लगातार 3 महीने से 3.5 महीने से लॉकडाउन चलता रहा, तो मुझे लगता है कि देश की इकोनॉमी बहुत बड़ी नीचे आ गई है और उसको सुधारना बहुत बड़ा मतलब जल्दी इम्प्रूव होना बहुत बड़ा मुश्किल है। लेकिन उसके बावजूद भी आत्मनिर्भर भारत की भूमिका माननीय प्रधानमंत्री जी ने रखी है। चाइना ने जब हमें बहुत बड़ा धोखा दे दिया, तो चाइना से होने वाला जो इम्पोर्ट जो माल है, तो वो प्रोडक्ट पूरा हम अगर शुरू करेंगे तो देश की इकोनॉमी में काफी सुधार आ सकता है, जीडीपी में बहुत बड़ा सुधार आ सकता है और अपने देश में मतलब हम हमारे बलबूते पर खड़े रह सकते हैं। अमेरिका जैसा बड़ा देश भी अपने साथ है, रशिया अपने साथ है और फ्रांस अपने साथ है। कई देश ने मतलब जब चाइना ने हमें रोका तो जल्दी से मतलब हमारे 20 नौजवानों की हत्या की, तो उसके बाद बहुत सारे दुनिया भर के लोगों ने अपने को सपोर्ट किया है। और अभी इंडिया ने जब अपनी ताकत दिखाने की कोशिश की, मतलब अब हमारे तो 20 नौजवान शहीद हुए हैं, तो उनके भी बहुत सारे लोग मतलब उनकी हत्या अपने आर्मी के माध्यम से हुई है। तो मतलब इसीलिए हम कोई कम है ऐसा बिल्कुल नहीं है। इसीलिए मुझे लगता है कि अभी कोरोना के माध्यम से हमें माननीय प्रधानमंत्री जी ने शुरू में 1,70,000 करोड़ रुपए हमारे मजदूरों के अनाज के लिए फ्री चावल देने का निर्णय ले लिया था और कम से कम 80 करोड़ लोगों को उसका फायदा हुआ है। अभी माननीय प्रधानमंत्री जी ने नवंबर तक, दिवाली तक मतलब फ्री में चावल और दाल सभी लोगों को 80 करोड़ लोगों को देने का निर्णय ले लिया है। और अभी 1 नेशन 1 रेशन कार्ड, मतलब पहले तो मतलब बीपीएल का कार्ड होता था, एपीएल का कार्ड होता था, लेकिन अभी एक ही कार्ड सबके लिए रहेगा और सबको मतलब ज्यादा ज्यादा सुविधा देने की भूमिका माननीय प्रधानमंत्री जी की है। माननीय प्रधानमंत्री जी ने 20 लाख करोड़ रुपया का जो पैकेज है, ये पैकेज उन्होंने अनाउंस कर दिया है और अलग अलग क्षेत्र में कुटीर उद्योग है, लघु उद्योग है, मध्यम उद्योग है, ऐसे सभी उद्योगों के लिए उन्होंने मतलब बहुत सारा जो मदद है, ये मदद उन्होंने मतलब पूरे अलग अलग क्षेत्र के लिए मदद उन्होंने अनाउंस की है। तो भारत सरकार की तरफ से तो मदद हो रही है, लेकिन हमें अगर जो एनआरआई के लोग, कल मैंने दुबई के और अमेरिका के, लंदन के लोगों से मैंने बात की, एक वीडियो कॉन्फ्रेंस का प्रोग्राम था, तो उन्होंने पूछा था कि भाई एनआरआई के लोगों को क्या सुविधा मिल सकती है। तो हमने बताया कि भाई एनआरआई के लोग अगर इंडिया में आकर अपना बिजनेस शुरू करना चाहते हैं, तो भारत सरकार उनको पूरा सहयोग देने का काम न करेगी। उनको लैंड देने के लिए राज्य सरकार की बात करेगी। उनको अगर कोई बैंक से लोन चाहिए तो वो लोन के लिए भी मतलब वो कोशिश करेगी। उसका भी जो उनके पास जो पैसा है वो भी अगर उसमें डालते हैं तो मतलब उनको उस फैक्ट्री के लिए पूरी मदद करने का काम हमारी भारत सरकार की तरफ से करेगी। तो इसी तरह मतलब मुझे लगता है कि आत्मनिर्भर भारत की भूमिका जो प्रधानमंत्री जी ने रखी है तो हम हमारे बलबूते पर खड़ा रहेगी। चाइना से कोई माल हम नहीं मंगाएगी और भी देशों से कोई मांग नहीं मंगाएगी। हम हमारे देश में पूरा प्रोडक्ट तैयार करेंगे और हम अपने देश को मजबूत करने की कोशिश करेंगे। तो मुझे लगता है कि कोरोना से बहुत सारे पेशेंट ठीक हो रहे हैं। उसमें डॉक्टर है, नर्सेज है, वार्ड बॉय है और हमारे म्यूनसिपालिटी के वर्कर है और हमारे पुलिस के लोग है। जो लॉकडाउन का पालन जो लोग नहीं करते हैं उनको उन्होंने मतलब लॉकडाउन का पालन करने के लिए मतलब उन्होंने बहुत सारा एक्शन भी ले लिया था। तो उसमें मतलब मुझे लगता है कि जो लोग कोरोना के माध्यम से ड्यूटी करते वक्त अगर वो अगर उनकी डेथ हो जाती है तो उनको 50 लाख का जो इंश्योरेंस है ये भी मतलब उनको निर्णय सरकार ने ले लिया है। उसी तरह मुझे लगता है कि जो आपने जो 7 दिनों में बहुत सारे डॉक्टर्स ने इसमें भाग ले लिया है और डॉक्टर ने बहुत ही अच्छी तरह सभी लोगों को मदद की है और बहुत सारे लोगों की जिंदगी को बचाने का काम उन्होंने किया है। तो सभी डॉक्टरों का मैं आभार व्यक्त करता हूँ जिन्होंने इस कोरोना के साथ युद्ध करने में जो मदद की है। बहुत सारे पेशेंट को जीवदान दे दिया है। ऐसे लोगों को ऐसे सभी डॉक्टरों का मैं आभार व्यक्त करता हूँ, नर्सेज का आभार व्यक्त करता हूँ। और आपने 7 दिनों में जो बहुत अच्छी तरह चर्चा आपने की है तो मुझे लगता है कि जो जो इंटीग्रेटेड हेल्थ एंड वेलबींग काउंसिल के द्वारा जो आयोजित डॉक्टर डे जो है ये डॉक्टर्स डे जो है ये बहुत सारे डॉक्टरों ने अपनी जिंदगी का विचार न करते हुए उन्होंने लोगों की सेवा की, बहुत सारे लोगों को जीवदान दे दिया है। उसमें कई डॉक्टरों की मृत्यु हो चुकी है और बहुत सारे पुलिस वालों की मृत्यु हो चुकी है, म्यूनसिपालिटी के वर्कर की मृत्यु हो चुकी है, कुछ नर्सेज की और वार्ड बॉय की भी मृत्यु हो चुकी है। तो मुझे लगता है कि ये लोगों ने बहुत बड़ा काम किया है और अपने देश में इम्प्रूव होने वालों का वो रेट बहुत अच्छा है। बहुत सारे लोग ठीक ठाक हो रहे हैं। तो मुझे लगता है कि एक आपने ये जो हमारे कमल नारायण जी जो आप मतलब है और अपने संबंध बहुत बड़े अच्छे हैं। बहुत बार आपके सेमिनार में आपने मुझे बुलाया है और ये आपका नाम कमल है और नरेंद्र मोदी जी की निशानी कमल है। तो इसीलिए मतलब हम सब लोग मिलकर आगे बढ़ेंगे और आपसे हमारे अच्छे संबंध रहे हैं। तो आपने 7 दिनों तक मतलब ये वीडियो कॉन्फ्रेंस द्वारा जो चर्चा रखी और उसमें बहुत सारे लोगों को अच्छी तरह अपने विचार रखे और डॉक्टर के डे के दिन से मतलब आपने चर्चा रखी। तो डॉक्टर डे के अवसर पर मैं सभी डॉक्टरों को हार्दिक बधाई देता हूँ और आप डॉक्टर अगर हमारे साथ रहेंगे तो हमारी जिंदगी को बहुत ही सुंदर बनाने के लिए आपका अच्छा उपयोग हो सकता है। आपकी दवा से हम जिंदा रह सकते हैं और इसी तरह मतलब डॉक्टर डे के अवसर पर मैं सभी डॉक्टरों को हार्दिक बधाई देता हूँ। और कमल नारायण जी जिन्होंने मुझे आज यहाँ निमंत्रित किया और आपने आग्रह किया था कि आज जो इसका समापन हो रहा है, समारोह हो रहा है, उसमें मेरे कुछ विचार आपने रखने का एक आग्रह आपने किया था। तो वैसे आपका 4 बजे का टाइम था लेकिन मैंने आपको बोला कि 3:30 बजे आपको एक प्रोग्राम स्टार्ट करो। तो उसी तरह आज आपकी इसमें इस वीडियो कॉन्फ्रेंस द्वारा आयोजित इस सेमिनार में मुझे अपने विचार रखने का मौका मुझे मिला है। इसलिए मैं आप कमल नारायण जी और जो भी पार्टिसिपेट हो रहे हैं उन्होंने पार्टिसिपेशन मतलब इसमें 7 दिनों में किया है तो सबका मैं हार्दिक आभार व्यक्त करता हूँ। और बहुत सारे जो लोग हैं इसमें डॉक्टर हेमा दिवाकर है, प्रकृति पोदार है, डॉक्टर देवाजू लता जी है, और डॉक्टर सुशील बजाज, रोहित पोद्दार, डॉक्टर सोनिया मलिक, डॉक्टर मीरा अग्निहोत्री, डॉक्टर देसाई, प्रभात कुमार सिन्हा, और मिस्टर गोयल जी, डॉक्टर सुमित ध्रुव, संजीव जी, कई लोगों ने इसमें 7 दिनों में भाग लिया है, तो सभी का मैं धन्यवाद करता हूँ। और डॉक्टर डे के अवसर पर दुनिया के सभी डॉक्टर को, भारत के सभी डॉक्टर को मैं शुभकामना देता हूँ, हार्दिक बधाई देता हूँ। जय भीम, जय भारत।
धन्यवाद मंत्री जी, आपके इनकरेजिंग आपने उद्बोधन से हमें और इनकरेजमेंट मिलेगा, और आपका सहयोग हमेशा मिलता रहता है ISW काउंसिल को। आप बहुत सारे हमारे जो इनिशिएटिव्स हैं उनमें सहयोग करते हैं। आज मंत्री जी मैं आपको बताना चाहूंगा कि हम लोगों ने इन 7 दिनों में 2 और बड़े एक इनिशिएटिव्स लिए हैं जिनके लिए आपसे सहयोग और सपोर्ट चाहिए। कि एक तो हमारी एक मांग है जो हमने सरकार को हम भेज रहे हैं, और पीछे MOS हेल्थ और वेलफेयर के अश्विनी चौबे जी आए थे, श्रीपद नाइक जी आए थे MOS आयुष के और डिफेंस के। तो हमने उनसे भी ये रिक्वेस्ट किया था कि हम चाहते हैं कि डॉक्टर्स जैसे सोल्जर्स बॉर्डर पर लड़ते हैं और कई बार अपनी जान देते हैं देश को बचाने के लिए, आज डॉक्टर्स जो है अपनी जान दे रहे हैं देश को ही नहीं, पूरी ह्यूमैनिटी को बचाने के लिए। और इंसानी जान को बचाना सबसे बड़ा काम है, कर्तव्य है, और वो इस ड्यूटी को पूरी दिलो जान से कर रहे हैं। हमने ये रिक्वेस्ट कर रहे हैं कि अगर डॉक्टर्स के लिए, हेल्थ वर्कर्स के लिए और हेल्थ के लिए एक मेमोरियल होना चाहिए, जैसे हम देखते हैं कि वॉर मेमोरियल्स होते हैं हर जगह पर सोल्जर्स के लिए, तो ये डॉक्टर्स भी अपना बलिदान दे रहे हैं इस काम पे। तो उसको उसे जो है हमें इनकरेज करने के लिए और लोगों को ये याद दिलाए रखने के लिए कि स्वास्थ्य सबसे बड़ी चीज है। मैंने कई बार आपको सुना हमारे इवेंट्स में कि हेल्थ से बड़ी कोई वेल्थ नहीं है। तो मेरी ये रिक्वेस्ट है कि आप माननीय प्रधानमंत्री से और अपने और कलीग जो हैं सरकार में उनसे भी ये रिक्वेस्ट करें, और ये आइडिया जो है पार्लियामेंट में भी अगर हो सके तो ये आगे करें कि एक डॉक्टरों के लिए भी एक मेमोरियल होना चाहिए जिन्होंने अपनी जान दी है और जो लगातार अपने मेहनत कर रहे हैं।
हाँ, तो मतलब जिस तरह कमल आपने वो बताया है कि जिस तरह हमारे नौजवान लोग बॉर्डर पर लड़ते लड़ते जो शहीद होते हैं उनका मेमोरियल होता है, लेकिन अभी इसके पहले तो डॉक्टरों का कभी मेमोरियल ऐसा नहीं हुआ है। लेकिन कोरोना पहली बार अपने देश में आया और कोरोना योद्धा के नाम पर, कोरोना योद्धा में डॉक्टर का सबसे ज्यादा योगदान है और उनको जिंदगी देने का काम भी वो कर रहे हैं, जो देश भी हो रहे हैं उसकी भी सेवा करने का काम वो कर रहे हैं। तो कोरोना योद्धा के नाम पर अगर ये डॉक्टरों का अगर एक मेमोरियल हो जाता है बहुत ही अच्छी बात है। आपका सुझाव बहुत अच्छा है। मैं हेल्थ मिनिस्टर डॉक्टर हर्षवर्धन की बात करूंगा, माननीय प्रधानमंत्री नरेंद्र मोदी साहब को भी एक पत्र में लिखूंगा, और बहुत सारे डॉक्टरों ने लाखों लोगों की जान को बचाई है। तो इसी तरह मुझे लगता है कि अभी तक जो 6 लाख के आंकड़े हैं उसमें कम से कम, अभी मेरे पास तो अभी आंकड़ा ध्यान में नहीं, लेकिन कम से कम 4 लाख से ज्यादा लोगों की जिंदगी बचाने का काम इन लोगों ने किया है। इसलिए कोरोना योद्धा के नाम पर डॉक्टरों का एक मेमोरियल जो है, इनकी डेथ डॉक्टरों की हुई है, ऐसे डॉक्टरों का एक मेमोरियल जो है, ये मेमोरियल बनाने के लिए जरूर भारत सरकार की तरफ से जरूर हम कोशिश करेंगे। माननीय नरेंद्र मोदी जी जो प्रधानमंत्री जी है वो डॉक्टरों के बारे में बहुत अच्छी बात उन्होंने की है, करते भी है, और कोरोना योद्धा को बहुत ही अच्छा सम्मान देने का काम वो कर रहे हैं। इसी तरह मतलब भारत सरकार की तरफ से जरूर कोरोना के इस संकट में जो डॉक्टरों ने बहुत ही बड़ा योगदान दे दिया है, जिनकी डेथ हो गई है, वो भी मतलब जिस तरह बॉर्डर पर रहने वाले युद्धों में जो शहीद हमारे लोग होते हैं उसी तरह ये भी मतलब शहीद हो रहे हैं। और मैंने ये भी मांग किया है कि भाई डॉक्टरों को शहीद का दर्जा देना चाहिए। तो डॉक्टरों में भी जो कोरोना के इस संघर्ष में जो डॉक्टरों ने बहुत बड़ा योगदान दिया है और सेवा करते करते उनको भी संसर्ग हुआ और वो उनको कोरोना के संसर्ग से उनकी डेथ हो गई, तो ऐसे डॉक्टरों को भी शहीद का दर्जा दे देना चाहिए। इसी तरह की मेरे रिपब्लिकन पार्टी ऑफ इंडिया की तरफ से मेरी मांग भी है और हम इसी तरह की कोशिश करेंगे। लेकिन कोरोना योद्धा के माध्यम से ऐसे डॉक्टरों का एक मेमोरियल जो है ये करने के संबंध में जो आपका सुझाव है बहुत बेहतरीन सुझाव है और जरूर भारत सरकार के तरफ से जरूर हम ऐसी कोशिश करेंगे और राज्य सरकारों को भी, हर राज्य में जो डॉक्टरों ने काम किया है तो वो राज्य सरकार भी इसी तरह का एक आधा मेमोरियल अपने राज्य में खड़ा करने के संबंध में विचार करे। इसके लिए जरूर एज ए सोशल जस्टिस एंड एम्पावरमेंट स्टेट मिनिस्टर के नाते, एज ए नेशनल प्रेसिडेंट ऑफ रिपब्लिकन पार्टी ऑफ इंडिया के नाते, बाबा साहब अम्बेडकर जी के नाते मैं जरूर मतलब कोशिश करूंगा और जगह पर डॉक्टरों का इसी तरह का एक मेमोरियल हो। ये आपके सुझाव को मैं मान्य करता हूँ, स्वीकारता हूँ और जरूर इसी तरह का मेमोरियल जगह जगह पर खड़ा हो, ऐसा मुझे लगता है।
थैंक यू सो मच मंत्री जी, आपने बहुत ये बहुत बड़ा सहयोग होगा आपका, आपने इस बात को एक्सेप्ट किया और ना सिर्फ एक नेशनल लेवल में बल्कि आपने उसको और आगे बढ़ाते हुए ये बताया कि अगर स्टेट लेवल में भी एक एक मेमोरियल होगा तो ये जरूर देश की जनता को भी याद दिलाता रहेगा कि स्वास्थ्य और हेल्थ सबसे पहले आती है और उसी को पाने और उसको बचाए रखने के लिए हमारे सारे एफर्ट्स होने चाहिए। मंत्री जी, हम लोगों ने आज से ही एक और शुरुआत कर रहे हैं। हमने एक अपने जो बहुत सारे ऐसे डॉक्टर्स हैं जो सिर्फ कोविड-19 के समय ही नहीं, पहले उसके पहले भी, जैसे हमारे देश में करीबन 10 लाख लोग हर साल कैंसर से मरते हैं या बहुत संख्या में लोग हमारे यहाँ सबसे ज्यादा कार्डियोवास्कुलर प्रॉब्लम, दिल की प्रॉब्लम से मरते हैं और ऐसे बहुत सारे डॉक्टर हैं जो हमें हर तरीके की इन बीमारियों से बचाए रखने की कोशिश करते हैं और जब भी वो बीमारियां होती हैं तो हमें बचाते हैं। हमारे साथ कई सारे डॉक्टर्स जो मैटरनल हेल्थ में जुड़े हुए हैं, जो ये कोशिश करते हैं कि हर मदर, हर वुमेन को हेल्थ पहुंचता रहे, वो भी हैं और मेडिकल प्रोफेशनल्स हैं जो फार्मा की कंपनी में हैं। संजीव नवनगुल जी हैं, वो एक दवा का ट्रायल कर रहे हैं जिससे शायद भारत एक ऐसा देश बन जाए जो कोरोना की दवा सबसे पहले प्रोवाइड कर सके, जो कि उसके लिए टेस्ट की गई हो प्रॉपर। तो ऐसे बहुत सारे काम जो हमारे ये हेल्थ केयर प्रोफेशनल कर रहे हैं, उनके लिए हमने आज सम्मान में एक नया अवार्ड शुरू किया है जिसका नाम है द गार्जियन ऑफ हेल्थ अवार्ड और उनमें से कुछ लोगों को आज हम IHW काउंसिल की तरफ से एज अ रिस्पेक्ट टू देयर वंडरफुल वर्क, एग्जाम्पलरी वर्क जो उन्होंने किया है इतने दिनों में और आगे भी करते रहेंगे, उसको ध्यान में रखते हुए, उसको अप्रिशिएट करते हुए द गार्जियन ऑफ हेल्थ का अवार्ड आज से शुरू किया है। और मैं आपसे रिक्वेस्ट करूंगा कि पहले अगर वो होता तो आपके शुभ हाथों से लोगों को वो अवार्ड मिलता, लेकिन हम ऐसी कंडीशन में हैं कि वो नहीं हो सकता, तो उसे हम इंटरनेट के थ्रू वेब कॉन्फ्रेंस में ही प्रेजेंट करेंगे। तो आपसे ये निवेदन है कि अगर आप सहमति दें उस अवार्ड को प्रेजेंट करने के लिए और जो है ये उनके और ऑल्सो उनके अच्छे काम के लिए जो ये डॉक्टर्स कर रहे हैं उनको और इनकरेजमेंट प्रोवाइड करें जिससे कि ये हेल्थ की जो का यज्ञ है वो चलता रहे। तो माननीय मंत्री जी, आपका की अनुमति कि हम ये अवार्ड आगे प्रस्तुत कर सकें।
मैं भी कमल जी,
जी सर,
कमल तो जो अवार्ड देने के संबंध में जो आपने बताया है गार्डियन ऑफ
हेल्थ,
गार्डियन ऑफ हेल्थ अवार्ड जो आपने बताया बहुत अच्छा है, लेकिन अभी अवार्ड तो ऐसा हम हाथ से नहीं दे सकते क्योंकि हमें किसी के हाथ से नहीं लगाना किसी के हाथ से हाथ नहीं है लगाना, हमें किसी के हाथ से हाथ नहीं है लगाना, तुमको कोरोना को यहाँ से जल्दी भगाना। कोरोना को जल्दी भगाने के लिए हाथ से हाथ नहीं लगाना है। लेकिन अगर अवार्ड ऐसा ही अगर देना है तो अभी अवार्ड तो देना है। अवार्ड क्या करना है कमल जी? मैंने अवार्ड तो देना है क्या? अवार्ड क्या?
हाँ नहीं, आपकी बस अनुमति, आप 5 मिनट हमारे साथ रुके रहें। मैं अपनी कलीग अनीसा को बोलूंगा, वो जो हमारे सम्मानित डॉक्टर्स को हम आज अवार्ड दे रहे हैं उनका नाम लेंगी, हम स्क्रीन पे उनका सर्टिफिकेट दिखाएंगे और आपका की शुभकामनाएं चाहिए और आपका सहयोग चाहिए कि आगे, और आपका इंकरेजमेंट चाहिए कि लोग आगे आगे भी ऐसा अच्छा काम करते रहें और देश को कोरोना ही नहीं, ऐसी सारी बीमारियों और ऐसी बहुत सारी पैंडेमिक जो शायद आगे फ्यूचर में आएंगी उनसे बचाते रहें। अनीसा, can we begin the awards?
Yes, and just like Kamal said, we would like to honor the contribution of India's healthcare professionals by awarding them for their inspiring leadership and vision. The IHW Council is proud to present the Guardian of Health Awards to our healthcare heroes who inspire all the team members to give their best and serve the society. So we'll start with the first award, and the first award goes to Dr. Hema Divakar, the founder and medical director, Divakar Specialty Hospitals, Bengaluru. Dr. Divakar is the founder and the director, medical director at Divakar Specialty Hospital in Bengaluru, which is also the first private hospital in Karnataka to obtain an ISO 9 hospital certification. A women's health champion, Dr. Divakar has keen interest in high-risk pregnancy and have established specialty clinics for recurrent pregnancy loss, fetal malformation, diabetic obstetric clinic, myoma clinic, as well as women clinic. So a big round of applause for our first winner, Dr. Hema Divakar.
बहुत बहुत धन्यवाद, शुक्रिया, thank you very much. And I must say, as how, you know, in the whole scheme of things, this is Kamal ka Kamal. Thank you very much.
Kamal ka Kamal.
Congratulations to you, ma'am. We are very happy that you are with us, and we are very grateful to you for all the work that you've done and the lovely quizzes that you did during the week to increase the awareness amongst all people about healthcare issues. Congratulations to you. Our next award winner is Professor Devashish Danda, the founder, Clinical Immunology and Rheumatology, CMC Vellore, and President-elect Asia Pacific League of Association of Rheumatology. Dr. Danda is a well-known name in the field of immunology and rheumatology. He's the founder of the Clinical Immunology and Rheumatology Department at CMC Vellore and the President-elect of the Asia Pacific League of Associations of Rheumatology, or Rheumatology. If Dr. Danda is there, I would request him to say a few words. I think Dr. Danda is not with us right now, but when he does join us, we will ask him to speak about his experience.
Dr. Danda is, I think, Dr. Danda.
Yes, thank you. Honorable Minister, Mr. Kamal Narayan and your team of Indian Health Wellbeing Council. I'm deeply touched and humbled by this award for recognizing the life behind us and the life ahead of us, which is dedicated for people. Right from childhood, I think human beings never do not appreciate any encouragement. The encouragement is always good, and I'm very happy that at this stage of life you have recognized my work. Thank you very much for this. I would also like to say that the doctor's role in society is to connect to patients as a full human being, not just as a disease or a body part. And in this respect, the connection between the different components of society and doctors, which was getting broken down, I think you are making great effort to join that. So thank you very much, and I'm very honored that the Honorable Minister is here, and in presence of him, I got this award. And thank you and congratulations to all the other awardees as well as the participants here. Thank you, Mr. Kamal, and thank you, the viewers. I'm very humbled and honored. Thankful to you.
Congratulations, Dr. Danda. It was wonderful listening to you during the Gratitude Week, and we wish you all the very best. Our next winner is Dr. Shrutin Bajaj, founder and director, Ujala Signals Hospitals. He runs a chain of healthcare facilities across North India, combining his medical skills with that of an administrator. Dr. Bajaj was among the Entrepreneur Economic Times and was chosen as the Healthcare Leader of the Year in 2017. He's on the board of a number of prominent NGOs as advisor to the health programs. Congratulations, Dr. Bajaj.
थैंक यू वेरी मच. बहुत बहुत धन्यवाद आपका, कमल जी, अनीशा जी और आपकी पूरी टीम. बहुत बहुत धन्यवाद मंत्री जी. आप सबकी प्रोत्साहन से और आप सबके ही जोश से मुझे जोश मिलता है, और आई एम श्योर कि हम जल्दी ही कोरोना को हरा देंगे. इतनी अच्छी टीम और इतने सब लोग इस बैटल में हमारे साथ हैं, तो कोई डाउट ही नहीं है कि हम जल्द ही जीतेंगे. बहुत बहुत धन्यवाद.
Congratulations, Dr. Bajaj. Our next winner is Dr. P.P. Mohanan, President-elect, Cardiology Society of India and the Director and HOD Cardiology of Westport High-Tech Hospital. Dr. Mohanan has been actively involved in medical associations and societies throughout his career and participated in several clinical trials and research studies. He has many articles and papers to his name in peer-reviewed journals over the years. In 2008, he received the Distinguished Service Award from the then President, Dr. APJ Abdul Kalam. Congratulations, Dr. Mohanan. We are very happy and grateful that you're with us today.
Thank you. Thank you very much. As I was saying earlier, traditionally we doctors don't have to risk our lives to save patients' life. But Corona has brought that stage, and I take this award on behalf of all those healthcare warriors who lost their life and they're still fighting. And you have, in the bargain, IHW has also tried your best to improve the public trust in the doctors, which is possibly a need of the hour. And thank you very much for all your effort. Thank you, Kamal and others.
Thank you, Dr. Mohanan. We really do appreciate your kind words, and this is actually our effort to ensure that this gratitude rings in our hearts forever for doctors for the exemplary work being done by them. And the award is also in recognition for the extraordinary leadership and dedication. Our next winner is Dr. Rishikesh Pai, Medical Director, Bloom IVF. Dr. Pai is a specialist based in Mumbai and is highly respected name in the field of gynecology and obstetrics. At a time when IVF was still in its nascency in India, Dr. Pai did his fellowship from Australia and set up the first IVF center in Mumbai in 1991. He has performed over 10,000 test tube baby procedures and also introduced many path-breaking and pioneering techniques in the field of assisted reproductive technology.
Thank you for this award. I'm very overwhelmed, and I would like to thank the minister. It's a great pleasure, sir, to be in your presence, and Kamalji and Anisha-ji and all, especially my friend, both the Diwakars are here. And so, I want to just say that IHW it has focused so much of health problems in our country. And the most important thing that this COVID and this 1 month, we have realized that the two most important securities that we need to tackle is the external security and the internal security in form of health security. So these are the two securities we must spend maximum money in the future, build our infrastructure so that we can be stronger nation. And we all will have to work on it. The next 3 years are going to be the building time for our whole country again. It's a mammoth task, and I'm sure that we all will do it together. Thank you.
Congratulations, Dr. Pai. Our next winner is Dr. Sanjeev Navankul. He is the Managing Director and CEO of Bharat Serums and Vaccines Limited. Last month, the company received approval from the Drug Controller General of India, DGCI, to conduct phase 3 clinical trials on existing ulinastatin for mild to moderate acute respiratory distress syndrome, ARDS patients with COVID-19. It is certainly a very encouraging development for not only India, but perhaps for all people in the world who must be praying for a lasting solution to the coronavirus. Congratulations, Dr. Sachin Navangal.
Thank you, and really appreciate you trying to recognize healthcare workers all throughout in the country. I think everybody is fighting a single war, and we all need to be united in this, and we will make our contribution. I salute all the doctors who are really on the front end of everything, and really appreciate the kind of effort they're taking to save patients every day. Thank you, Minister, for being here. And ISW has become like a movement, since the time I've seen it. It's no longer just a event story, but it's about how much they have created a movement in healthcare. So thank you very much, Kamal and team.
Thank you, sir.
The next award goes to Arunima Patel, founder and managing director of iGenetics Diagnostics. Arunima Patel is a young, dynamic, and entrepreneur featured in Forbes India's 2018 W Power Trailblazers. Founded in 2013, iGenetics Diagnostic is one of the companies that developed the RT-PCR test kits with 100% concordance. iGenetics uses molecular diagnostic testing to help identify biological markers in the person's DNA that can help doctors identify the cause of the infection in patients with septicemia in less than 4 hours. Congratulations, Ms. Patel.
I think she had joined some time back, maybe some connection problem. We can go ahead with the other award.
All right. We are very happy to award Professor M.V. Padma Srivastava, the head of Neurosciences Center at All India Medical Sciences, New Delhi, for her contributions in the healthcare sector. Her primary areas of interest include stroke, vascular dementia, and multiple sclerosis. She actively participates in epilepsy program in AIMS and initiated the hyperacute reperfusion strategies, including thrombolysis program for acute ischemic stroke, recrescent code red. Congratulations, Professor Srivastava. Okay, I think ma'am is not with us, but we will move on and announce the name of the others who have been awarded for their contributions. The next award goes to Dr. Sundeep Gupta, Director, Advanced Center for Treatment, Research and Education in Cancer and Professor of Medical Oncology, Tata Memorial Hospital, Mumbai. Dr. Sundeep Gupta is Director of Advanced Center for Treatment, Research and Education in the Cancer and Professor of Medical Oncology, the Tata Memorial Hospital. Is Dr. Gupta with us?
Dr. Gupta seems not to have got the time to join, so please go ahead. We will share this award with him later.
Sure. The next award goes
I think Honorable Minister will have to. Anisha, we can continue with our award. I think Honorable Minister will have to maybe take care of his other work also. And I also heard that it is actually his lunch time, and he has pushed our event within his lunch time. So I would request that we will continue with the award. We have got his graceful presence, and also his well wishes for all our doctors and healthcare professionals whom we are recognizing for their exemplary work. And so thank you so much, Honorable Minister. Before you part ways with us today, I would request if you would like to say a few words and to congratulate the.
I congratulate all the awardees because all the awardees are also very hard workers. There are many awardees are from the doctors. Doctors are many awardees are there. And other institutions, those who are running the institution, they are also got the award. And therefore, this award is also very important award. And Kamal Narayan and has given the award to all the doctors and other activists also. Therefore, I congratulate all the awardees. And this award is also very important award. This coronavirus is also very dangerous. And in this time, this award has won from Kamal Narayan. And thank you very much. Congratulate all the awardees. Jai Bhim, Jai Bharat. And I have given the slogan, Corona Go, on 20 February 2020 in India, near India Gate, the Gate of India, and near Taj Mahal Hotel. That time my slogan was Go Corona, Go Corona, Corona, Go Corona, Go. And now my slogan is No China, No China, China, No, China, No. This slogan was given by me at that time. Therefore, I'm not going to take more time. But thank you very much. All the awardees, I congratulate all the awardees. Jai Bhim, Jai Bharat.
Thank you so much, Honorable Minister, for your encouraging word and graceful presence. Thank you so much. Yes. Anisha, please.
Yes, we will resume with the awards that we are presenting to healthcare workers for their exemplary contribution to the society. We would like to present the next award to Dr. T.S. Clare, the chairman of PSRI Heart Institute. Padma Bhushan, Dr. Clare is the chairman of PSRI Heart Institute, and he heads the electrophysiology program. He's an expert electrophysiologist. Dr. Clare has many firsts to his credits. He's established the first dedicated electrophysiology department in India at Escorts Hospital. He also conducted the first implant of ICT, a heart failure device and a combo device in Southeast Asia. Congratulations, Dr. Clare.
Thank you. Thank you, Kamal, Narayan, Himani, and Anisha and Nikki for a very, very well thought of gratitude week. This has never been done before actually in our country, and I must congratulate the whole team, the whole idea, the whole thinking. See, the people of India should realize this 1300 million, 130 crore, that there is a time when every mandir, every gurdwara, every church close their doors to the people. But healthcare people are only people in this difficult time where the doors were always open. So people should, I think, understand the value the healthcare workers are to any society. And out of healthcare workers, in fact, I would give number one gratitude to Safai Civics, the people who clean the floors, who clean the dirt in the hospitals and other places in the society. And number two, most important, which I think you people have not taken, is the role of nurses. The doctors come third, they don't come first. The doctor's role is third. So I would rather appreciate you that in the future gratitude week of healthcare workers, these people who clean Safai Civics and nurses, they should be given prominence and they deserve our gratitude more than anybody else. Still, nonetheless, I think very good effort, and our help whatever you want to plan in the future will always be given. Thank you very much.
Thank you so much, Dr. Claire, and definitely you highlighted very well that even those sweepers and those cleaning staff who make sure that we get a clean environment for recuperating to which can support our health. They definitely deserve our respect and our gratitude. And this entire gratitude week was for everyone, for all millions of people who work in at any part of healthcare system from at any level. So I'm sure the next time when the physical conditions will allow, we will have more participation from them. Thank you. Anisha.
Yes, so we are very grateful for everybody who has taken the time to join us here. This gratitude week is definitely important because this is a start where we will remember the contributions of doctors for the longest time ever. We need to now step up and thank them to doctors, to nurses, to paramedics, to everybody who is making a contribution there. Kamal, would you like to request somebody to share their experiences with the Gratitude Week and their suggestions to improve further if they have any?
Yes. So thank you so much, Anisha. And this was just an effort to appreciate some of the work of the our doctors through this the Guardian of Health Award. And we look forward that in future we will be able to recognize and appreciate more people who are working really hard in this line. I would just like to mention that some of our more speakers who have supported this 60-year-long endeavor has joined. We have been joined by Professor Pankaj Gupta. He's the president of IIHMR. I can see Professor Pankaj is with us, and he has been a big support for us to put together this event, and always been a great champion of mental health and well-being. I see Dr. Sonia Malik has also joined. So Dr. Sonia Malik, thank you so much for joining. And I would request, so the awardees got a chance to share their views, but the other speakers who have joined, who were with whose support we were able to put together this event, I would request them also to share a few words of their how did they feel, and also we will be very happy to take this initiative and movement forward. We are of very deep belief that this gratitude is not enough for a day or a week or a month or a year. It has to go to our value system, and I'm sure that we will be able to, with the support from all of you, will be able to create a better social, emotional, and supportive environment around our doctors. So I would request Dr. Dhamija is there. So Dr. Dhamija, your few words for us too, because as we will be parting today, it's been wonderful 7 days, and I heard your great experiences and your views for Indian healthcare. Just a few words if you would like to share.
Thank you, Kamal, for inviting us and having us during this whole week. And it was a wonderful experience of listening to various speakers of different parts of the healthcare system. So what you are actually doing is a great advocacy. So in the Western world, people have got the advocacy groups to mobilize and lobbying to the policymakers and the parliamentarians or the member of parliaments in US at the Capitol Hill, and other people who are the lawmakers in different states. So this is a great movement, advocacy movement for the cause of healthcare, sensitizing the policymakers and the people who matter really in shaping our healthcare system in the country. I am sure that this step would go in a long way to strengthen and sustain our primary as well as secondary healthcare system, so that we are better prepared for the next epidemics, which will happen. I'm sure this is not the last pandemic. So we are going to see many more pandemics, and we are going to see resilient healthcare system from India. And we have learned a lot of lessons, and recognizing these healthcare heroes or the workers who have done their bit to save the human race. I think it's a wonderful step, and I must congratulate you and Himani and Anisha and other team members for organizing a mammoth event of 60 hours. It's not as simple as it looks like. A lot of labor must have gone, a lot of hard work must have gone in planning and then executing this program. Congratulations to all to you once again, and please carry it up and bring it forward and forward. Make it an advocacy group to raise the voice of millions of people to the concerned policymakers and the lawmakers. Thank you very much.
Thank you so much, Dr. Damija, for your kind word. We will try our best that what we can do to give maybe a stronger voice for these millions of people, but their work speaks itself. We will do our humble contribution, whatever we can do. Professor Ravi Kant is with us. He's the director of HIMSS. Professor Kant, are you listening? So if you would like to share your few words on it. Professor Ravi Kant is there? Okay, I think then I would request all of you who are with us, if you can switch on the video so that I can identify that who is with us and who is not with us, so that at least I can identify. Dr. Sonia Malik, you have been a wonderful advocate of women's health, and I love the way you feel that technologies, IVF, and all these things comes later. God has itself given all possible support systems. Dr. Sonia Malik, would you like to say a few words? Dr. Malik, you. On mute.
I'm unmuting. Yeah, I hope you can hear me now. I just want to say a very big thank you to you, Mr. Kamal, and to your team, because basically, like Doctor had just mentioned, this is probably the first time that people other than the doctors have actually have been recognizing us. So doctors are generally not seen on podiums other than what they are, where they are. And this is probably the first time that non-medicos have actually given a chance to the doctors to speak out. Not only speak out, you have actually awarded the ones who deserved it. And therefore, this is a very big movement. And I think you've done an exceptional job. We all are very, very grateful to you. Thank you so much for having all of us here all these 7 days, recognizing the job of doctors and giving them the kind of encouragement that they've always needed. And also giving the right perspective to the society about what doctors are. So I think it's a very good beginning, and thank you so much for shaking hands with us. Thank you so much.
Thank you so much. Thank you so much, Dr. Malik. And we will keep doing whatever best we can do with our limited capacity. Professor Pankaj Gupta, a few words from you. Professor Gupta, please unmute yourself, please.
Am I audible?
Yes, sir. Please.
Okay. Thank you. And I think it was a great initiative you have taken, Kamalji, and your whole team. I want to really congratulate you. And also the way you have made sure asking very, very relevant things, relevant issues, and also choosing a wonderful panel. And the people who have really made a big difference. So my heartiest compliments to you, and also choosing this whole domain around the gratitude, which is also very, very touching for people. But as I've been sharing with you in my panel also, I shared that the biggest thing is when somebody's going ahead without any reward or any punishment, but with a swantaya sukhaya. Even they know that seva is my dharma, and my nishkam karma is there. So even if somebody appreciate or doesn't appreciate, and that is what all the time the doctors and medical people, they are always driven by that. So the way you have touched their lives by offering the gratitude is very, very good thing. But I deal with so many healthcare professionals because my university is the top university in the area of healthcare research. So we have also been advising the Rajasthan government on COVID and all. So I'll be very interested if there are any research themes. If there is all the things which you have discussed, you want to come out with any working papers, any monograph or a book. I have got a wonderful faculty team and research capability. We were like set up 35 years back with a collaboration of Johns Hopkins, which is a #1 in the world. So I'll be very happy to contribute. And once again, my heartiest compliments to you and your team. Namaskar.
Thank you so much, Professor Gupta, and definitely you are our important partner. We will be doing a lot of things together. And I actually propose that the next Gratitude Week in July 1 to July 7 should be hosted at IIHMR University's wonderful sprawling campus in Jaipur.
We'll be very interested.
And we should make sure that all our healthcare leaders, professionals, and important stakeholders come down to that university and see your hospitality.
Sure, it is taken as granted fully. It will be our honor indeed.
Thank you so much. Thank you so much for accepting this proposal. Thank you so much. So. Now I would request Mr. Prabhat Sinha is also with us. He's heading the public affairs portfolio of Novartis. So, Mr. Sinha, would you like to say a few words?
First of all, Kamalji and the entire ISW team, I was thinking yesterday, in fact, that what you have done is real. And in real term, I will tell you how this real is, REAL. So the first R belongs to the recognizing, and acknowledging and appreciating the real fighters. That is the R stands for. And what you have done is whether it is healthcare doctors, patient advocates, nurses, for everyone, saying a gratitude itself is a big thing. So you started with that R, which is recognizing. The second is E, which is empowering. You also brought these people on a platform and allowed them to speak. And I think the process of empowerment, I feel, that has started in this, last 7 days through this conversation that has happened. The third A of real A is the authentic. And I think where I have seen many events, but it also takes a lot of time and effort to bring authentic people on panel, authentic people to be awarded. And I think a lot of credit goes to the entire IHW team to get that authenticity right. So that is the third A of real. And the L is the listening. What you all have done is you listened. You allowed everybody to listen. The whole country was listening. Sometimes there are a lot of conference which happens one way, but there are conferences where you don't get bored. I myself, as at least 3 to 4 days, have seen a lot of sessions, and you feel that your questions are being answered because of the kind of the panel member, the way it is being moderated. So even if you're not asking your question, somebody is answering those questions. So in true sense, it has been a real effort. And you all must be very proud. I think the kind of distinguished faculty and the people who have joined, it made all look very, very real. So a huge applaud, a gratitude from, I think, from on behalf of all the speakers, all the people who have listened to that, to the entire IHW team and Kamalji team. Thank you.
Thank you so much, Mr. Sinha. Very encouraging, and we will try to be more real maybe in future. So thank you so much. We also have Mr. Durga Prasad from Dabur India Limited, and he also helped bring that perspective of the whole Indian medicines and how, and they also play a wonderful role. India has very broad diversification, and then a lot of our people still get a lot of support from traditional medicines. So Dr. Durga Prasad, would you like to share a few words?
Yeah, thank you, Kamalji. Thank you very much. First of all, I would like to congratulate the entire IHW Council team, starting from you, Kamalji, then Viplavji and Anishaji, Himaji, to conceive the idea of celebrating the gratitude for a week. Even for the week is very short to celebrate that gratitude, but doing the gratitude for the healthcare workers is a huge. That itself is a very great job, and compiling the entire thing, conceiving the idea, bringing all the professionals, as Dr. Clergy told, and we doctors said, you have brought exceptional professionals onto a platform. where everyone spoke very professionally and answered many queries. That has never happened. Even I have been part of many webinars and many seminars. Such kind of gathering on the fifth day, where the healthcare and the medical field is there, the professionals like from oncology, from dentistry, from Ayurveda. So there is a huge conglomeration of various medical professionals coming onto a single platform, sharing their ideas to fight the corona-like infections. It's a huge job. Congratulations to you all. And I thank Honorable Minister Shripad Yasho Naik ji and Ramdas ji for standing with us in fighting the corona-like conditions and giving us a moral boost to continue the momentum. In fact, the panel discussions and the various forms we have on the fifth day, many of the Ayurvedic practitioners who have heard very satisfaction for the kind of platform we have given to the doctors to share their views. For that, I must thank you and the entire team for giving us an opportunity. Thank you very much and keep doing the same good work, sir. Thank you.
Thank you so much, Dr. Prasad, and your support and your the knowledge and then the kind of Indian traditional medicine practitioner you brought on this this platform was very encouraging and insightful. So I think I just saw Dr. Ekta Bajaj also was here. Dr. Bajaj, would you like to say a few words?
Yeah, thank you, Kamalji. First of all, I would like to congratulate you for a very, very successful gratitude week. And I think this is for the first time. And my best wishes to you. And I think it is very, very encouraging for doctors. And their good work has been brought up in front of everybody. It is very encouraging. Plus, you have discussed, there has been discussed a lot of things like deficiencies in our present healthcare system, lot of panel discussion. It will definitely help us to improve our present health system.
Thank you so much, Dr. Bajaj. And you also brought a wonderful perspective about your passion towards women care and health. I believe it had been a wonderful 7 days. We put a lot of effort. I request Himani to switch on her video. She has been one support, bringing together everyone. So I think a round of clap for Himani for putting so much of work, and at the same time the entire IHW team. A lot of them are working behind and continuously for 7 days. But this is nothing. I told them that this is nothing. When I hear Dr. Sachin Bajaj, the Corona warrior, working in a oven-like temperature for maybe 10 hours in a continuity without even attending to the call of nature, our work is absolutely, I think, negligible what we did. So thank you so much for all your encouragement, your support, and this is just a beginning which we have made, and we want to make this movement everyday movement, and which may culminate in this 7 days of gratitude week every year. And there are so many influential leaders of healthcare, and I would request all of them that whatever way they can promote this gratitude week among their communities, among their fraternity, so that we are able, and we will definitely also write to the government and also WHO over the period to recognize it as a these 7 days, and not that ISW's effort, but these 7 days at least should be dedicated for our healthcare professionals from across the board. So thank you so much for all your effort. I'll just, Dr. Hema Devakar wanted to say a few words. So I'll request Dr. Hema Devakar, and after that, I would request my team to play the video of our 6 days of glimpse. So if, some of them might have not seen. And before that, the anthem which we created, and I'm thankful to Padmajit Sarawat also, who created a video, that anthem. And it touched to my heart. I hope that it would have touched to, it is kind of echoing in my mind all the day. So thank you so much. So we'll go to the anthem and then the glimpse video, and then we will continue our the performances. So you have seen that we engaged with the school children, with the society, with the artists, with everyone to come and share their express their love and their gratitude. So Dr. Hema Devakar wanted to say.
Yeah, Kamalji, by now, over the week you would have realized that I speak a lot, but the way you put the googly of the award, it was so overwhelming, because the Gratitude Week itself is a fantastic idea, and suddenly you decided to give an award which really rendered us speechless. That is why I said Kamal ka Kamal, because that is what it has been, the experience through the week, because Rishikesh, Sonia, Meera Agnihotri, Ekta, everybody of us in the own women's healthcare circle will recognize that we think we are doing on our own, but just imagine if all of us get together, how much more we can do. That is the broad sense that you have exposed us to, and I really sincerely thank you for this, because for yesterday, for the first time when I heard Pankaj saying Swanta is okay, I went back on the Facebook and then saw, what did he say? What did he say? What was that word? That you reflect back with your own satisfaction. That is true. But some gratitude coming our way, it really meant very differently, and it meant a lot, and it has revoked, resolve to do more with greater responsibility, because we have seen what a difference that unknowingly or knowingly we have made to make this world a better place. So one last time, to yourself, to your entire team, Himani, Vivekananda, Rajiv, Anisha, who all have become a part of our extended family, thank you very, very much.
Thank you so much. You are the family for us also. All of you, thank you so much. Now I'll sign off, and looking forward to meet you all very soon, maybe physically when this, the environment allows. Till then, we will keep continuing connecting with this medium. Thank you so much for your support, and we are really humbled. Thank you so much.
Thank you. And we have a few artists who also want to render their thank yous to the doctors, to our heroes, the healthcare professionals who are doing such a great job. Through their own medium, we have a dance performance by Kavita Satish Kumar, expressing gratitude for our healthcare heroes.
जिस मंजर से हम गुजर रहे सब डरे हुए और सहमे हैं जिस मंजर से हम गुजर रहे सब डरे हुए और सहमे हैं कितनों ने जान गवा डाली कितने अभी नासाज पड़े हम घर में हैं महफूज अभी कुछ है फर्ज पे टिके हुए कुछ डटे हुए हैं खाकी में कुछ सफेद कोट में जूझ रहे सड़कों पर भटक रहे है वतन जिनके कांधों पे है जतन जिनके हाथों में है अमन जिनसे बागों में उनको नमन
Satish Kumar, to our healthcare heroes who are at the forefront fighting the unseen enemy, COVID-19, and giving it the best shot. Thank you so much for all your efforts and an awesome performance by Kavita Satish Kumar, showing gratitude to our healthcare heroes. We also have a band joining us now for their own version of Thanksgiving. We have Parag Jain and Manav Doshi of Dastak the band joining us.
Thank you.
I'll hand it over
Thank
to
you so
both of
much.
you.
Hi.
Hi.
Are we audible?
Yes, yes. Please go ahead.
Okay.
So hi, before starting, we would just like to introduce ourselves. He's Parag Jain. I am Manav Doshi. I'm the guitarist and backing vocalist of the band. He's
And
Parag Jain.
I'm in the lead vocalist of the band.
So before talking anything more, we'll just give our first song to you.
कह दरियाओं को आर पार आशा है, कोई देशों को आर पार, कर दरियाओं को आर पार आशा है, तूफानों को चीर दे, मंजिलों को छीन दे, आशाएं खिले दिल की, उम्मीदें हंसे दिल की, अब मुश्किल नहीं कुछ भी, नहीं कुछ भी, आशाएं खिले दिल की, उम्मीदें हंसे दिल की, कोई मुश्किल नहीं कुछ भी, नहीं कुछ भी, वो उड़ जाए लेके खुशी अपने संग तुझको वहाँ, जन्नत से मुलाकात हो, पूरी हो तेरी हर दुआ, आशाएं खिले दिल की, उम्मीदें हंसे दिल की, अब मुश्किल नहीं कुछ भी, नहीं कुछ भी. Thank you so much. So it was a tribute to all the doctors who have worked so hard to fight for the COVID-19. Thank you so much, and we would like to dedicate this song to all the doctors. Okay, moving towards, so we would like to sing a song, a very famous medley by Lucky Ali, and it's dedicated to all the Lucky Ali fans out here. Where I know we lost the will, where I know we lost the will, where I know we lost the will, where I know we lost the will. क्यों चलती है पवन, क्यों झूमे है गगन, क्यों मचलता है मन, ना तुम जानो ना हम, ना तुम जानो ना हम। ओ, क्यों आती है बहार, क्यों लुटता है करार, क्यों होता है प्यार, ना तुम जानो ना हम, ना तुम जानो ना हम, ना ये मदहोशियाँ, ये तन्हाइयाँ, तसव्वुर में है किसकी परछाइयाँ। ला 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 ला, ये भीगा समा उमंगे जमा, मुझे इश्क ले जा रहा है कहाँ, क्यों गुम है हर दिशा, क्यों होता है नशा, क्यों आता है मजा, ना तुम जानो ना हम, ना तुम जानो ना हम, ना तुम जानो ना हम, ना तुम जानो ना हम। शाम सवेरे तेरी यादें आती हैं, आके दिल को मेरे यूं तड़पाती हैं। ओ सनम मोहब्बत की कसम, मिलके बिछड़ना तो दस्तूर हो गया, यादों में तेरी मजबूर हो गया। ओ सनम उन यादों की कसम, Okay, so the next song is by Mohit Chauhan.
आपको ऑडियो कंप्लीटली क्लियर है?
I guess the audio.
Yes, it's fine. Please continue.
दिल का दरिया बह ही गया, इश्क मुसाफिर बन ही गया, खुद को मुझे तू सौंप दे, मेरी जरूरत तू बन गया। बात दिल की नजरों ने की, सच कह रहा तेरी कसम, तेरे बिन न लेंगे एक भी दम, तुझे कितना चाहने लगे हम, तेरे साथ हो जाएंगे खत्म, तुझे कितना चाहने लगे हम। बात दिल की नजरों ने की, सच कह रहा तेरी कसम, तेरे बिन न लेंगे एक भी दम, तुझे कितना चाहने लगे हम, तेरे साथ हो जाएंगे खत्म, तुझे कितना जाने लगे हम। Thank you. Okay, so the next song is a prayer for all the people who are suffering from COVID to get well soon. So this song is by Arijit Singh. किससे पूछूं ऐसा क्यों बेजुबां सा ये जहां है, खुशी के पल कहाँ ढूंढूं बेनिशां सा वक्त भी यहाँ है, जाने कितने लबों पे गिले हैं, जिंदगी से कई फासले हैं, बस जीते हैं सपने क्यों आंखों में, लकीरें जब छूटे इन हाथों से यूं बेवजह, जो भेजी थी दुआ वो जाके आसमां से यूं टकरा गई के आ गई है लौट के सदा, जो भेजी थी दुआ वो जाके आसमां से यूं टकरा गई के आ गई है लौट के सदा। ना 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 रे, ना 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 रे, सांसों ने कहा रुख मोड़ लिया कोई राह नजर में ना आए, धड़कन ने कहा दिल छोड़ दिया कहाँ छोड़े न जिस्म निसाए, यही बार बार सोचता हूँ तन्हा मैं यहाँ, मेरे साथ साथ चल रहा है यादों का धुआं, जो भेजी थी दुआ वो जाके आसमां से यूं टकरा गई के आ गई है लौट के सदा, जो भेजी थी दुआ वो जाके आसमां से यूं टकरा गई के आ गई है लौट के सदा। Thank you so much.
Next song is one of my favorites, also from Arijit Singh. Guys like it?
Hey, 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 aha. Hey, 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 aha. जिया जाए ना जाए ना जाए ना ओरे पिया रे, जिया जाए ना जाए ना जाए ना ओरे पिया रे, पिया रे, मुस्कुराने की वजह तुम हो, गुनगुनाने की वजह तुम हो, जिया जाए ना जाए ना जाए ना ओरे पिया रे, जिया जाए ना जाए ना जाए ना ओरे पिया रे। धूप आए तो छाँव तुम लाना, ख्वाहिशों की बारिशों में भीग संग जाना, जिया जाए ना जाए ना जाए ना हो रे पिया रे जिया जाए ना जाए ना जाए ना हो रे पिया रे
लैपटॉप से खींच लो तो पता चले कि
Thank you, Parag, and thank you, Manav, for your beautiful rendition. We are very grateful that you took out the time and entertained our participants, and also rendered your thanks to all the doctors who have gathered here and healthcare professionals who have gathered here to celebrate the Gratitude Week. Thank you so much to both of you, and I would also like to thank all the doctors and the healthcare fraternity members who have joined us through this week and celebrated with us this Gratitude Week. This is our endeavor to ensure that the selfless work and the dedication shown by doctors, nurses, and the entire healthcare ecosystem doesn't go unnoticed. We want to thank you from the bottom of our hearts forever for the great work that you're doing, whether it is fighting the corona pandemic, whether it is improving our healthcare facilities, for giving us the healthcare that we require. We thank you all. And thank you all for joining us during the Gratitude Week.
Thank you so much, IHW Council, for having us over here. And thank you so much. And you guys are doing a great job. Thank you so much for having us over here.
एंड ऑल्सो जो भी देख रहा है मैं उनको बताना चाहूंगा IHW ने नया पेटिशन स्टार्ट किया है वो जैसे वॉर मेमोरियल बना हुआ है वैसे हेल्थ केयर वर्कर्स के लिए भी एक मेमोरियल बनवाना चाहते हैं दैट दे वांट टू रिक्वेस्ट दिस टू गवर्नमेंट सो लिंक नीचे डिस्क्रिप्शन में पेस्ट किया हुआ है आप लोग जरूर उस लिंक पे क्लिक करें और पेटिशन को साइन करें
Please do sign the petition. Thank you so much for having us over here. Thank you.
Thank you. And yes, the reminder for signing that petition, for showing our gratitude to all our healthcare heroes, that is something that you must all do. Thank you all for joining us during the Gratitude Week.
Dr. Meera, you want to say something, ma'am?
I just wanted to extend my heartfelt gratitude to all those friends who have shown gratitude to the doctors. We are felicitated, we are feeling very, very juvenile, we are feeling whatnot. So I extend my heartfelt gratitude to one and all. And lovely song. I really enjoyed the program so well, very nicely arranged. Thank you very much, IHW, once again.
Thank you so much, ma'am.
In last, we would like to pay a tribute to all the doctors in this song. टूटा टूटा एक परिंदा ऐसे टूटा कि फिर उड़ ना पाया लूटा लूटा किसने उसको ऐसे लूटा कि फिर उड़ ना पाया गिरता हुआ वो आसमां से आकर गिरा जमीन पर ख्वाबों में फिर भी बादल ही थे वो कहता रहा मगर के अल्लाह के बंदे हंस दे अल्लाह के बंदे हंस दे जो भी हो कल फिर आएगा अल्लाह के बंदे हंस दे अल्लाह के बंदे हंस दे जो भी हो कल फिर आएगा खो के अपने पर ही तो उसने था उड़ना सीखा खो के अपने पर ही तो खो के अपने पर ही तो उसने था उड़ना सीखा गम को अपने साथ में ले दर्द भी तेरे काम आएगा अल्लाह के बंदे हंस दे अल्लाह के बंदे हंस दे जो भी हो कल फिर आएगा अल्लाह के बंदे हंस दे अल्लाह के बंदे हंस दे जो भी हो कल फिर आएगा अल्लाह के बंदे हंस दे जो भी हो कल फिर आएगा Thank you so much.
Thank you, Manav. Thank you, Parag, and thank you to all our participants, healthcare heroes, for showing us their solidarity, for being with us, for speaking their minds. We will continuously endeavor to show our gratitude to you for all through the day, and we will again request the government to come up with a memorial for healthcare heroes. So do sign in that petition so that there's more awareness and the government favorably reacts towards this demand. Thank you all for joining us.
So before going, I'd just like to thank everyone for being here watching us. और उसके अलावा अगर आप लोगों को हमारा गाना हमारी आवाज़ पसंद आई तो आप लोग हमें फॉलो कर सकते हैं फेसबुक इंस्टा मेरा हैंडल है मानव दोषी म्यूजिक स्पेलिंग MANAVDOSHIMUSIC and Parag Jain official and Dastak the band. Thank you so much. Thank you.